Testing, testing. Yeah, I can hear myself. Yeah. Is it okay through the headphones, do you think?
Yeah, it's good. If you would lay the mic on your, I don't know the English, but you can, I show you. You can lay it here, so you don't have to think about, do I have it in the right way? So just lay it down here, so you don't have to think about it and can concentrate on that what you would like to say.
Okay.
Thank you.
Like that?
Yeah.
Okay. Is that a trick of the trade? On? Everybody got their headphones on? What number am I? Good question, actually. 0. I have no number. Does it all sound okay? Let's give a few minutes for people to set them up. Okay. Perfect. So perhaps we can get started. I would like to start, first of all, by wishing you all a very good morning and welcome you all to Glasgow and to the WHO Health Pavilion, and for joining us for our first in-person climate classroom at COP26. So today's class will be on climate change and health with Dr. Dermot Campbell-Lendron from the WHO. I'll allow him to introduce himself more fully in a moment. My name is Colin Hastings. I'm a green economy consultant at Unitar, who runs the Climate Classroom series. Perhaps some of you haven't actually attended or heard of the climate classrooms themselves before. So just a few words on that. Typically, the climate classrooms are all held in person. This year, most of our series is actually online. We're only running 4 in-person classes here. This is the first of them. But in general, the climate classroom is our espresso shot of learning. Obviously, we all have an increasing number of pressures on our time. And so essentially, the climate classrooms are designed to be a short and sweet interactive learning experience to help those that are attending, meaning you all today, to get up to speed on a range of different climate change topics, including today's topic, climate change and health. So the class itself will be 45 minutes long. It will be broken down into 3 parts. The first part will be focusing more on, I guess, the substance and introducing you to the general topic of climate change and health. In part 2, we'll have more of an illustration and go through the interlinkages between climate change and health with some practical examples. And then in part 3, we'll hand that over to you for a Q&A. So all of you are more than welcome to raise your hand once we reach that point and to ask any questions to Diarmuid here. In terms of class rules, this is supposed to be a classroom. It's very different to the classes I attended at school. Those of you that have arrived, because it is meant to be a class, it would be great if we didn't have any skivers. So now that you're here, it would be great if you could stay to the end. If you do need to leave, if you could do so as quietly as possible. Of course, we know there's a lot of competing things going on here. There is a registration sheet, which I think many of you have signed. If you haven't, if you could sign that before the class is over, that would be absolutely great. We'll also be handing out some evaluation forms at the end. This is our 8th edition of the series. We're always looking at ways to improve it. So if you have any thoughts on how today's class went, please do feel free to share them with us. I think that's it. I think that's everything from my side. Perhaps now I can hand over to the actual expert, Dr. Diarmuid, to deliver today's class. Thank you all for joining.
Okay. Well, thank you very much for the kind introduction and for effectively opening the pavilion. This is, I think, the first event that we're holding at the Health Pavilion. We will have a series of events going on throughout the 2 weeks. We think this is, of course, the most important pavilion at the COP. All issues at the COP are important, but as you'll hear during the course of the presentation and throughout the events that will take place over the next 2 weeks, the reason that we think this is so important is because we think that health has some of the most important and most positive arguments for acting on climate change. And that's what we wanted to articulate here and also then to bring to the negotiations. So if I could have, well, I'll just quickly, if I could just go back one. So I'll be introducing the first sort of content part of the presentation and basically making clear why we think that climate change is the defining issue for public health for the coming century. And you can imagine as somebody from WHO how important it is for us to say that when you consider all of the other health issues that we're dealing with around the world. But climate change is the one that has the potential to swamp all of the other health issues that we're dealing with. And that makes these negotiations, what's going on here at COP26, effectively, we think, the most important public health discussion of the century. We'll talk a little bit about health in the COP26 program, so where health is being represented in the discussions and where health can continue to bring positive arguments to those discussions, and then a little bit of an overview of the events and a bit of discussion and Q&A. I understand we may also be broadcasting, so we have people here in the room, but we have also people online. And I'm just looking around my colleagues to see if we have a way of also getting, I don't know if we have a way of getting Q&As from participants online. Maybe we can sort that out during the course of the event. So if we could go to the next slide, please. So the reason why climate change is so important to health and the massive challenge that we have for health is that we in the health community are used to dealing with individual diseases. We're used to dealing with malaria. Well, we've got interventions for malaria. If we can get those out to enough people, we can solve the malaria problem. COVID, the massive public health challenge of the past 2 years or so. We now have vaccines, we have masks, we have other interventions. If we can get those to enough people, we can solve the COVID crisis. The climate change crisis is different for health. And the reason that it is such a big challenge for us is that it hits different weak points in health. So it increases the frequency and intensity of extreme weather events. It makes it easier to transmit infectious diseases, whether that's malaria, dengue, or waterborne diseases. it undermines the environmental and social determinants of health. It undermines our air quality. It undermines the quality and availability of our water, or the effectiveness of our sanitation systems. And ultimately, long-term changes such as sea level rise will submerge certain parts of the world. We will lose some of our member states as WHO, and that therefore makes it impossible for us to protect health. No matter how good our public health interventions are, there is nothing that we can do to protect the overall health of a low-lying population in a small island developing state or in another low-lying area. So that is why we think this is the ultimate challenge for public health. And at WHO, we've been talking about this issue for, I think, over 30 years now, since we published our first report. But what has changed in the last few years is that we're actually getting this back from the countries. We're talking to ministries of health from around the world. We run a global survey on health and climate change from around the world, and we're hearing them report back to us. When they carry out their vulnerability and adaptation assessments, they're reporting back to us that they have problems with vector-borne disease, they have problems with water and foodborne disease, and they even have problems with issues that we were hardly aware of. So over the years we've been talking about this issue, we have hardly talked about mental health. And yet within the last 2 years, we have heard from almost all of the stakeholders that we talk to, what about mental health? What about mental health of climate change? If it's the case that we will submerge populations, obviously that must have impacts on mental health, the future of young people. What are you doing about that? And we're hearing that now reported back from countries. So this is the fundamental scale of the challenge that we are facing. Next slide, please. We also have a massive equity challenge. You will hear very much within the climate negotiations about inequity, about the most vulnerable populations, those who have contributed least to climate change, suffering the most impacts. And I can think of no better example of that than health. So this figure here is based on work that, on the bottom part of the graph is work that we at WHO published just over 20 years ago now, where we carried out the first estimates of the overall health impacts of climate change. We were asked to quantify the global burden of disease from climate change. It was an almost impossible task, but we were able, even with some quite conservative models that only looked at a few of the health impacts of climate change, we concluded at that time, in the year 2000, that climate change was probably already causing over 150,000 excess deaths per year, even then and even from a small subset. And the populations that were hardest hit were those that already suffered a high burden of malaria or diarrheal disease or malnutrition, and climate change was making that worse. On the top part of the graph, we can see where the problem has come from. It has come from the richer countries or the richer populations in all countries. And so that is almost the exact inverse of those whose health is most compromised by climate change. And we don't show this graph to point the finger of blame at the richer populations. This was not a deliberate act. It's effectively a historical accident. We're currently in Glasgow. Glasgow, you can make an argument, is the home of the Industrial Revolution. It's where this all started. And that was done, it drove jobs and development and so on. But the long-term impact of that has been climate change and impacts on other people. So we do make the case that there needs to be burden sharing. There needs to be support from those populations that have benefited from the use of cheap fossil fuels to those who are most affected, including compromising their right to health. So next slide, please. And now we come to the Paris Agreement as a public health treaty. And the reason that we say that we believe the Paris Agreement is the most important public health agreement of the century, for all of those reasons that I've just described. Now, those of you who are involved in the climate negotiations, you are probably aware that in the opening section of the Paris Agreement, it refers to human rights. And the first right that it refers to is the right to health. So the Paris Agreement says that all of the actions that we need to take on climate change should take due regard for human rights, and it starts with the right to health. And as I've hopefully made clear, there is no way we can protect that right to health without putting in place the measures to adapt to climate change, increase our resilience to climate change on the one hand, but also to cut carbon emissions, because there are some things that we can't adapt our way out of. So that's why we think the Paris Agreement is so important for human health, because it should be safeguarding the rights even of the most vulnerable populations, their right to health. So we've been consistently making this case that the Paris Agreement is a public health treaty, both to safeguard the right to health, but also, and I'll come on to this in a minute, to get massive health gains. The actions that we need to take to cut carbon emissions can have massive positive gains for human health. And we think that's probably the most effective argument that we can bring to the climate negotiations, because we will hear a great deal over the next couple of weeks about how disastrous climate change is for the future of humanity, and that is absolutely true. What we will hear probably less of are all of the good things that come from climate action. And we think number one on that list of the good things that come from climate action is public health. Next slide, please. Sorry, next slide, please. And over the years that we have been involved in the climate negotiations, and to be honest, it's been too long that we've been involved in the climate negotiations. They've been going on for 30 years. You know, we've been coming to them for over 20 years. And right in the beginning of the climate negotiations, the first articles and principles of the UNFCCC treaty and the overarching agreement from Rio refer to health. They're right there at the top. But over time, that health argument, we think, has been neglected. It's been neglected from the health side, with not enough health people coming forward saying climate action is important, but also from the environment and climate change side to be sort of welcoming to health arguments, particularly those positive arguments. And that is changing. It's perhaps not changing strongly enough or quickly enough, but it is changing. And so at COP26, for the first time, we actually have a strong health program. So over the past year or so, we've been working with the UK presidency of the COP, and their priorities, their campaign aims are the ones listed across the top, and we've been working with them to articulate how health can contribute positively to each of those. So when we're talking about adaptation and resilience, we should also be talking about climate resilient health systems. When we're talking about the energy transition, we should also be talking about improved air quality and improvements for human health. When we're talking about clean transport, we should also be talking about the public health gains that come from active transport, public health, and so on. And they've been very receptive to that, and that's starting, I would say, to get into the DNA and the core discussions around health. And finally, on finance, we know that one of the big barriers to action on climate change is people saying, well, we agree it needs to be done, but it will cost money. One of the things that health brings is to make clear that we are already throwing money on the wrong things. We're already effectively massively subsidizing fossil fuel consumption, and we're paying that either in cash or we're paying it in the cost to our lungs. And so in the finance discussions, when you talk about the positive health gains that come from climate action, we're actually talking about investment and saving money. The health gains from climate action actually pay for the cost of mitigation probably at least twice over. So that's another positive argument that we can bring, and we see increased receptivity to that. Next slide, please. And so the COP26 health program is, for the first time, I would say, a strong health program. And we see the COP presidency has articulated a series of specific initiatives. So they have an initiative on building climate resilient health systems. They have an initiative effectively on health leadership and emissions reduction, effectively low carbon health systems, with the fantastic example of the NHS England as one of the real pioneers in this regard. They also have an initiative on promoting healthy NDCs. So the big engine of climate action is the commitments that countries are making through their nationally determined contributions. We think that every NDC should look at the health implications of their NDC, because usually, if they're ambitious, those health implications will be positive. And we're working with countries to articulate how positive and to design their NDCs in such a way as to get the biggest health gains. And then one of the others is, I think there's one which may not be listed here, is around applied research on health resilience to climate change. There's a lot of discussion about the health impacts of climate change. There is not as yet enough research on identifying the interventions which are most effective in protecting people's health from climate change. So there's another initiative on that. And then probably the one which I think is the most hopeful over the long term is on mobilizing health voices for climate action. And I think this comes up later in the presentation, but some of you may be aware that in the run-up to COP26, There was a letter which was promoted by health and climate NGOs. We also supported it from WHO. And that was signed by organizations representing 45 million healthcare professionals. That's somewhere between 2/3 and 3/4 of all of the healthcare professionals in the world. Their organizations have signed up to this, asking for strong climate action. And one of the signatories on that letter is our boss, is Tedros. So we are absolutely behind that. And we think that the engagement of the health community, which is just getting stronger and stronger, is a really valuable contribution to the climate change discussion, because these people are numerous, they're embedded in every population in the world, and they're probably the most trusted profession on the planet. So we see this as a really positive sign. Next slide, please. So there we go. That's basically what I've just been describing. We have the Healthy Climate Prescription, which is the letter that we signed on to. But we also, about 2 weeks ago now, launched a report called The Health Argument for Climate Action that we as WHO sort of held the pen on, but we developed it in collaboration with health organizations from around the world. So we have effectively about 400 contributors to this report. And it lays out recommendations and concrete steps to deliver the Paris Agreement effectively as a health agreement, and is completely aligned with the wider mobilization of the health community. And once again, I come back to this point that we think the big contribution that we can make is the positivity of this. It's not just sounding the alarm bell, important though that is. Next slide, please. So I won't go into these in detail, but these are the 10 recommendations which are listed out in this report. And if I was to briefly summarize them, there's a set of things that we have to do, including making clear that our health is not negotiable. So we're sitting in the middle of negotiations. There will be negotiations about finance, about technology transfer, and so on. The thing that should not be on the table is the health of ourselves, our children, and future generations. And that is what the Paris Agreement says. It says the right to health. It doesn't say the if you can afford it to health, or the nice to have of health. So we think that there's a real reason why health should be central here. We want to make clear that the recovery from COVID should be done in such a way as to promote health. And if you're interested in promoting health, that means climate action. You can't promote health by investing in polluting energy. You can't promote health by compromising the climate and the ecological systems on which health depends. And we need to build health resilience. So that's the first set. The next set is all of those positive arguments that I keep referring to. So we think that the connection between health, climate change, and air quality is absolutely critical to the climate discussions. Many of you will be aware that we estimate that over 7 million lives are lost each year to air pollution. That's about as big a health impact as we've got from any risk factor in the world. It's about 13 deaths per minute. And at least for outdoor air pollution, which is about half of that, about 2/3 of that comes from the burning of fossil fuels. So the same thing which is driving the climate crisis. So if we're able to make this transition to clean energy, it's not just about protecting the planet, it's actually about saving lives right now in individual countries and individual communities. We can make a strong health case for reimagining mobility. So in our cities, as transport systems are redesigned to cut carbon emissions, if you do that right, there are massive health gains to that, from reduced road traffic injuries, from increased physical activity. The same with food systems. The food systems may be the biggest of all of these. Even though we estimate that the air pollution gains would cover the cost of mitigation twice over, the first estimates from food systems suggest that the gains from healthy, sustainable diets may be even bigger than those. So if populations follow WHO's healthy diet guidelines, we would massively cut carbon emissions, and we would also gain great health gains. And then the final set are around the need to make healthy climate commitments. We are seeing countries making healthy NDCs. This argument that I've already mentioned about stop funding pollution, that most of the subsidies that we currently pay out are actually bad for the environment and bad for health, and that includes particularly subsidies for fossil fuel consumption. And then finally, the prescription of climate action, and that's about the health community saying what we think needs to be done in order to protect the health of the populations around the world from climate change. It's about that mobilization of the health voice as a supportive voice for climate action. Next slide, please. I didn't prepare these slides. I should say, but so this is not self-advertising, but as an example of the mobilization, literal mobilization of the health community. The Healthy Climate Report and that Healthy Prescription Letter have been hand-delivered by bicycle from Geneva to Glasgow. So I cycled the first leg, which was Geneva to London, carrying the report, hand-signed by Ted Ross with a message for Alok Sharma, and the Healthy Prescription Letter, also hand-signed by Ted Ross, and then handed that over in London to a group of fantastic cyclists from the National Health Service in England, who then cycled the rest of the way from London to Glasgow. We basically piggybacked on their ride. Theirs was organized in advance, and we linked up with them. But I think that's a really good demonstration of the commitment that health workers feel to this. We're prepared to take the time to make the statement that we will make our own commitment to addressing this. So that report and the letter is somewhere within COP. I need to reclaim it. I don't know exactly where it is. There are other riders here. I can see Alice in the back, but there's it really was a fantastic thing. The NHS riders were mainly paediatricians led out of Great Ormond Street Hospital. If you come from the UK, Great Ormond Street Hospital is a legendary children's hospital. They declared a climate crisis about a year ago, and it was basically paediatricians saying, we're fed up with just treating sick children when we know that the climate crisis will compromise their health in the future. And they were then prepared to ride from London to Glasgow to make that case. And they did it in collaboration with the Pollution Pods, which is an art exhibition which demonstrates the difference between breathing clean air as opposed to polluted air in different cities around the world. So that's exactly the kind of thing, and the 45 million signatories that we intend to do more of in the coming years to get that health community articulating on behalf of climate action. Next slide, please. So we're also running a very large program of climate events. So this is, in fact, our first health pavilion at any COP. We're usually sort of here with a little stand, sort of in a corner, trying to find a coffee and so on. But we think it's important that health is here with a positive presence, and we will hold our global conference on health and climate change in partnership with the organisations you can see listed across the bottom at Glasgow Caledonian University in the middle weekend of COP, so now on Saturday. You can register. I'm not sure if there are still in-person places available, but online places are available, and we'd certainly encourage you to join up with that. So we'll have a whole day to explore these arguments in more detail. Next slide, please. In terms of bringing us back to the COP itself, those of us from the health community have taken a while to really get the hang of COP negotiations. I think we probably thought that if we turned up with our evidence and we turned up with our nice scientific studies saying climate change impacts health, that everybody would sit up and take notice. Those of you who have been involved in COP for a while will realize that's not how COP works. COP has its own negotiating streams, it has its own priorities, it has its own arcane rituals. So we have developed an online course on climate change negotiations on health that helps people to understand the climate change negotiations and therefore where health can fit into those. Next slide, please. So that appears to be the end of the presentation. I think at this point, I can see we have a good audience here in the room, and it would be good perhaps to have some interaction, to have some Q&As. Hopefully we've made clear why we're here as WHO, why we think it's important to be here as a health community, and we'd be really interested to hear from you where you come from, whether you're more from the health side, whether you're more from the climate change side, and what you think can be got out of the climate change negotiations for health, and how health can contribute to the climate negotiations. So I'll stop there and open the floor to questions. So I think I can just hand you this microphone. I'm not quite sure. This is our first event, so we'll make it up as we go along.
Yeah. So thank you so much. My name's Jacob. I'm a student at Duke University, a master's student. One fun question before I start: how did you cross the channel with the bike? And then my serious question is, I've taking a class on food security, and we talk a lot about like food health and climate. So if there's any research or anything that you guys have been doing with like sustainable food systems and how like our food may be less secure with respect to health, that would be great. Thank you.
Okay, thank you. I'll just check if there are any other questions to start with. Or maybe we can take a couple and then I'll come back.
Thank you. Hi, my name's Victoria. I'm a medical doctor, but I'm also currently taking a fellowship with the Centre for Sustainable Healthcare based in Oxford in the UK. I have two very quick questions. Firstly, as someone in their early medical and hopefully public health career, what should I choose as my priority? So you listed your 10 key recommendations. As someone who's going to be dealing with the effects of climate change in their career, what should I choose as my main priority? Second question is, have you seen or do you know of or have you witnessed any examples of where using the climate argument for climate change has actually had an impact on decision makers?
Okay, I'll take one more, otherwise I'm going to lose track. Okay, thanks, because otherwise I will lose track. But I'm also looking at the rest of my team here, so I may want to pass the mic, or if they want to take the mic to answer any of these. The question on how I crossed the channel, when I was tweeting about this, people were tweeting me photographs of pedalos. They're saying this is, if you really want to do it all human powered, then you need to get a pedalo. In fact, I took the ferry. I got the ferry to Dieppe. I was very pleased. I was the only bike on the ferry. So there's a big queue of cars. They sent me, I was the only bike in lane one. But yeah, basically I've made it to Glasgow either by bike or by train. So my feet have not touched the ground, well, almost literally to get here. Your question was on food systems and food security. I think this is an issue which is certainly ripe for further development. We find that one of the challenges in climate change and health research is that people will tend to focus on those issues which are easier to investigate, not necessarily the biggest and most important issues. We see on the health impacts of climate change, there's a lot of work on heat stress, or relatively a lot of work on heat stress, quite a lot of work on infectious disease, relatively less on food systems, non-communicable disease and mental health. Even though the early indications that we have are that food systems may be the most important. And even in that early work that I referred to of the health impacts of climate change, the largest contributor to that was impacts on food insecurity. So I think we have to be more creative and a bit more bold in looking at issues which are not just the ones where it's easier to do a neat intervention or a neat trial. There are, I would say, new partners coming into this area. We're starting to see investment by research funders. And I think maybe this relates to your question a little bit as well. I'm not personally a medical doctor. I come from a different background. I would say that my experience up until now is that people are having to create their own path, and they're creating demand for this. And so you're probably aware, for example, that the International Federation of Medical Students Associations have been one of our best partners on this for over a decade, are effectively campaigning for clinical teaching to include climate change. And they have, I think, been able to sort of boost the coverage of climate change within medical curricula from around the world. And I would say that the demand is absolutely there. So I may not be able to give a very direct answer to your question, because part of the challenge is that there are very clear career paths, I think particularly for medical doctors, to go into individual specialities. You can see how you would do that. I don't know that that exists as yet for climate change. So that means that we will have to create it. The issue of climate change and health, that didn't exist as a discipline when I started on this about 20 years ago. There were literally, I think, 5 or 6 people in the world who are working on this issue. There are now hundreds, probably thousands of people working on this issue. And those systems form as they go along. So I don't have a very clear answer to your question, other than there are enough of some of the best, I think, medical people out there who now realize this is the top priority. and will be supportive of you in trying to create the systems that should support people like you going into that area. And I think that there is a great deal that can be done within the health service. And yeah, the NHS Sustainable Development Unit and now the bigger investment within NHS England is, I think, a tribute to starting small with a small cell, which then became mainstream and is now a major part of NHS investment. So I think if we build it, it will come in terms of people and in terms of the investment as well. And I think you asked for one example where I guess you're asking examples where the health argument has been used to drive climate action. I think we're starting to see that. I'll just give one example off the top of my head. The last COP we were at physically in Madrid in 2019, we gave a presentation on climate change and health. The representative of the Pakistan Ministry of Climate Change came up to us and said, we need the health argument, we need to quantify the health gains in order to look at the implications of our policy on eliminating fossil fuel subsidy reform and putting a carbon tax on, because we see that it will bring health benefits. We want to know how big they are because we think that's the argument that will make it palatable. And we see individual examples of this from around the world. Phase out of coal has been at least as driven by health implications as it has climate change implications. And I would say in the really big developing economies like China and India and so on, I would say in China, my understanding is their primary motivation for doing what they have done on phasing out coal has been the health implications and the air quality implications, less for the climate implications. And if you ask people in the street what they're concerned about, health tends to come out number one. So we probably need to get a bit better in documenting that with concrete evidence, but I think there are now quite a few stories emerging.
Thank you. This is Yusuf Irmak from Ministry of Health of Turkey. Just a little question. As you know, surveillance and monitoring and gathering data from the field is very important for the policy making process. In Turkey, we would like to start a process and a project like that. What do you suggest? An effective project should be how should be an effective project to getting data for the climate effects?
I think that is a critically important question. Those of us from the health community are quite evidence-driven, rightly so. So it really matters that we're able to document impacts, we're able to document benefits. The short answer is that at WHO, we have now quite a comprehensive set of technical guidance on that. So we have guidance on monitoring the health impacts of climate change. So, for example, how you can monitor exposure to heat waves, how you can quantify the health impacts of heat waves, infectious disease, and so on. And we also have guidance on monitoring the health gains that you will get from climate action. So we have a very strong air pollution program which will give you guidance on how you can monitor air pollution around your country, how you can turn that into estimates of the current health impacts of air pollution and model the health gains that would come from climate action. So I don't want to just say refer you to our website, but we'll be happy to interact further with you because we have quite a strong program on that. Two other things I would mention is that we run a global survey on health and climate change. So we contact ministries of health. The Ministry of Health of Turkey has probably been contacted. And we use that to ask these questions, for example, about what are you already experiencing in your country through your vulnerability and adaptation assessments and so on, but also what steps are you taking in your country? Do you have a health focal point? Is health included on your NDCs and so on? We have that for most countries in the world, and we work with countries to produce climate and health country profiles. I'm not sure if we have one for Turkey, but we develop in... Okay, fantastic. Wonderful, okay. So that's the kind of sort of engagement that we have. And I would say from the WHO side, you know, we're here for the long term. We're not just here for one COP. We're not just here to sound the alarm and disappear. We have a comprehensive program of working with countries, providing them technical support, providing them policy and advocacy support. So the Ministry of Health is you're our bosses and our direct clients. So we'll be very pleased to work more closely with you.
Hello everyone, Saad Wakas here from Morocco. I worked in IFMC leadership for a couple of years now, doing my master's in science, public health in LSHTM. So my reflection is, we as healthcare professionals, health field people, we have a role to play. So I think another role we should, other than pushing for the health impacts, is starting from ourselves. So, for example, making guidance for people working in the healthcare, how they can take things greener, either hospitals or health systems. We see now the NHS engagements, for example. So, what initiatives or programs or actions are going on, or guidance for different healthcare system, let's say, players or stakeholders on the local level to engage to become greener or more environmental friendly?
Okay, thank you for that question. Can I see if there are more questions to take? So I'll take these two and then try and answer all of them together. And again, if any of my team wants to chip in, you'll be very happy to.
Hello, thank you. My name is Mark. I'm also from the International Federation of Medical Students Association. I just wanted to ask, you mentioned that mental health was an emerging theme in the last 2 years. And I was wondering if there's work that the WHO is doing into looking into emerging health outcomes in the future, and if you've kind of got any early indications of potential other health impacts. Was there another question?
Yeah, hi. I actually stumbled upon this event because it seemed interesting to me. I'm actually just representing one of the NGOs, which is called Nuclear for Climate. But it came as an interesting topic to me, the problem of malnutrition. While we know very well that also food waste is a huge problem. So I was interested to know what is what health organization position on the nuclear technologies being used for food sterilization and preservation in order to address these two topics at one time.
Okay, thanks very much for the questions. To take the first one on effectively work within health services themselves to make themselves greener. For me, this is another area which has emerged rapidly within the last few years. So there are organizations like the NHS Sustainable Development Unit, which have been working on this for a long period of time. Big NGOs like Healthcare Without Harm, who have been doing fantastic work on this for about probably, well, more than a decade. And I would say suddenly this has become mainstream. And so I keep referring to the NHS England as a really prime example of this, but we are seeing emerging demand on this from around the world. Because you're absolutely right that there are two big reasons why I think healthcare systems need to become green. One is that healthcare systems are now a major part of the global economy. You may be aware that healthcare is about 10% of the global economy. It's a huge economic sector. So it really matters if healthcare starts buying green, and in the way that NHS England is doing that, it actually is big enough to have an impact on supply chains and so on. The healthcare around the world contributes somewhere between 4 to 5% of greenhouse gas emissions, again mainly from supply chain. So again, it makes a difference what healthcare systems do themselves. But the other part of this is that sort of moral weight of healthcare systems. If people start going into GP surgeries, if people start going into hospitals, and they see the poster that says not only, you know, eat an apple a day or you know, cycle or other standard public health preventive measures that we're quite happy to promote as a health community, if there are also posters up saying climate action is important, then that normalizes it and it makes clear that the health community, again, the most trusted community on the planet, thinks this is important and thinks this is mainstream. And I think that's really important. So I would refer you, we're now starting to do more on this within WHO. So just about a year ago, we published our first guidance on climate resilience and environmentally sustainable healthcare facilities. So we're attempting to span the range from developed country hospitals to clinics in underdeveloped countries. So it's quite generic, but it does describe how the areas you need to work on in order to make sure your healthcare facility is more resilient to climate impacts, but also greener. But there's a rapidly emerging community of practice in this area. The question about mental health and climate change. We will, I think, within the next couple of weeks, be producing our first document on mental health and climate change. And I think it's a really interesting and important area of work. From the WHO side, we're developing that in collaboration with our mental health department, who are, if you like, sort of traditional mental health experts. And they, I think, are quite correctly being quite careful about the language that is used. Because as this is an area which a lot of people are interested in, colleagues have said to me in the past, climate change is an issue that everybody thinks they're an expert in. There's an Italian who said it's like, everybody thinks they would be a better manager of the Italian football team than the people who actually manage the Italian football team. Everybody thinks they know something about climate change. Everybody thinks they know something about mental health because we all experience it in our own lives or in the lives of people we know. And so our colleagues are saying, okay, here's what you can say about mental health impacts. Here is what we don't yet know. And there's a sort of that gray area in between about issues like eco-anxiety or the fact that children are reporting that they are stressed and anxious about climate change. A massive survey recently across children showing that I think the majority of them are anxious about the effect of climate change on their lives and are feeling let down by their national governments. Those are real results. And then we need to find the right language and to stick to our disciplinary rigor to make sure we talk about that in the right way. And in fact, when I rode over to London, I spent one day riding with the NHS professionals, talking to somebody who was involved in that survey. She was explaining to me quite clearly that it's important not to pathologize people who are concerned about the impacts of climate change. That's actually the sane response, is to be concerned and somewhat anxious about the impacts of climate change. You can say that these people maybe are suffering from mental health impacts. You have to treat them and support them. But it is something that we have to be very careful about. And I think that we really want to work with that community which is starting to describe these looser, long-term mental health implications of climate change to ensure that we don't just throw the disciplinary rigor out the window. We need to be correct in what we're saying, but it is an issue that is not going away and that we're supporting. So I think our brief should be out in the next couple of weeks. And then the other question on food systems and food waste. One of the challenges on working on climate change and health is it's such a wide area that none of us can really claim to be experts on the individual areas. I would say that sustainable and healthy food systems, we now have enough evidence to say that is one of the really big opportunities for cutting carbon emissions and promoting health. And food waste is clearly a significant part of that. So we know, everybody knows this anyway, everybody knows we shouldn't be wasting food for many reasons. And that is one of the ways in which we can improve health. On the individual sort of techniques, for example, for making sure that food waste is sterilized, I'm afraid I'm not an expert. It's not something I feel qualified to talk about. I would say that what we are comfortable in saying is that we are in favor of technologies that cut carbon emissions and are safe for health. So if that includes particular applications of nuclear technologies or radiation, then we're completely open to that. But I think we are now at the stage in addressing climate change where we have to do everything. It's no longer enough to say, well, we're not going to talk about nuclear power. We only want to talk about wind power. We don't want to talk about adaptation because that will take the pressure off mitigation. Unfortunately, we are beyond the point where we can point to other people and say, you clean up the mess. We can't point to other countries. As health people, we can't say, well, other sectors should decarbonize. As health, we'll do it last. Unfortunately, we're all going to have to do pretty much everything we can think of to address the climate crisis. But I think that we can do it in such a way that we also promote health at the same time as we cut carbon emissions. I'm not sure how we're doing for time and how long the session should be running for. Okay, we have 10 minutes to go. I see we have more questions, but I'm happy to keep going. So we'll take these two questions.
Hi, thanks. I'm from the Margaret Pike Trust, and we focus on reproductive health and rights, and particularly the ability to exercise reproductive choice as part of adaptation and resilience building. Does the WHO have any focus on reproductive health in its climate work? And if it doesn't, where would the entry point be to actually work with WHO to do so?
Hello, my name is Ankush Bansal. I'm a physician in Florida in the United States, here representing the World Medical Association. My first question is, my focus on climate change and health is on food systems, healthy, sustainable diets. So my first question is, are there statistics, economic statistics on more sustainable health systems as far as food goes to help policymakers both at the national level and the local level so that we can make that case to them? And I'll give you an example. So in Florida, it's usually very hot. We have hurricanes. There was actually a report that came out from the Union of Concerned Scientists recently that said, 20% of our economy is outdoor workers that are affected by heat, and if we do nothing, then by 2050, this will affect about $4 billion in revenue for the state and about 30 days of lost time and wages per worker. If we can apply that to put pressure on policymakers for food systems, that may be beneficial. My second question is circling back to hospitals and health systems on making them sustainable, which also includes food that's served both to visitors as well as to patients. And this could include things like green roofs, local farming, healthier diets, and how that can be, number one, more economically viable for the hospital and beneficial for the hospital, but number two, offer it as an educational opportunity for patients as well as visitors to help their overall health, never mind climate, but it kind of solves two problems at the same time. Thank you.
Fantastic. Thanks for both questions. Neither of them are really simple ones. On the issue of sexual reproductive health and rights, WHO has talked about this issue in relation to climate change. We don't have a formal position on this. That's partly because it's somewhat tricky, and we know we need to be careful to get it right. But it's also, to be honest, because there are so many ways in which health interacts with climate change. But I would say that we are very comfortable championing sexual and reproductive health and rights. We will stand up for that in any forum that we have. There are framings of this that we would find difficult and we think should best be avoided, particularly around suggesting to people in developing countries that they should be controlling their fertility in order to solve the climate crisis. From our point of view, that's absolutely the wrong way to enter on this. We would say sexual and reproductive health is a right. It should just be, we should just be defending it on those terms. It is also really good for health. So giving women, enabling them to have control over their own fertility is good for their health and their children's health. So we're happy to stand up for it on that basis as well. And by the way, if you do that, then that tends to increase the capacity of populations to, it puts them under less stress, puts less local environmental stress in terms of deforestation and so on. And also, by the way, it probably helps with the climate crisis as well. But that's our sort of the way that we feel comfortable talking about it. But it absolutely starts with, we shouldn't be arguing about a woman's right to have control over her own fertility. That is just a right. And by the way, it brings a whole series of other benefits as well, including for the climate crisis. I think on food systems, I would say, I just couldn't agree with you more that should be a really positive and persuasive argument to policymakers. One of the things that we find helps in talking to policymakers is in making this local and also connect directly to issues that they're already dealing with. One of the challenges that we had in the early stages of talking about climate change and health is that everybody was prepared to say, yeah, it's a big issue for health. Everybody should do something about it, and then walk away because it wasn't made directly, didn't directly relate to their day jobs. And now we're starting to find, because it's become such an important issue, it is starting to become people's day jobs. We now have climate change and health focal points. We now have people whose job it is to cut carbon emissions within the health sector. That's one thing. But the other thing that we see is that if you can make clear that agricultural productivity in Florida is already being impacted by heat, it's going to get worse because of climate change. And I would say that heat stress is one of the issues where the evidence is clearest and simplest. We can show what temperatures and levels of humidity are unhealthy to work in. And if you can quantify that in terms of lost productivity, then that should be a persuasive argument to policymakers. Sorry, there was another part to the question. Yeah, within health systems themselves. Yeah, I think that is critically important. I think that, again, procurement and supply chains are the most important contribution to the carbon footprint of health systems, and a significant part of that is food. So that it's important in its own right, but it is also important as a signal that is sent out to the wider community. I haven't been in hospital for a while. I haven't eaten hospital food for a while, but I think I would expect if I go into a hospital or if I take my children into a hospital, I wouldn't expect that hospital to be feeding them junk. I would expect them to be feeding them food which is nutritious, and there is a large degree of overlap between food which is nutritious and healthy and that also has a low carbon footprint. But I think we're now at the point where it should be valid and accepted for a hospital to say that we're promoting a healthy diet ourselves, and by the way, it also has low carbon, because that is now part of the reality that we live in, that most people around the world now accept that we need to act on climate change. And I think the experience, particularly from the NHS in England, is that healthcare workers are asking to do more on this, and their patients are very happy to see more on this. There was initially some pushback to say, well, maybe health services shouldn't be doing this. Maybe they should be spending their money on treating people, not wasting time trying to save the planet. That is not what the patients actually say when you ask them. They're actually very comfortable with a health service that also reduces its own carbon emissions and sets an example to future generations. So, yeah, I think that all of these areas are emerging areas, but that is one which I think could do with further development as well. I think we're probably coming to the end of our time. I'll just check whether there are any final burning questions that anybody has. If not, then I'll just thank everybody for participating, both in person and online. Once again, this is our first event. We're inaugurating the Health Pavilion. I think there'll be about 60 which are going on throughout the course of the 2 weeks. We also have our health conference as well, so we'll be just be really pleased to see you and to talk to you throughout the course of the next 2 weeks. So thank you very much for participating. Thank you.
That was great. Thank you, dear Mids, for being an excellent teacher today and delivering an excellent class. I know you made more of a personal sacrifice to get here than many of us in this room. As an amateur cyclist myself, I'm amazed at how freely you're moving about the stage after after a journey like that. So thank you again and for being here to open the Health Pavilion this morning. Thank you as well to all of you for attending. I think today was a perfect demonstration of what we want our classrooms to be like. We want them to generate thought. We want them to generate discussion. So thank you all for being such an active and engaging audience. I mean, I think we had an open Q&A for nearly half an hour there, which was great. In terms of some more details about the classrooms, as I said, all of the resources that Diarmid was talking about today will be available on our website in case you would like to learn more about climate change and health. We have 2 online courses that we've developed in partnership with WHO on climate change and health, climate change negotiations and health, which are available for free online. They're self-paced, so you can take them at your own speeds, at your own time, wherever you are. So just to make you aware of that, so please check out our website. We also, as I said, have 3 more in-person classes here at COP26. We will actually be running the same class again on Thursday at the Pavilion at 3:30. In case I know some of you that came in slightly later that may have missed the start, if you would like to attend that, or if you have any colleagues or other friends here that you think might be interested, please bring them along. Our next class will be tomorrow in the Capacity Building Hub, which is just across the walkway here, and that will be on thinking, talking, acting climate with a speaker from the BBC based in Tunisia. Finally, we did have a registration form, which I think most of you have signed. If any of you haven't, if you could complete that before leaving, that would be absolutely great. And also, as I said at the beginning, some evaluation forms. This is our 8th edition. We're constantly looking at ways of improving the format, improving the structure. So if you have any thoughts about today's session, please do fill in an evaluation form before you leave. I think that's it from me. Thank you again, everyone, for attending. I hope you found the class as interesting and as engaging as I did. And enjoy the rest of your day here in Glasgow. Thank you.
talk about the microphone real
Sure.
quick? When you're talking, you need to put it like here. You know.
I used to be a sound engineer actually back in a long time ago.
yeah.
So no plosives, right? Peter Piper picked a peck of pickled pepper.
That's fine. So we take that too. I don't know who's.
You've got three.
I got four.
Okay, so I'm going to grab one for myself.
So the
and
chair's
then,
going in the middle?
Yes, exactly. Yeah.
Then they can share it.
Good morning,
They'll be happy to.
and welcome to this session on energy and health. I hope you can all hear me. Can I get a thumbs up at the back? Are you hearing us okay? Fantastic. Okay, great. So in the next hour, many thanks to the WHO Pavilion for hosting us here. In the next hour, we're going to be examining some of the various links between energy and health, and we're going to be looking at the process of extracting the materials that we use to burn, and we're going to look at the process of burning them and what that does, and we're going to be looking at sort of from the sort of technical end of things, sort of political into the social end. We've got four panelists up beside me, all of whom know far more about this than I do, and we're also joined by a couple of other speakers online, technology allowing. We're going to leave as much time as we can for your questions, your answers, and hopefully we're going to get some questions and answers in from the people who are joining us remotely as well. So I'm just going to very briefly just name our speakers in order so you know who they are, and then we're going to go straight into presentations. So on my right, my extreme right is Purnima Prabhakaran, who's from the Public Health Foundation of India. Next to me is Jane Burston from the Clean Air Fund in the UK. Immediately to my left is Rhiannon Osborne, Students for Global Health. And on my far left, your far right, is Robert Hughes from the London School of Hygiene and Tropical Medicine. And we're going to be joined online by Rachel Huxley from the C40 group of cities, and also by Francina Nkosi from South Africa, from the Waterberg Women's Advocacy Organisation. So many different links between health and energy. And let me hand over first, please, to Jane Burston to outline some of those, particularly as regards air pollution.
Cheers, Richard. Hi, everybody. So what are the links between energy, climate change, and health? Well, one of the main ones is the effect that air pollution has on our health. You probably know that energy is one of the main sources of fossil fuels which are damaging our climate. Fossil fuels are the major cause of air pollution. About 2/3 of our air pollution is caused by burning fossil fuels. And there's two links there to the air pollutants that harm our health. The first is that sometimes pollutants that harm health and climate pollutants are the same thing. Black carbon is one example, and 15% of global warming is down to black carbon and its warming effects. But also it's one of the main components of particulate matter, which causes respiratory problems, heart disease, strokes, dementia, and many other health issues. Also, obviously, burning fossil fuels co-emits greenhouse gases at the same time as other pollutants that are harmful to our health. And then you've got things like methane leaks, which methane isn't directly harmful to health, but it does cause secondary pollutants through chemical reactions in the atmosphere, secondary pollutants like ozone, which are really bad for us as well. So there's a huge link between fossil sources of energy and the air pollution that's harming our health. But often the two issues of climate change and air pollution are addressed separately. The UN FCCC synthesis report on the NDCs identified that only 7% of the NDCs actually tackle air pollution as an issue, which is a huge missed opportunity, because by tackling the two things together, you can do things faster, cheaper, and fairer. Why faster? Well, because pollution harms our health, actions that reduce pollution at the same time as greenhouse gases often have greater public buy-in. You can see pollution like we saw in the lockdowns from COVID. As soon as you stop the polluting sources of activity, people can see that the pollution comes down overnight, and they can see the benefits that has on their health and their family's health. So it's more immediate, it's more tangible, it's about something that they can relate to themselves, them and their family's health, where climate change is sometimes a little bit politically divisive in some places. That's probably an understatement. And for some people can feel a little bit remote. Why is it cheaper? Well, action on air pollution actually saves money. When you think about the savings to the health system of not having to treat the people that have been harmed, but had their health harmed by air pollution, and also the savings to businesses from increased productivity. You know, if people aren't sick and if they're not having to stay off work because their kids are sick, then they're in work more, they're more productive, and they're living better lives as a consequence. So action that addresses both is just more cost effective. And then finally, it can be fairer. Work on air pollution, if it's targeted towards those communities that are most vulnerable or most affected, can really help reduce health inequalities. The people who are most exposed to air pollution are oftentimes the ones that are least responsible for emitting it in the first place. They're often the lowest income communities that can't avoid living next to a busy road or living next to an industrial facility, and that's wherever you are in the world. And lower middle income countries obviously have the highest levels of pollution. So if we're tackling climate change and air pollution at the same time, and in the neighborhoods that are most effective, it can be cheaper, faster, and fairer. So what can be done? Well, I think for governments, it's obvious from the UN FCCC synthesis report that more countries need to look at both climate change and air pollution together. Chile is a brilliant example, and we might want to talk about that a bit later, of a country that set specific black carbon reduction targets for health and climate. Donors need to, like official donors, need to really focus on improving our health rather than harming it. The Clean Air Fund did a report back in September looking at sources of funding for air pollution projects, air pollution reduction projects, and official donors are very surprisingly giving 21% more money to projects that prolong fossil fuel use than they are to projects that reduce air pollution. So official donors need to sort their act out as well. And I think funders in general need to focus on the win-wins. There's a limited amount of, say, philanthropic funding in the world. If we look at what can be good for health and equity and climate change, then I think we'll get further faster. Thank you.
Lovely. Thanks so much, Jane. Of course, a lot of the air pollution around us is concentrated in cities, so not surprising that the C40 Cities network is involved in measures to clean up the city air. So delighted to be joined by the miracle of modern technology by Rachel Huxley, who's Director of Knowledge and Learning at the C40. She also was Chief Executive of Peterborough Environment City Trust in England, and set up and led the UK Sustainable Cities Network. So, Rachel, over to you.
Can you hear me, Richard?
Yes, we can. It's all working. Fantastic. Go for it.
Wonderful. Fantastic. Well, it's lovely to be here. I'm going to talk about the research that we've recently launched looking at coal-free cities and the health and economic as well as the climate case for a clean energy revolution. So, as we know, coal is the single biggest threat and opportunity in terms of achieving our 1.5-degree goal. It's the single largest source of electricity in the world, and it's the largest source of GHG emissions. It's estimated to be responsible for about 0.3 degrees of the 1 degree of warming we've experienced so far. I just want to check, can you see the slides okay?
Yep. Yep, we're seeing them absolutely fine, Rachel. Thank you.
Wonderful. And if we can go on to the next slide. And, you know, we obviously, as you've said, we're all about cities. And so what's the role of cities with regards to kind of coal and global coal use and the rapid coal phase out? Well, cities are at the center of the global energy transition. They account for 2/3 of global energy use, and on average, 38% of electricity is coal-powered. And when we looked, we found that 68% of global coal capacity is located within 500 kilometers of C40 cities. So cities are both influenced and are impacted by the shift from coal to clean energy. So we wanted to undertake research to understand this impact on cities and also the potential role of cities in leading a rapid phase out of coal. If we can go to the next slide. We looked at, to start with, we looked at how current coal plans compare to what is needed to achieve 1.5 degrees. And for C40 cities, we can see that emissions actually increase by 4% under current coal plans, whereas they need to decrease by 61% to achieve the 1.5 degree target. So it's clear that coal-fired power generation is completely incompatible with climate goals. But what if cities can lead a clean energy revolution? You know, what's the potential there? So we looked at the impact if C40 cities phase out coal from their direct electricity use in line with a 1.5 degree scenario. And that would avoid around 1.3 gigatons of carbon this decade. But we know that city action has a huge impact beyond the direct city boundaries, beyond city electricity demand. They can influence the wider grid mix. So we extended this analysis to look at the potential if C40 cities work with other stakeholders to phase out all coal-generated electricity across their regions, their energy regions. And the total avoided emissions increases then to 24 gigatons of carbon. And that represents a massive 6% of the world's total remaining carbon budget. And this shows that cities can have an outsized impact in terms of leading a clean energy revolution. And what's more, we know this is possible. So cities like Denver, Minneapolis, and St. Louis have already successfully pressurized local utilities to commit to rapidly phasing out coal. Having looked at the next slide, please, having looked at the climate implications of coal, we then looked at the health impacts. And first, we modelled the concentrations of air pollutants from coal-fired power plants in all of our cities. And it showed that 61 C40 cities are substantively impacted. And the analysis also shows that cities are impacted by pollution from plants often a long way away from them. So in this slide, you can see how New York is impacted by coal-fired power plants in Pennsylvania, hundreds of kilometers away. And second, we wanted to model the health impact from this air pollution on the 61 cities affected. And our analysis clearly shows that coal is deadly. Based on current coal plans, over 260,000 people could die prematurely. And it's not just about deaths. Coal affects all aspects of residents' health, contributing to over 120,000 premature preterm births and over 93,000 new asthma cases among children. And in addition, air pollution increases the risk of and exacerbates diseases such as diabetes and stroke. And over 350,000 years of life will be affected by these diseases. So that significantly impacts the quality of life of C40 residents. It also shows how inequitable air pollution is. So as Jane was mentioning, air pollution affects all people, but it's especially harmful to a city's most vulnerable populations, such as children, pregnant women, and those with pre-existing medical conditions. Moving on to the next slide. So, our analysis shows that from a climate and health perspective, we know the transition to clean energy is desirable, but we wanted to understand if a rapid transition was also viable. So we looked at both energy prices and we modeled the impact on employment. And so starting with energy prices, how expensive is clean energy compared to coal? We modeled costs for the 34 countries where there was available data. And the findings show that renewables are already cheaper than new coal in 27 of those countries, and cheaper than operating coal in around half. And by the early 2030s, renewables would be cheaper than new and operating coal in all countries across the globe. And going on to the next slide, looking at how a transition to clean energy will impact jobs, the results show a clean energy transition could create and support 6.4 million jobs, and that's 1.1 million more than current coal plants. And just a note here to say that whilst the transition provides more jobs, we do still need to ensure that it's a just transition. And I'm glad a couple of people are going to be speaking on that later. So our analysis shows that clean energy is cheaper and better for employment than coal. And what's more, cities can and already are taking action. So if we're on the next slide about how cities can act, it shows that there's so many examples of how cities are leading on rapidly phasing out coal, leading on shifting a demand to clean energy, on reducing overall energy demand, and on supporting renewable energy generation. I don't have time to go into all the amazing examples from across our cities and others, but please do refer to our reports. And moving on to the next slide and summing up, it was really abundantly clear from our analysis, there's no place for coal. We absolutely must rapidly phase it out. And cities are central to this. They can have an outsized impact. Coal has a huge negative impact on cities' residents' health, especially the most vulnerable. And we know it doesn't have to be this way. If we switch to clean energy, we can avoid the majority of these health impacts. And there's a huge climate and health opportunity here. And what's more, this transition to clean energy is affordable and would generate more jobs. And we can see, inspiringly, that across our cities, mayors are already leading the way on this, showing that not only is a clean energy alternative possible, but it's better. And they're already creating climate safe and healthy cities. Thank you.
Great, lovely. Thanks so much, Rachel. We'll hear a bit more from you later on as well. Maybe maybe we can delve into at least one of those examples that you mentioned. So you were talking, of course, about children as well and other vulnerable groups. And I'd like to pass over now to Robert Hughes from the London School of Hygiene and Tropical Medicine, who spent quite a lot of time working with children, not least in Africa, where, of course, air pollution and other things interact with other health issues that the kids may be facing as well.
Thanks very much. And I'm going to stand so I can see the slides, although I think we've got a bit of a shuffling of the pack of slides. So I don't know if, Alison, you could reopen them. I think that we've got them wrong, but don't worry. No worries. We can go without slides. It's easier because then I can sit down again. Thanks very much. And actually, the previous two speakers have set that up, what I want to talk to you about today, really, really well. What I want to talk about is the intersection between young people and children, the cities, and the climate. And I think that's, the case for that's been made really clearly. But what we set out to do at the London School only about 6 months ago was to truly try and unpack that issue and to say, what's that place in the middle between cities, children, and the climate? And also, and crucially, and this speaks to something that Dermot was saying before, we didn't want to characterize the problem. We didn't want to talk more about the negative health effects of climate breakdown or of the things that contribute to climate breakdown. We wanted to flip the conversation and flip it around into sort of the positive dream, not the horrible nightmare. So what we did is we did two things, really. Well, three things. One is we reviewed the literature. And we looked across the literature that connects the decarbonisation with child and maternal health outcomes. And we found, firstly, that there's very little research out there. So children have, once again, like in many situations, been a little bit neglected. But what is there shows this whole series of ways that cutting carbon is good for our health. So thinking about young people's health, That starts with the obvious. You breathe in pollution, and then we focused in on air pollution as well, because air pollution is the most obvious mechanism where we could find the best data that says cut carbon, reduce pollution, improve health. That's a fairly simple path to follow. And what we found is we found five sets of outcomes that we felt could quantitatively be connected, where you could say, improve the air, improve the health. And those were the obvious, so respiratory health, so lung function, lung growth, asthma cases, and respiratory infections. So those are all quite clear. But then I think this point sometimes those of us working on climate and health forget, is that there's a systemic effect as well to air pollution. So it's not just the lungs, it's a whole body effect. So that means for children growing up, that's about cognition, learning, and how much they, even later life earning. So it's that mechanism, so it's brain development. But it's also thinking about the unborn child. It's about in utero and the birth outcomes that Rachel mentioned. So really, what did we find? If you could you skip back a couple of slides to the one that was the O2 Arena, which was the stadium, Alison, that one. So really what we found when we modeled this across 16 cities, and I can explain to where those were. They were largely global southern cities, but also included Glasgow, Milan, and London as COP hosts. And really quite staggering findings. We found that each year, over 20,000 cases of asthma would not happen, by our estimates, if we had net zero levels of air pollution. So we simulated that change, and that was the kind of headline. That's a 20,000-seater stadium in London, where if you like tennis, you may have watched on TV. And it's important. Numbers don't really mean much when they're a number, but just that's the number of children who would not have had asthma across just 16 cities. And then if you think about those birth outcomes, the numbers are even bigger. So it's probably another 60,000 children who would not be born too small or too soon, so premature or low birth weight. And those things obviously both have lifelong consequences and economic consequences. They're people, but they're also lifetime effects. I said we'd do three things. One was the literature, the second one was modelling that we're doing right now, and then the third thing was that, if you could go to the slide with the map, Alison, is that we also wanted to do research not just about young people and children, but also with young people. So we've been working with advisors from IFMSA, Students for Global Health, Fridays for Future, and what we decided is we wanted to systematically collect the views and opinions of young people living in their cities to say, well, what do you think of your city? What's good, what's bad, what needs to change? And really the findings from that were we didn't know what we'd find. We thought, God, we might find all the young people say, I want jobs and places to go out, and I don't care about the air pollution. But actually it was really staggering. The worst thing about people's cities was the traffic, and the second worst thing that they reported was the pollution. We found 4 in 10 people listed air pollution as one of the worst things about their city. And we also asked them for their ideas about their cities. And we said, well, what do you want to do to make your city better? And my God, I wish there were more of them in the big chamber with sharing those ideas, because we were quite struck. A really powerful set of themes came out of that survey. Young people were saying, they had very tangible, specific ideas. They said, sort the buses out. They said, get public transport, stop us relying on burning things in our houses to cook. I mean, pretty obvious stuff. But they also really talk quite eloquently and powerfully about structural underlying factors, about inequality, about corruption, and really how those things need to be part of the solution, and the equity and justice, which I think is a really important theme. And then the third thing they did is they also said, well, how to actually engage with, about the process. And they talked about their frustration of not being engaged in the room. So I think, just to sort of conclude, really, I think there's 2 big findings from this research, and it's a work in progress. If you can go to the slide that's got the QR code, in case anyone wants to get the report, Alison. That's the survey findings. I'll skip over that, but we've done a load of public engagement with young people, which I can talk to anyone at the end. And the report, if you point your phone at that QR code, you can download. The 2 real strong headline findings we found were, cutting carbon is good for young people's health and maternal health and child health. And it's really quite good for it in a big way. And then the second thing is that we really feel it's important that young people are actively and meaningfully engaged in that process and in those conversations, because they have a lot to give, even before we think about intergenerational justice. But I'll stop talking. Thank you.
Well, thanks, Robert. That was absolutely fascinating. Again, showing that young people are in the front line of this fight, as well as climate change itself. We have a young person sitting to my left, student anyway. Rhiannon Osborne, Students for Global Health. Take it away.
Hi. Okay, great. This is
working well. So yeah, hi, I'm Rhiannon, early 20s, so I think I still count as relatively young. And yeah, I'm a health and climate justice activist based in the UK. And what I'm going to talk a little bit about today is the foundations of our energy system as it works today, and why moving away from fossil fuels needs to look at an awful lot more than just reducing emissions, right? We're all in this room because we care about health and we care about climate. We know fossil fuels are causing the destruction of our planet, and thanks to the incredible speakers that have gone before me, we also know an awful lot about how the burning of fossil fuels kills people through air pollution. But yeah, I'm going to talk a little bit about ownership, about power, about justice and fairness as we look to redesigning our energy system, because without fundamentally examining the structure of our energy system, we're going to end up with the same oppression and the same problems, but with less emissions, right? And I think we can all agree that we want something that's better than that. So when we look at kind of the foundations of our energy system and the Industrial Revolution, what we see in history is the extraction of fossil fuels is very much founded on and intertwined with colonialism and the extraction of resources from the global north to the global south. Sorry, completely the other way around, right? Great start, Rhiannon. So from the global south to the global north. And what this logic is built on, as well as a disregard for the lives and the well-being of many people in the majority world, it's also built on treating nature as a commodity, and the logic of us being superior to nature and being able to just extract and extract and extract in order to fuel human consumption rather than living in reciprocity with the earth. And what this system has also resulted in is an incredible amount of violence towards the communities who steward these resources. So can I just check if Francina is going to be able to join us after I speak?
Alison, could you give us a thumbs up as to whether if Francine's going to be able to join us?
50-50. Okay, yeah. So just in case she doesn't, I just wanted to pay tribute to Francina, who is an anti-mining activist in South Africa. And the reality of our current energy system and the extraction of resources is that her life is actually in danger, right, regularly, for trying to defend her community against the violence that she is being faced at the hands of mega mining corporations, and also other communities face from oil corporations as well. If anybody hasn't watched the press release from the Fridays for Future Most Affected People in Areas, the press conference that they did yesterday, you can hear from them much better than you can hear from me the violence that is faced by people at the front lines of extraction, whether that be oil, whether that be mining. And what we can't say as part of our just transition is, okay, everything's going to be fine. We're going to carry on exploiting these resources in these communities, but it's going to be lithium or it's going to be copper, and we're going to have less emissions, and then we're all going to be fine, right? So, and I think what we need to kind of go back to is the fact that energy is a right. You know, it's not a commodity to be distributed to the richest countries and the richest people. Everybody needs energy for their communities to thrive and to be healthy, and that is absolutely not how we govern our energy system as it is. So the world's richest 1% produce double the emissions of the poorest 50%, right? And that is because they have so much more access to resources, to energy, and to consumption. At the same time, billions of people across the world lack access to very, very basic electricity. And I'm not going to go into detail about why access to electricity is good for your health, because we would literally be here all day. But, you know, like, it's a right. Okay, and we are not distributing energy equally. So we can't just say, oh, that we're going to do the same distribution of energy, but it's going to be green energy, right? The fundamental distribution of energy is completely wrong in the way that we've designed it. So not only are fossil fuels killing the planet, but the entire energy system is still set up on its roots of taking from the poor to feed the consumption of the rich. And our current economic model demands endless growth and endless consumption. So that's going to carry on unless we fundamentally challenge that when looking at a just transition in the global north that are not compatible with a living and thriving planet, no matter where you're getting that energy from, because it's based on extraction and exploitation. And while the basic rights to energy of the majority world are not met. And then, okay, so saying like, okay, in like a country like the UK, where we do have an awful lot of access to energy. Okay, so maybe it's fine in the UK. Well, actually, within countries, the way that we govern energy also doesn't reflect its vital importance to health and life, but instead reflects an opportunity to make profit. So gas prices are rising in the UK, and as a student doctor, I literally see patients coming in like having exacerbations of anxiety, depression, and psychosis because they're not going to be able to afford to heat their homes. That is exactly the kind of thing that we absolutely cannot have as part of a transition to renewable energy, right? Where the poorest in our communities are facing rising gas prices to the point where they're not going to be able to heat their homes. And millions of people in the UK live in fuel poverty, while private energy companies are some of the most profitable companies in this country, right? Whilst not meeting the needs of the vast majority of low-income families in the UK. And of course, we have to look at the rights of workers in the energy sector, right, which are so often violated if in global north countries, including with practices like fire and rehire, like basic workers' rights, sorry, I don't know what's going on over there, like basic workers' rights practices and unsafe working environments. And that's even before talking to the communities who are being exploited by mining companies doing some of the hardest work extracting resources. So, okay, so that was kind of a bit doomy and gloomy, but like what next, right? So we're here because we're looking into an energy transition, right? We're looking into transitioning away from fossil fuels. And what this is, it's an opportunity to reset the way that we design our energy system so that it actually delivers flourishing for people and planet. Because if we don't explicitly design for that, we're going to end up with the same system with less emissions, right? And that's exactly what we need to move away from. So a transition to renewable energy has to be rooted in dismantling imperialism and dismantling neoliberalism and classism in our current energy system as it stands, if it is truly to support the collective health and flourishing of all people on this planet, not just people in the global north and not just people who are going to have lovely, nice solar panels on their very nice houses. And that looks like degrowth in countries like the UK, right? And everyone's always really scared of what that looks like, right? But if you're growing a toxic system, then you can degrow it and you can build something better, right? Because endless growth and consumption it's not the answer. It's not like a way for us to be healthier. And if we rely on extremely unequal endless growth to meet our health needs and to meet our energy needs, then we're never going to get there. So it looks like degrowth in places like the UK, and it looks like a move away from extractivism, of building energy systems which are based on reciprocity with nature, not just extracting as much as we can. And it looks like also decentralized community ownership of energy, right? At the moment, the control of energy is deeply concentrated in the hands of companies and richer countries, but actually the benefits of distributing energy is not only like for the energy system itself. Decentralized energy systems are much more resilient to the impacts of climate crisis, but it also means like better health and well-being and better ability to engage in the actual ability to govern the life systems that support you and that support your family and that support your community. So decentralized energy systems that function on community ownership are essential. And we also need to look at governance. Is my microphone stopped working? Oh, okay. Sorry. Okay, I'm finishing anyway, so it's fine. And we need to look at how we actually govern resources in the interests of communities, right? Not just in the interests of the rich and powerful, but how we govern our energy system. I absolutely can't be an energy system based on fossil fuels. We can have an energy system based on renewable energy. But we absolutely have to center the voices of people at the front lines of extractivism, the voices of working class communities, and we have to govern those resources in the interest, because a better world is possible and a better way of organizing our energy system is possible. So that's it from me.
Thanks so much, Rian. Fantastic stuff. Well, there's probably no country on earth, actually, where this comes together more cogently than in India. And of course, we were hearing just yesterday from Prime Minister Modi about an advance to India's planned transition away from coal. So we've got a need for energy, we've got the need to get away from coal and build out renewables on a massive scale and do it all as justly as possible. So how does it look like from where you're sitting? Delighted to be joined by Purnima Prabhakaran from the Public Health Foundation of India. Purnima is not only a researcher and a consultant, she teaches, involved in communication and health sector leadership, is also Deputy Director of the Centre for Environmental Health at the Public Health Foundation of India. Over to you, Purnima.
Thank you, Richard. Hear me? Yeah. Yeah, so moving on from that very powerful exposition from the youth panelist, I think the rights-based lens is really important. But thank you for the opportunity. I'm going to stand because I want to look at my slides. So thank you for this opportunity to talk about the perspective from India. And
Purnima, just hold the microphone slightly closer to your mouth, could you? So
is that better? Yeah. Okay. So just so that I can make that connect, I thought I'll start by sharing some pictures from the ground. So back home in India, next slide. So this is a picture, a satellite picture of the Indo-Gangetic Plain, which is the northern part of India. And about this time of the year, every year, we see this picture. This is a contrast between the summer and the winter. It's not like we don't have air pollution throughout the year, but it just gets worse at this part of the year. And we have this layer of pollutants hanging over the entire northern part of the country. Next slides. Closer home, this is my city where I live in Gurgaon, which is very close to the national capital, Delhi. And this is again a contrast. The picture from our office, this is a contrast from summer and the winter scene from our windows. It doesn't look pretty, but next slide. The reasons why we are facing all of this in India is because we are still facing fossil fuel combustion for our power generation. We use brick kilns a lot. You see them spewing the fumes over there. It's very rampant, again, in the northern part of the country. We use coal, we use biomass for cooking and heating, and there is a lot of industrial activity that's spewing pollutants into the air. Next one. With all of this, we also want to talk about the vulnerable populations in India. So it's children and our women. Much of our rural population still depends on the cooking fuels. The biomass, coal, is burned for cooking and heating, and many times they have the little children sitting around with them. So it is these vulnerable parts of our population that are facing the impacts of pollution, not just outdoor, but also indoor household air pollution. Next, Alison. So this is just to place the statistics out there. This is from the State of Global Air 2020, and very nicely placed by Jane at the beginning. We have both the natural sources as well as the anthropogenic, or the human sources, responsible for both air pollutants as well as the climate pollutants. And among those, you have the power plants, you have industrial activity. In Delhi and many other cities of the country, we also have vehicular pollution. Transport is a big culprit. And we have all of these pollutants that are causing huge morbidity, but also mortality in India. In India, we have about 1.7 million deaths due to air pollution, a good amount from ambient air pollution, which is the external air, but also the household air pollution. We cannot forget the household air pollutants in our country. Moving on to actually the health impacts of air pollution, we already heard quite a bit from Jane, we heard it from Richard as well, but air pollution, I just wanted to place a few important points out here. It impacts us across the life course. So pregnant women who are exposed to this air pollution, deteriorating air quality, are going to be facing adverse birth outcomes. And children who are born small, there's this whole school of research on the developmental origins of health and research. The babies who are small are setting themselves on a trajectory for poor health, even in adult life. So you have this life course approach to the health impacts of air pollution, and right through from the birth to childhood, adolescence, as well as adult and the elderly. You see stunted growth, you have decreased cognitive potential, but also in terms of impacts on the health system, it's every which organ that you can think of. Air pollution, the evidence is really increasing now. It's not, as we intuitively think, respiratory health, but it also impacts cardiovascular health. It's one of the top risk factors now for cardiovascular health, but also impacts on other organ systems and on the elderly as well. Next slide. 3 important points I mentioned, and that one, the first one on top, is that our deaths in India most often occur prematurely. Compared to the rest of the world, 50% of the deaths are premature. We have an average of 1.7 years loss of life expectancy, and it's no surprise that the UN pegged air pollution as one of the top risk factors for non-communicable diseases. Beyond physical inactivity, obesity, our unhealthy diets, and smoking, we have the new tobacco now, air pollution. So this has been now stated as the top risk factor. It's the top of the table risk factor for non-communicable diseases. And India, next Alison, was earlier known as the diabetes capital of the world. But today we have the dubious distinction of housing 15 of the 20 most polluted cities in the world in our country. Nothing to be proud of over there. We also have a huge dependency on coal-fired power plants. 70% of our electricity generation comes from the burning of fossil fuels. Fossil fuel combustion, as we've heard from the previous panelists, are responsible for not just air pollution, but they're also important climate pollutants. And there's co-benefits for addressing these two risk factors together. Co-benefits for health, but also for a social as well as economic benefits for India. All is not bad. We do have some national response as well. We have a national clean air program, which is run by the Ministry of Environment, Forest and Climate Change, and that aims to actually reduce the particulate matter, which is the prime pollutant, PM 2.5, by 20 to 30% by 2024. And this is targeting non-attainment cities, the cities where the cities are not even able to reach our national air quality guidelines, you know. So there is a targeted approach for those 120 plus cities. And as of last night, that figure has changed. We have climate targets of achieving 450 gigawatts of renewable energy. That's now 500 since last night. But there's also a commitment since last night to increase our energy mix, the renewable energy mix, to about 50% by 2030. So we have good things to hope for, not just for the health of our populations, but also from the social lens. Rhiannon laid out beautifully the need for a just transition. Coal is not just about health. We also have to talk about livelihoods. So we do need our coal plants to be phased out, but maybe we need to phase down and then phase out because of the livelihood issue in many cities where we have our coal hubs. But that not to say that we should be dependent still on fossil fuels. We have a commitment for renewable energy, and clean energy is the way forward. And we are looking forward to taking our next steps, baby steps, but it's a good start. Thank you.
Wonderful. Thanks so much, Purnima. Okay, let me just check. Yeah, we're on. Okay, delighted that we can be, especially after the build-up that Rhiannon gave, really delighted we can be joined by Francina Nkosi from the Waterberg Women's Advocacy Organization. She's a frontline human rights defender in Lefalale, which is a mining community in Limpopo province, an acting convener of a national coordinator for women affected by mining, United in Action. Francina Nkosi, over to you.
I will do just a short video so that people can see who they're speaking with. And I'm going to close my video because my network connection is bad. My apology for that. Greetings, everyone. And everyone who's there, protocol observed. I want to talk about the cry of Mother Earth. As Mother Earth, I give you indigenous seeds, indigenous plants, I give you water, I give you land to plow. I also give you oxygen. But for you to give me the oxygen that you breathe, then you return with the detox or the killing of the Mother Earth. I breathe, I can't survive. You killing me as Mother Earth. Where are you going to live if you kill me? When you plant, I give life. But you don't give that life back. You give death. Let me end there for the cry of Mother Earth. I want to speak about the just transition. The gender equality is a reality. And when women are under poverty, they are usually unable to afford good health. And why is that? It's because there is this monster we call power station, we call mines, because they bring the inequality and they bring misery. With that, there's people who are relocated unlawfully. They are sicknesses that are caused. I can talk about community, mining affected community challenges. It will take me days, but I don't want to go there. Where I live, it's a hot place whereby South Africa, if decides to opt to just transition, we can generate electricity. I'm here generating electricity for South Africa, but I speak to you, I'm affected by load shedding more than others because our government is more on profit before people. We have a climate justice now campaign that is called a Green New ESCOM. That is transforming power, and that is transforming South Africa. And the objectives of it is that we need skills jobs and training programs for sustainable jobs, because if it's not that one, then those jobs of coal, they kill. We need to expand the insufficient basic free electricity because people can survive due to the load shedding. We are promoting the free, prior, and informed consent because we want just transition plan. The green industrialization policies that will help South Africa a lot. Remove the constraints on renewable energy. Our government gives opportunities to big companies. They don't recognize communities. They don't want to empower communities to do a social owned project that will be sustainable, that won't cause more sicknesses. No to continue tariff hikes. That's what I'm talking about. ESCOM. There is price hikes, there is load shedding, and this is what we call energy is a woman's issue. And this is a human violation. And for us who are the front lines, we are seen as people who are against projects. And we are not against, but we are saying we need accountability, transparency, inclusiveness, and skills for communities because there is a high rate of unemployment. And with this high rate on unemployment, it causes the gender-based violence because everything connects. If you talk about gender-based violence, it connects with unemployment. It connects with health impacts. Because with those health impacts, where will a person get money to get assistance of health? Because they are unemployed and they are under poverty. And that is what we call inequality. There is no equity, especially with women who are in the rural areas. Youth, they are never been given opportunity with skills. We have the fourth biggest power station called ESCOM, but they've never done that. People now, when you look at them, they're unemployed. Some are sick, and that leads to what? To suicide. And with that, it means now we're losing more death then that's why we say we're promoting the Green ESCOM campaign so that we promote the just transition for communities to have jobs that are sustainable. And with that, we can achieve. With that, we can promote more jobs. With that, we can have a society that is not sick. With that, we can restore our Mother Earth so that our Mother Earth can be able to produce more food, more water, and more life. I thank you.
That was very evocative. I'm really delighted we got the technology working. We could hear from you. Okay, so we've got a short time left. I've got a whole stack of questions I could be asking, but I'd much rather take your questions and your comments. Both people who are here with us at the WHO Pavilion at COP26 and those people who are joining us remotely. So anyone right in front of me who's got a question or a comment for any of our panelists, stick your hands up and I'll pass the microphone over. Okay.
Do I keep it? Do you hear me? Yes. So thank you for the presentations. I'm a lawyer working on air pollution standards, but I'm a bit worried about an information in the last IPCC report. I don't know if you noticed that, but the fact that actually the diminution of sulfur in the atmosphere could actually create warming in the atmosphere. So what do we make with such a message when we are dealing with air quality policies?
Thanks. Jane, perhaps this is one for you because you used to head up the greenhouse gas inventory for the UK, so you're probably the best qualified to take this one.
Thanks. Well, I don't know what to say other than I agree that that's worrying. I mean, so it's reflective. So when sulfur dioxide, for those people who didn't read that specific bit of the IPCC report, when sulfur dioxide is emitted mostly from coal-fired power stations, it reflects light, so it does provide some cooling. It's emitted, though, alongside other things like carbon dioxide and black carbon, the reduction of which at the same time by closing the coal-fired power plant will decrease warming. But I'm afraid I don't have the figures on the balance there. I know that the sulfur dioxide is a short-term effect, but it's a difficult fact.
One of the most interesting things I found in the IPCC report was where they sort of talked more about the need for a quick methane transition, because you get that short-term reduction in warming impacts if you reduce methane, which counteracts that short-term loss of that short-term cooling effect you get from if you reduce sulfate aerosol emissions. So that was interesting. Now, I believe we've got a question or comment. Okay, Rachel, do come in on that then.
I let Alison know I'd be happy to respond to that question, but actually, Richard, it was to make exactly the same point that you did.
Right.
That by tackling methane at the same time, we can counteract the kind of sort of loss of cooling effect from the pollutants. And so one of the things that we're looking at the moment, I just talked about our research on coal in cities, but we're also going to be looking at gas. And it's incredibly important that we transition away from things like from coal towards renewable energy and not rely on natural gas because of things like methane leaks. So I think it's a really great question from the member of the audience. I think it shows that we need to be holistic and joined up and also think sort of short-term and long-term at the same time in how we tackle climate change, as well as improving sort of health and ensuring a just transition, as everyone's been talking about. But yeah, I was going to make the same point you did. So.
Cheers. Thanks, Rachel. And a couple of very relevant things coming up today here at COP26, a new partnership on methane, and also we're expecting an announcement on a just transition for South Africa with funding coming in from several Western countries. Now, I'm just going to move over here. You have a question or a comment, sir?
Yeah, thank you very much for your really great presentations. This is a question directed at Rob and at Purnima in particular. So if coal is deadly and coal exiting from coal is the single most important thing we can do to reduce air pollution, I'm wondering what you guys think about countries like Germany that have decided to exit from nuclear, but are keeping a large amount of coal burning in their electricity mix.
Cheers. Robert, would you like to take that first then?
I'll take that partially, mainly to say that that's not an area of my expertise. I mean, I think where, what our research says is if we stop burning fossil fuels in and around and within the air sheds that we live, our health will get better. So you can apply from that. You can extrapolate from that. It's very clear that the types of transitions we need to be absolutely radical. We need to be, and this is perhaps what, I don't know if I mentioned this, but one of the things that we did in our research is we didn't look at an incremental, slow, cautious pathway of decarbonisation. We actually tried to listen to what younger people have been telling us and hanging from bridges telling us and, really shouting loudly, is to say, be radical. So don't look at this sort of incremental shift, because that shouldn't really be on the agenda. That's just enough to make us feel better, but not probably enough, it could be a distraction. So I guess it's sort of not really answering your question, but what I would say is that I think our research shows that if we are bold and ambitious and kind of radical with how we stop burning stuff where we live, put it simply, don't need to use complicated language about particulates. We can talk about stop burning things and premature babies, not, there's human stories here. If we do that, it's going to be good for our health. And by the way, young people who will inherit the earth and who are there's an intergenerational justice want that. So I guess that's sort of a way of not really answering a question, other than to say I think that the right change is to stop producing fossil fuels from a kind of public health perspective.
And sorry, I've forgotten. Was it Purnima or Rachel that you wanted to hear from as well? Purnima, okay.
Yeah, thanks, Rob. I think I'll just add to that, just to say that, the evidence is loud and clear and coming from every part of the world. I think earlier it was just the developed countries, but even now in countries like India, there's increasing evidence now that there is an impact on health. And that's across the life course. I mentioned that before. It's the children, it's the elderly, and it's the demographic dividend. All your working population, they're exposed to unpardonable levels of air pollution. So I think there is no two ways about it. You have to transition away from fossil fuels. I think the health lens to that argument is important.
Great, thank you very much, Purnima. Now we have one question, do we, Alison, coming in from the audience?
Question in the chat.
Francina, did you want, or Rachel, did you want to come in on that? No. So I'm going to exert chair's privilege, if I can, and ask a question to you, Rachel, and also to Rob. You talked, interesting, Rob, about the way that you found young people actually wanted to have a say in how the city evolves and cleans up and so on. So I'm wondering, what does one do with that? What's the model for implementing that?
Yeah, I mean, well, I'd say the first thing you need to do is you need to recognize you've got a problem at the moment, which is that we have institutions, whether it's voting ages, the opportunities people have to engage in kind of parliamentary scrutiny. Adults can often ask a question of lawmakers, or children often can't. So you've got to look at your systems through which we're engaging young people. So recognize there's a problem, and then create a whole set of systems where we can actually, I guess, not treat young people as a kind of a nuisance or a kind of noise, but actually as an asset, where we're in this radical period where we need to be bold and ambitious. And actually, young people and the energy and the ideas they bring are a resource. So I think it's about flipping our mindset and flipping the mindset of the kind of pale and stale people who are in charge, and saying to them, look, you need to get with this or move aside. So I mean, that's me not speaking so much as an academic, but as a parent and as someone who's looked at what we found through this survey of like over 3,000 young people across the world. It was really loud and clear. They both have the ideas and they really want to be more engaged.
And Rachel, you were saying you've got 60-odd cities where pollution is a real problem, and obviously you've worked with one particular city in the UK. What models can you offer us for engaging young people in the development of a city for positive ends?
Well, I think the work that Robert's already talked about is really powerful. We have a youth council at C40. We've been working very closely with a number of organisations, including Fridays for the Future, and we're trying really just to engage and co-develop and co-design solutions and have a shared understanding of the problem and what the solution might be. So I think as Rob said, acknowledging there's a problem, listening to people about what kind of solutions they want, engaging and involving people in developing those solutions, particularly young people. And I think one of the things we've done an awful lot of work on at C40 is how we make sure that climate action is inclusive. So, as I said, engaging people in defining what the problem is, defining what the solutions are. And I mentioned earlier that there's an awful lot of examples given in the report where there's specific sort of examples of what cities have done. I can't do justice to that now, but people can go and have a look at those.
Okay, thanks very much, Rachel. I just wanted to. We've got a couple more. Okay, in this case, I'm going to abandon my other questions, great though they were, and just take a couple from over here. So, young lady behind you first.
Thank you very much for all the presentations. I'm Rosaria Pileci. Can you hear me?
Can you hold it closer?
What should I do?
Closer.
Okay. So I'm Rosaria Pileci. I am R&D responsible of a company, a biotech. No, can't you hear me? Okay, this way. Is it better? Great. Okay, so I'm Rosaria Pileci. I'm R&D responsible of a company called UR Biotech. I have also a PhD in atmospheric chemistry and physics and focus on black carbon science. So very keen on this problem. So my question is, we all a comment in the question at the same time. So we all agree we should work on cutting the emissions and also on trying to fasten this technological and industrial revolution and transition. But in the meantime, because we know that this is not immediate, unfortunately, in the meantime, what else can we do to meet the WHO indoor air quality guidelines? For example, what about the use of good practices and indoor air purification system? And as a company, how we can help poor people and who cannot afford the cost of this transition in use these new technologies. Thanks.
Sorry, I know there's a few more questions, but we're really short on time, so I'd love to throw that over to Francina, if I may, because obviously, you know, you've talked about, Francina, the South African transition that needs to happen. It needs to be just, it needs to be fair, but some of these things are going to be pricey. What is the secret to getting the just transition in South Africa?
Just transition is that, as you know, South Africa is rich with minerals. And with that money, it should have supported the just transition. That's what my colleague is saying. We need a system change, because with that system change, we'll be able to have the just transition plan, whereby communities will be involved, because we have the entrepreneur that are brought up locally, but our government doesn't give them on the opportunity. But if they can be given that opportunity, that will be able to give those locals the skills and also reduce the unemployment. And that way, it will also assist with those who are having a challenge with paying for electricity. Because the renewable energy will be cheaper, safer, and accessible for all. And it will be a way of saying you can use the land again rather than relying on coal, whereby the land needs to be rehabilitated and it costs money. But with solar panels or wind or the biogas, that doesn't need anything extras. It just needs natural sun, then you generate electricity. With the biogas, you just have those waste. Then you can be able to cook. That way it will reduce the poverty. I thank you.
Great, thanks very much, Francina. I just want to give a very brief final word, if I may, to Rhiannon. You gave us a really big challenge earlier, Rhiannon. We need the global energy transition.
Yeah.
The future of extracting material for solar panels and so on can't be like the extractive future we have now, right? So what's the secret? Because obviously large parts of the developing world need energy as well.
Yeah. Yeah, so there's definitely like no conflict between a just transition and like the ability to produce energy and have energy for lots of people. I think to be honest, the answer to this question is very deeply linked to the answer to the earlier question about involving young people, right? It's actually just not that hard, right? So Boris Johnson stood up yesterday in his leader speech and he quoted Greta Thunberg. He took the liberty of quoting Greta, and whilst at the same time his government is set to approve up to 40 new oil and gas projects, right? So don't stand up and give speeches saying that you're listening to young people and only do that like with your voice, whilst like legally and with your government policies going against what they're demanding. Indigenous youth from Mexico and Colombia are outside COP, like they're not inside, right? So like yesterday, like Fridays for Future Mapper, their press conference is outside COP. Some of them sailed here, right? Because they're not inside, they're not in these decision-making spaces because they're so exclusive and because this isn't where the real power lies, right? The real power lies in those communities, in the people at the front lines of change. And it's not about, well, obviously, like technical questions are important, but a lot of this isn't about technical questions. It's about power and who we give power to. So I would say that we don't know what a new system is going to look like because it would be silly to word by word completely prescribe a new system. But what we do know is it should be different people in charge and it should be different people making those decisions. And yeah, so that would kind of be my answer.
Lovely. Thank you. This is one of those events I really feel we could go on for another hour, but we can't. We have to stop right now. So I just want to thank all a fantastic panel sitting in front of you. Robert Hughes, Rhiannon Osborne, Jane Burston, Purnima Prabhakaran, and joining us remotely, Rachel Huxley and Francina and Cozy. I think I forgot to introduce myself earlier on, but I'm Richard Black and I run something called the Energy and Climate Intelligence Unit. And a massive thanks to Alison Doig at the back who put this whole thing together. Hope you've enjoyed it.
Thanks, Alison.
Shall we go? All right, we're going to start the session now. I think you can all hear me on the headset. Is it okay? Yeah, all right, it's great that it's working. So good afternoon, everyone, and thank you for joining us today for this 60-minute session that we are organizing on the title, Achieving the Paris Agreement and Preventing the Next Pandemic, the case for transformative, climate resilient and healthy food systems. So first, let me thank the WHO for hosting this session and organizing. We know all the challenges with COVID, with masks, with headsets, with stream, with like hybrid formats. So it's really, really great that it's working today. And I would like also, of course, to thank our partners and friends that are co-organizing this event, the Buddhist Sushi Foundation, the Humane Society, and for Pause. And it's great, sorry, that we could all make it in person today. So my name is Rafael Potselva, and I work as head of UN advocacy for ProVeg International in Berlin. I will not take too much time because we have a pretty short session, but to say a few words about ProVeg International. We are a food awareness organization with a clear goal. We want to reduce the consumption and production of animal products by 50% until the year 2040 and accelerate the shift towards more healthy, climate resilient and plant-rich diets. We have offices in 9 countries, including the US, the UK, South Africa, and China. And we work with various stakeholders as policymakers, the private sector, schools, or health professionals. We also opened 3 years ago the first plant-based startup incubator. So it's also the topic of food innovation is also a topic that is interesting us a lot and that we try to frame towards more healthy and plant-rich products. This year, we also launched the Diet Change, Not Climate Change campaign, with partners all over the world and with a clear goal, having plant-rich diets, having a shift towards more plant-rich food systems included in the nationally determined contributions of countries. So make sure that the next COP, the coming COPs will be much more on food systems because it's a topic that is missing this year in Glasgow again. Now let me get back to the topic of this session, which focuses on the Paris Agreement, pandemics, and shifting towards more plant-rich food systems. Animal agriculture accounts for something between 14.5% according to the FAO, and that's 10 years ago, of greenhouse gas emissions, to 20% because we have like studies now that are very credible that we also we've been always very cautious with these numbers, but it's clearly more than 14.5% of greenhouse gas emissions. And despite this, we see that it's lacking in dietary lacking in the national determined contributions, and that a lot of countries are also not doing a lot to really reduce meat consumption, to actually, in a lot of countries, make sure that the average person can follow actually the dietary guidelines, which are often recommending something between 3 to 4 times less meat than what is consumed in reality. So we think that it's really time to have a level playing field for the plant-based sector, for example, in the economy. It's a time also to reform, for example, taxation, subsidies, to lead by example in catering, and that's great to see some progresses at the COP this year where we can also have much more options for plant-based foods. But we really have to create this enabling environment for consumers to make healthier and more sustainable food choices. So I will stop here and just introduce our first guest who will come by video and send us a video message. It's Jens Tweeder who is our international director and special advisor to the CEO at ProVeg International. He created and leads the Cellular Agriculture Project, CAP at ProVeg, and also consults policymakers and the private sector on the potential of plant-based and cell-based alternatives to animal products. Jens is a strategist specialized in food system change, and he is leading the team that was writing the ProVeg Food and Pandemics report. He will now tell us why, in a video message, we have to make the link between our broken food system and the challenges of pandemic. So we can now launch the video.
Help us achieve the Paris Agreement climate goals and prevent the next pandemic. Just like AIDS, Ebola, swine flu, and bird flu, COVID-19 is a zoonotic disease, which means that it was originally transmitted from animals to humans. Transmissions of this kind are made more likely by our use of animals as food. 3 activities stick out here. Intensive animal agriculture crams huge numbers of genetically similar individuals into factory farms. Animal agriculture is also the main cause of biodiversity loss, increasingly destroying natural habitats for pasture and feed crops. And using wild animals for food reduces species diversity and exposes humans to novel pathogens. These activities are creating the perfect hotbed for the emergence of potentially dangerous pathogens and the spread of disease. At the same time, animal agriculture is a main driver of climate change, accounting for about 20% of global greenhouse gas emissions, while also causing large-scale deforestation. Climate change, in turn, is a zoonotic risk multiplier. Higher average temperatures can shift the habitats of both animals and pathogens, resulting in higher risks of new infectious diseases emerging. And COVID-19 has demonstrated the massively disruptive impacts of a zoonotic pandemic on individuals, healthcare systems, jobs, the economy, and societies at large. By monopolizing our attention and resources, and by affecting our economies, pandemics can have detrimental effects on combating climate change. It is easy to see how this is a perfect vicious cycle. And these activities are all accelerating due to the ever-growing demand for animal-based products. With every factory farm we build, and with every natural habitat we destroy, we increase the risk of future COVID-like events. And with every steak we eat, and with every forest we cut down for pasture or feed crops, we contribute to climate change, which in turn increases zoonotic risks. All of this constitutes a highly destructive interplay, fueled by our food choices. We are literally eating our way to climate change and to future pandemics. The solution is simple. When it comes to sourcing food, we need to take animals out of the equation. People don't want to use animals for food. They just want to consume certain products. Think of video stores and streaming. People don't want to go to a store and rent a film. They just want to watch the film, which is why Blockbuster went bankrupt and Netflix is now $1 billion business. Today, new food technologies can provide plant-based, fermentation-derived, and cell-cultured alternatives, making the future of meat, eggs, and dairy a future without the animals and a long list of negative side effects. What we are currently witnessing in the food system is not a trend, but a transformation. 42% of the global population already identify as flexitarian and are actively reducing their consumption of animal products. And it is predicted that by 2040, plant-based and cultured meat alternatives will account for almost 60% of the global meat market. Food systems transformation is not something we need to start from scratch. It is in full swing already. Scientists, investors, producers, and the wider public have understood the message and support it. We need diet change, not climate change. We need to put food systems on the climate agenda. Now it is time for governments and policymakers to follow suit and help provide the best conditions to accelerate this process by supporting innovation of alternative proteins, supplying an equal playing field for them, and ensuring a just transition that creates opportunities for all stakeholders. Shifting to a healthier, more resilient and sustainable global food system that replaces animal products with better alternatives can become a multi-problem solution. A solution that not only helps to prevent future pandemics and mitigates climate change, but also addresses further crises such as world hunger, non-communicable diseases, and antimicrobial resistance. A transformational food system that overcomes our dependency on animals will be one of the most significant cultural achievements of humankind. And it will be instrumental in preserving our way of life, our health, and the health of our planet. You can find our detailed food and pandemics report on proveg.com. Thank you for being part of the solution.
Wonderful. Oops. Oh, I hear myself pretty loud now. Thank you. I speak without the mic, without the headphones. So thank you very much, Jens. I think Jens is with us on the stream. I would now like to introduce our first speaker on the panel, Martina Stephanie. Martina, you are International Director of Farm Animals and Nutrition at 4PAWS, Vier Pfoten. You have a PhD on human-animal relationship. You have 20 years advocacy experience. And just to say a word about 4PAWS that we work with quite a lot in Germany and on the international stage, you work on establishing a just food system that takes factory farming out of the equation. So you want to speak a little bit about pandemics, and I'll let you the floor now. Thank you.
Thank you. And I will stand up to make sure that you can see me and to also make sure that I can see my presentation. So I choose a quite lengthy title, and that is COVID-19 and the interconnection between human well-being, animal welfare, the environment, and pandemics. So why did I do that? Because it's actually the title of a future study that 4PAWS just published a couple of weeks ago, just before the WHO conference. And actually, what we did here is we talked to 29 scientists from various fields, from virology, environment, ecology, human welfare, and of course, veterinarians. And we asked all of them, how should we approach pandemics? Should it be symptom control? Should it be preparedness? Or should it be prevention? And maybe it's not such a big surprise that all of them agreed that we should go more towards prevention. Next slide, please. What is interesting that the majority of these scientists agreed that animal welfare is significantly underestimated when it comes to the prevention of pandemics. And that's interesting because, as I said, we didn't just ask our friends from HSI and ProVeg, we asked scientists from all over the fields and from international backgrounds. So, next slide, please. If we look closer on infectious diseases, we can see that 75% of them are zoonoses, and 50% of zoonoses are caused by agriculture drivers. So my husband asked me yesterday, are you talking about tractor drivers? No, I'm talking about animal agriculture here. That's driving zoonosis. And that's interesting, but these are just numbers. What exactly do we learn from these numbers? Next slide, please. We can see here that we have a truly broken relationship between humans, animals, and the environment, because actually zoonoses are a symptom of this broken relationship. What we know is that whatever we do is interconnected with environment and animals, and actually we can see that zoonoses show this broken relationship and how it can backfire, whatever we do to the world. Well, probably one of the most ugly manifestations of this broken relationship is wildlife markets, it's fur farming, and for sure it's factory farming. Let's have a closer look at factory farming. Next slide, please. So factory farming is such an undysfunctional system that the animals have to be put on antibiotics to survive a couple of weeks until they die. It's interesting because 80% of the antibiotics flow into animals, while we know that antibiotic resistance is one of the biggest threats, according to the WHO, to human health. So that's a bit a sick system. So we need to acknowledge that factory farming is a perfect breeding ground for pathogens to amplify, mutate, and spread, because these animals are kept in very high density, they are on poor health, and they are stressed. So that's actually a perfect situation for a virus to spread. Next slide, please. What we learned from COVID when it comes to factory farming and generally our food system is that people started right away to choose new habits. They bought their own. Canteens were closed, restaurants were closed, and so they went shopping and they chose more plant-based foods and also, let's say, better meat from better quality and for higher prices, which is at first sight a good thing, but the problem was that the farmers were not able to sell their goods, to sell their animals, to sell the products. And that, for example, led to, in the UK, only 1 million liters of milk being dumped every day of lockdown. That's a lot. And also mass culling of animals, because the farms were overcrowded. And I won't go into details of culling methods, but I can tell you it's an ugly thing, and it's not nice to choke from foam or to die because of heat stress because someone just turned off the ventilator. So, and all of this is happening while we know that factory farming is one of the biggest drivers of the climate crisis, it's one of the biggest drivers of biodiversity loss, and it's actually the most likely reason and breeding ground for the next pandemic. But enough of these negative news. Let's go to the next slide. What do we do with this? So the good thing is that many international organizations like WHO, OIE, FAO, and others acknowledge the One Health system that acknowledges the interconnectedness of humans, animals, and the environment. The problem with the system is that it doesn't go far enough because health is actually an outdated way of thinking. Health is nothing, human health is nothing that exists in a vacuum. Human health is interconnected. And what exactly is health? It's more than the absence of sickness. So if you see me now, you can guess probably she's healthy, at least she doesn't look sick, but you don't know how I am, because health should also be about well-being. And I guess animal welfare is a good example, because we can try to read how well an animal is if we look at 5 domains, and health is just one of them. It's health, its environment, its behavior, its food, and its mental experience. And that's why the concept of One Welfare should be added to the One Health concept to make sure that we look at the whole picture. Next slide, please. Well, the scientists that we asked about how to tackle pandemics agreed that prevention should be the focus, and they also agreed that we should really tackle the root causes of spreading viruses, and that means actually the reduction of the animal population globally. We're talking here about 50% until 2040, and we are also talking about an end to factory farming, meaning much more plant-based food, meaning research and development on cultivated foods, and also meaning better welfare on the farms that still exist in future. The good thing is this would not only be good for animals and for human health, it would also minimize the negative impacts of economy. We would provide antibiotics for the next generation. It would have a positive impact on the climate crisis. And of course, we could protect water, crops, and biodiversity. Next slide, please. So if we look at the program of COP26, we cannot really find animal welfare or animal agriculture in there. We're hoping something will happen on Saturday. We're not quite sure. But I mean, it should be at least a one-day headline, if not more. Why is that? Why is there this lack of political will? So, of course, we know that the economic interests are still tied to the key drivers, and you can simply make money with factory farming. Then still there's the assumption that factory farming, meat and dairy, would be good for human health. We know actually it's quite the opposite that's happening here. And also people like what they know, and there is always some hesitance towards change. Next slide, please. Still, if you really look at the economic benefits, we know that setting up a new food system, of course, would cost money, but it would be much less than just the cost of the next pandemic. And if you also think of the cost for the climate crisis and biodiversity loss, that's huge. There's a study that actually says that building up a new food system would only be 2% of what the pandemic cost until now. So it's a tiny bit of that. Next slide, please. So when we come to the conclusions, there are clear learnings from COVID-19 and also from the latest IPCC report. And we should really learn from that and not just go on as we did. And I mean, animal welfare organizations and others, of course, are asking since decades for an end to factory farming. But now we have the true chance to really do that, because actually the scientists all agree that this needs to happen. And we're asking here for nothing less than a paradigm shift towards an economy of well-being, towards an economy of only growth. Next slide, please. So what now really needs to happen is pandemic prevention plans and climate action plans and national determined contributions to acknowledge animal welfare and to chart a path to reduce the number of animals farmed globally. This is the chance to really change the food system and to build a resilient future, and also to heal our relationship with animals and nature. Thank you.
Thank you so much. Thank you so much. Really great, and I couldn't agree more. I hope also that we will get a food day, especially in this context, having had the food system summit this year, etc. We really hope to have it more on the agenda of COP. It's not the case yet, but we will keep working on this. I would now like to introduce our next speaker, Claire Bass, who's working with the Humane Society International UK, HSI, as an executive director. And we appreciate a lot working together also with HSI on the cow in the room on diet change, not climate change. And you're going to give us some insights, maybe also on food systems now. Thank you.
Thank you very much, Raphael. Just take that off. I guess the question on everyone's lips at this conference is will it amount to anything more than a lot of hot air, which is the problem that we've obviously got. And one area clearly where the political appetite and ambition is lagging behind the science and the need for action is animal agriculture, as we've heard. And I want to kick off with a terrifying and very sobering fact, which is that by the time I've finished speaking to you today in under 10 minutes, around 1.2 million animals will have been slaughtered for food globally, as of the 88 billion killed every year. That is an astonishing number. And it's no longer under dispute that animal agriculture at its current scale is bad for our health, as Martina's told us, and also bad for the planet. But unlike all the conversations we're hearing at this conference about curbing fossil fuels, alternative energies, great commitments towards phasing out petrol and diesel cars by 2040, animal agriculture is actually still growing. And if we carry on with the current trajectory of growth, then in the next 10 years, the livestock sector will account for almost half of the emissions budget that the world needs to limit warming by 1.5 degrees by 2030. So even if we stop all fossil fuel emissions overnight, which is obviously not going to happen, current trends in world food production would mean that we would still not keep to the 1.5 warning that we're aiming for. We're in the Health Pavilion, so a quick mention to follow on from Martina's comments about the toll that excessive meat consumption takes on our health, most notably in Western diets. Very strong links of excessive meat consumption to various cancers. I still personally find it absolutely staggering that in 2015, 6 years ago, the World Health Organization classified processed meats like sausage, bacon, etc. as a Group 1 carcinogen, a substance known to cause cancer. And our collective response to that globally has been to increase production and consumption of those products. It doesn't make any sense. And Martina mentioned obviously the zoonotic threats from animal agriculture, confining animals in awful, unnatural conditions, trading them over long distances in appalling conditions, encroaching on wild animals' habitat to make space for animals to be farmed. It's entirely conceivable that the next global pandemic will find its home in a factory farm. If we look at the knife edge that we're on with avian flu at the moment, it could well be, in that realm. And of course, the antibiotic use that's used to keep these animals, from dying, is causing antibiotic-resistant strains of bacteria. So that's the problems. We have many, many reasons to curb animal agriculture, but the question is, how do we, how do governments, how do businesses, how do individuals make that change happen? And we feel that obviously the first step is acknowledgement. The link between animal agriculture and climate change is now inescapable, but as Raphael mentioned, is strangely quite missing from the main agendas at this meeting. And policymakers are a bit prone, we found, to using a lot of smoke and mirrors to talk about sustainable farming and transitions in agriculture and low carbon farming, without really setting out what success looks like. And we need governments to set reduction targets for animal agriculture within their nationally determined contributions, and then to create a supportive landscape, both financially and in policy terms, to enable and incentivize farmers, businesses and individuals to reach those targets. At the moment, governments, including my own government, the UK, are very disappointingly unwilling to grasp the nettle and publicly acknowledge that our diets need to change. We recently had published a national food strategy, many of you will know, which recommended a 30% reduction in meat consumption over the next 10 years. Excuse me, and we're waiting for the government's response to that. But if the UK's net zero strategy, published a couple of weeks ago, is anything to go by, then we might unfortunately have to be prepared for disappointment. So the Net Zero Strategy is a 367-page document that uses the word agriculture 60 times. It talks about sustainable agriculture, agricultural transition, low-carbon farming, but not once is animal agriculture, livestock farming, singled out for decisive action and reduction. And where mitigation is indicated, it's quite nebulous, it's target-free, and it pins its hopes on technological fixes like methane-reducing feed additives. 10 days ago, our government Department for Business accidentally released a report that they'd commissioned looking at behaviour change towards climate change goals, and it included options for normalising plant-based food. They quickly then took the report down, retracted it, and sorry. And the government issued a statement to say that it had no plans whatsoever to dictate consumer behaviour in this way. Now, this is the point. We're not asking governments to dictate diets. We are asking them to set meaningful targets and to work proactively with businesses to inspire and enable people to make better food choices. And in fact, there was a recent survey from the think tank Demos reveals that in the UK there's actually considerable support amongst the public for a government-led meat and dairy reduction campaign working in conjunction with supermarkets, and we've seen some really promising words from Sainsbury's to that effect at this meeting. A poll we commissioned with YouGov just this week corroborates that and shows that only over 50% of people in the UK support the idea of the government actively promoting the benefits of plant-based food choices. So a large section of the public is already ready for change, and our own experience, Humane Society International, working with the food service industry, shows that they are more than willing and ready to make shifts towards plant-centric menus. Globally, our Forward Food programme has knocked on open doors and trained almost 3,000 chefs in plant-based cooking and led to dozens of institutions measurably reducing their meat procurement. In the UK, we're working with the three biggest food service companies, Sodexo, Baxter Story and Compass Group, working with their innovation teams to create new exciting plant-based menus and delivering many trainings to universities across the UK. And our trainings aren't just about teaching chefs things they already know. They provide a toolkit to inspire creativity in plant-based cooking, to introduce them to new ingredients and suppliers, and also talk to catering teams about the psychology of plant-based food choices. A key hurdle we find often is the outdated notion that veggie or vegan food is it should be on the periphery, that it's a sort of annoyance and like an added thing that you have to do to cater for awkward vegans or veggies. And based on extensive research, we advocate for plant-based options to be integrated fully into the normal menu, to be clearly labelled, but labelled in an appealing way so that it doesn't put meat eaters off, thinking, oh, well, that's maybe not for me. All of our Forward Food services are offered free of charge. Oh, sorry. I haven't got COVID, I promise. With only one ask in return, that the institution makes a meaningful, measurable commitment to transitioning their menus to be more plant-based. And ideally, we ask them to cut their meat procurement by at least 20%. And we're all about measuring impact. That's really, really key. It has to be about actions and proving their value, not just words. So we do greenhouse gas assessments to show taking a deep dive into companies' procurement data, which is sometimes very complicated, and enables them to show the impressive carbon footprint reduction they can achieve with lower meat menus. So change is happening in food business, and as Raphael said, the growing plant-based menu at this conference is a welcome sign of this, but we need governments to put more than a tentative toe in the water on meat reduction, and we need them to stop seeing the promotion of plant-based diets as some kind of draconian threat. So lastly, to conclude, where to start with all this? Well, we have some reports which we're happy to, we'll leave on the table at the back there, which please do take a copy. It has a series of recommendations we have that governments should be taking at this conference to augment some of the dialogues that are already taking place. But we really think an obvious first step for governments is to lead by example, by embedding meat reduction targets into public procurement policies. Governments are often the largest buyers of food products, and so setting ambitious targets for more plant-based food in schools, hospitals, prisons would have a huge impact. Transforming our food system is a huge challenge, but it's a challenge we can rise to in the way that we have risen to other threats such as global wars, pandemics like the current one, by working together. And it's critical that we use this conference to do everything we can to talk to people about moving beyond the status quo of ignoring the cow in the room towards a proactive farmer to consumer inclusive strategy that delivers a more sustainable, future-proof, plant-based future for all. Thank you.
And I think, yeah, it's important also to acknowledge that even though like we are very, very far away from what we need to do, there is like something moving. We feel that also governments are starting to talk about reduction. Yes, it's not enough, and that's we are like coming also like this Thursday with a press conference with like new reduction goals. We will have a press conference at 3:30 p.m. And we will also like try to show what do we need as a reduction like to really achieve the Paris Agreement, especially in Europe. Now I would like to introduce my last guest. This is Dr. Ming Nan Lin from the Buddhist Tsushi Foundation, a good friend of ours. And I know you have a long presentation, so I will keep it short, and we'll try to stick to 10-12 minutes.
Okay.
Thank you.
Thank you very much, Raphael. I'm Dr. Ming Nan Lin from Tzu Chi Hospital. It's really my honor to be here. Because all the Tzu Chi Hospital, we provide only plant-based diet. And all the Tzu Chi Foundation, all the around the world, we provide only plant-based diet. So today my topic is talking about not only for plant-based diet, but how to reduce the environmental impact by healthcare sector. Because healthcare, we are now in WHO Pavilion. So health profession is, I think that is one of the most trustworthy profession in the world. So how to deliver the message of the environmental impact, climate change and health is, I think, is quite important. So next slide, please. Next slide. Next slide, please. So we are talking about the change. So next slide, please click. Please click. We are talking about why and then what. Next. Click, please. And then next. So I think we are all here. We all know why we are here, because the environmental impact is very important. But what and how? I think we had to know more about how to reduce the climate change impact. Next slide, please. So we are all talking about action. For healthcare sector, we care the personal health, but we need to care more about the planetary health. But the policy is there, but how to put it into practice? Next slide, please. This is why, the vicious cycle. Next slide, please. Because the climate change, we have a lot of direct impact of the health from climate disaster or from vector-borne disease, waterborne disease. They will increase the burden of healthcare sector. Then, in turn, it will increase greenhouse gas emission from the healthcare sector. Like Brazil healthcare sector will account for 10% of the total current country energy consumption in Brazil. Next slide, please. This is the what. Back in the year 2017, World Bank Group published a climate smart healthcare, low carbon and resilience strategy for the healthcare sector. Next slide, please. Next slide. And this is the year, this year in January, WHO guidance for climate resilient and environmental sustainable healthcare facility. All this talked about what we have to do, but how we do it in a hospital. Next slide, please. This is the WHO, the 4 fundamental requirements for hospital to be a more climate resilient. Next slide. Next slide, please. And this is a global green and healthy hospital by Healthcare Without Harm. It's also a very famous NGOs. And they have like 10 goals from leadership, chemical waste, energy, all these kind of perspective to make the hospital know how to reduce the climate impact. Next slide, please. So this is climate climate smart healthcare, leadership and governance, mitigation and adaptation. Next slide, please. And so in the hospital, we have like a health promoting hospital community. Besides taking care of the patient, staff, community, and also we have a team working on the environment. Next slide, please. And this is I think this is the biggest healthcare organization in the USA, Kaiser Permanente. They have their policy. They said they have a VP for sustainability. Back in the year 2016, they have the goal for by the year 2025, they will have net positive carbon emission. I think this is policy but how to put into practice? Next slide, please. So this is our Green Hospital program. We don't use paper. The paperless, we use the whole electronic system to see the image, the patient data, and also the laboratory. All data can be accessed through single line, single monitor. Next slide, please. And then for the utensils, we don't use disposable utensils. So we calculate how much waste we can reduce in a year, in 12 years. Next slide, please. So for the detailed classification of waste, we put like 9 recycle bins to segregate in detail, and then we can recycle more correctly. Next slide. And then click on the video, please. Click on the video. So this is in the hemodialysis room. We have friends from foreign country. When they want to segregate all the waste, then we put 9 recycle bins, and we put their language, different languages, in the hemodialysis unit, so they can segregate more correctly. Next slide, please. And then we have recycle bins in the whole hospital campus. Next slide. And then this is green building design. We have sunshine in hospital, nature light in the lobby. Next slide, please. And then you can see you can reduce the illumination, the electricity. Next slide, please. And also we have a garden within the hospital within the garden. Next slide. This is a Skyline Garden. This is Taipei Tsuji Hospital. Next slide. And then also we have an intelligent building energy monitor system, how to reduce the energy use, different department, different building, and how to reduce it. Next slide, please. So we have solar panel and a roll lamp. Next slide. And then we calculate how much carbon dioxide we can reduce in a year. Next slide, please. Also, this is a water harvesting in Taichung Tsuji Hospital. Next slide. And we can also save how many tons of water. Next slide, please. And for transportation, this is free shuttle bus, so we can reduce the transportation, the carbon dioxide emission. Next slide. So we can have this kind of calculation. Next slide, please. And also, for the food, we have the only 2 plant-based diet Starbucks coffee in Taiwan. So serves only vegetarian snacks. And then the other, we provide only plant-based diet, but for all the Starbucks in the hospital, we also ask them to serve only vegetarian snacks. Next slide, please. But I think that building the same mindset is very important. This is our new staff, the nurse. When they come to our hospital to serve, they have to know that each different lamp, they consume different amount of electricity. So to let them know that how to reduce the electricity from the first day in the hospital. Next slide, please. And then click on the video. So we have a recycle station in our hospital campus. And in the holiday, we have with our staff and their kids. This is like 5 years old, and this is 3 years old. So we can let them know how to recycle, building their mindset of protecting the environment. Next slide, please. Next slide. This is, I think that we have to make it a way of living. What I wear, the shirt and the pants, the shoes, all made from recycled plastic bottle. Even these are all made from recycled plastic bottle. So this is a way of living. Next slide. So this is Mama Gandhi. Be the change you want to see in the world. In the hospital, we do everything how to reduce the impact to environment from the hospital. Next slide. And for the diet, although we think that change the diet habit is very difficult, but we have to do by ourselves and then influence all the others, our friends, our relatives, our coworkers, because we can change the world with every bite. Next slide. If you want to walk fast, walk alone, but together we can walk far. Next slide. And this is the love. There is a Chinese character and also the English character love in it. Because of love to the patient, to the person, to the planet, we come together and then share with each other and learn from each other. Thank you.
Thank you so much, Dr. Lin, and thank you for sticking to the time. I know it's challenging, and it's like, we're used to like 90-minute session, and it's in 60 minutes, but it's really great, and I know you're also probably still jet-lagged and a bit tired, but like, thank you for making it today, and I really hope that I can one day like also visit you, because it's a wonderful facility, leading by example, so I think it's really great to have like also concrete examples of how we can live this change, as you mentioned. I would now like to open the floor for questions. And okay, I already see a raised hand. How does that work with a microphone? I guess, yeah, just give you the mic. Sorry? Yeah. Oh, yeah, okay. You promote physical exercise, okay, yeah. I started sitting, I saw I got corrected, but yeah.
Hi everyone, thank you for your presentation. My name is Daniel Torres Bolaro. I'm a college student from Swarthmore College, Pennsylvania. And I have a quick question. I think maybe Martina, this is more focused on you, but like in your sort of like advocacy and efforts to reduce animal and meat like consumption, I'm trying to like think about the fact that like there's some like communities, specifically thinking about like indigenous communities who have meat as the center of like their culture, or who integrates that in their culture, right? And so I'm sort of wondering how much of your efforts and your proposed goals take into consideration all of these cultural factors.
Yeah, thanks for the question. So actually, we are talking mainly about the global north. So I guess the big problem that we need to sorry, you didn't hear my answer now because of your headphones. I will start again. So thanks for the question. We are tackling the global north, and we totally see that there are communities who eat meat or who have their own animals, and I guess that's not the driver of the climate crisis. The driver of the climate crisis is factory farming and the overconsumption of meat. We know that in many European countries, people eat 3 times or 5 times as much meat as it's recommended, and even these recommendations can be questioned, and that's the problem. I don't know if one of my colleagues wants to jump in here.
I just wanted to add, that we also take that into consideration. At ProVeg, we also focus, of course, mainly on European countries where we have a strong presence, or on countries that are about to shift to unhealthy, like meat-intensive diets. I think we all acknowledge that, it's not about uniformizing diets and having everyone eating the same thing. This is not the question, but it's quite often used actually as an argument, this topic of indigenous communities, etc., to not do anything actually in the north. And in the north, we really have to move, and we have to move fast. I'll take the next question. Thank you.
I have a question to Martina. I'm a meteorologist, and I was also invited by our agricultural department to talking about carbon zero for the agriculture. And however, when I talk, we should have more vegetarian to save the food or fast for the food. But it's not easy because the meat industry, just like the fossil fuel industry, is very strong. So in your conclusion, you mentioned about the national determined contribution. We should think about the food supply chain. Is there any good example we should follow, or we do not have a good example now? How can we do?
Is your question like what exactly should be stated in the NDCs? Did I get that right? Yeah, I mean, I guess one thing that it seems like governments do not really see at the moment is that plant-based foods and also research and development of cultivated foods can also be a big driver for economy. At the moment, the whole cultivated food is in the private sector. And that's interesting because that could be a new thing to build on. And that's interesting that at the moment no one is really tackling this. I think actually that the NDCs are so much not looking at animal agriculture at the moment that I hope that if some of the key countries start putting it in, then there will be like a leverage effect and many others will follow, because actually we know that the countries are running out of options. No one can really say what exactly they want to do in the next 10 years. They are talking about 2050, but they don't say exactly how they want to do it. And I guess sooner or later there will be no other way than focusing on factory farming and how to reduce that if we really want to reach the Paris Agreement.
Claire, do you want to add something? Because I think this topic of NDC is very important.
Yeah, I think, I mean, the first point to make is that, you know, we're always very careful to say that this is not, our arguments are not anti-farmer, and we understand that, the farming industry, the farming lobby is a very strong, powerful organisation, entity. And we're not about saying, farmers should go out of business, far from it. It's about taking farmers with us into, as Martina and others have said, into a new relationship with protein through other sources. I think it's important to note that because of climate change and because of the trajectory we're on with it, actually animal agriculture is going to get ever more difficult in the coming decade and beyond. Raising animals for meat and for food will only get harder for farmers, and the more people are in that industry, the more challenged their livelihoods will be in the future. So, we are asking governments to set hard targets within their contributions, NDCs, and create the right business financial landscape to support producer industries and consumers to meet them.
Dr. Lin, do you want to add something also on the climate goals and the UNFCCC process and what needs to happen in the NDCs?
Okay, because I think that it is not easy to calculate the meat for the greenhouse gas, because when we import meat from other countries, how can you calculate this is the greenhouse gas produced by this country or the other country? But I think the other thing is that because we all know that meat production and eating meat will cause disease, like in the year 2015, just like our speaker says that first degree carcinogen is processed meat, and then second degree carcinogen or colorectal cancer is red meat. And that will cause a burden of health and then also a lot of medical expenditure. So I think that the root cause is that how to reduce the meat, but calculation is not easy, I think.
Absolutely, yeah, it's a very good point. I will take another round of questions. I see already one question here, one question here. Okay, well, try to.
Thank you very much. I'm interested in your comments on the recent report, Farming for 1.5 Degrees.
Sorry, I'm not sure I'm familiar with that report. Is it very recent? Who is it by?
It was in the last 2 or 3 months, I think, and it was produced by the National Farmers Union and farming, people in the agriculture and farming community who are really committed to its farming for 1.5 degrees.
Yes, I do know the one you mean now. Yeah, I think we feel it's a good start, but not really going far enough. You'll have to excuse me, I can't remember a huge amount of the detail, but I mean, we in speaking to people like the National Farmers Union, as I said in my comment before, we are very at pains to point out that this is not about forcing anyone out of their livelihood when they don't want to be, and I think there's really good examples of facilitated by companies like Oatly, for example, who have found farmers who want to actually transition into alternative crop production, food crop production instead of animal agriculture, and where there are success stories. It's not a huge number as yet, but there are farmers out there who want to make that transition. And of course, there's that fantastic film about Jay, the cattle farmer who made that transition with from his cattle farm. So I think we need farmers to be with us on this, and reports like that are a great start. It just needs to be more target led, I think.
Yes, thank you so much, all of you, for this event, because this is my second COP, and the lack of presence on factory farming at the last one was what made me completely pivot my career and get into this work. So I really appreciate, first of all of your work. My question is about comparing the misinformation in the meat industry with coal. One of the things that I've been thinking a lot about is how for many years, ExxonMobil and big polluters hid the effects of climate change. And now we're realizing we're at a point where everybody knows that power plants and coal are bad for the climate. Nobody's defending that anymore. It's just about how to move away. Do you foresee that the same thing is going to happen with the meat and dairy industry, but we're just kind of seeing it at a delayed time frame? Or do you think that there are fundamental differences by the tactics that these industries are using that makes that comparison kind of flawed? And anyone can answer that. It's just something that I've been thinking a lot about over the last few years. So I'd be curious on your perspectives.
I'm happy to start answering your question. Thanks for the great question, and thanks for joining the movement. That's awesome. Yeah, actually, I mean, we are talking about the peak meat coming up, and probably the peak meat will be the moment where we will have more meat than we can eat, actually. And I guess at the moment, with the climate crisis being more visible, and also with COVID-19, this is all putting a spotlight on this connection of humans, animals, and nature, and also about the way we treat animals. And that's why I feel we are not there yet, but I guess also with the new technologies and also with the rise of plant-based options that are much better than they used to be like 10 years ago, I think there will be the moment in the future where we will look back and where we will say, what did we do and why did this take so long? How could we do this to animals? How could we harm them like this? Seeing at the same time how we damage the planet and how we damage our own health. I mean, there's nothing good about that. So I'm positive that this moment will come. I don't know when, but like if we join forces, hopefully soon.
Doctor?
Yeah, I would like to comment on this. Because I think the health is the most variable for people. So we have some studies show that if you have a hypertension or a hypercholesterolemia, it is not easy to change their diet habit. But if you have stroke, you have a heart attack, it will be easier to change their dietary habit. And we all know, I think it's common sense that plant-based diet is better for health. So from the health perspectives, that we may give our citizens, our people, the how to improve their health by reducing the meat intake. But unfortunately, for medical curriculum, medical students, when they're in medical schools, we don't provide this kind of curriculum. So we are now, I think that IFMSA, International Federation of Medical Student Association, they are working on putting climate change issues. And also the plant-based diet is better for climate into the medical curriculum. Hopefully, all the physicians and other medical professionals, when they in their young age, they can know better about this topic, this concept, with the mindset, then we can treat the patient and prevent the disease and make everybody know that reduce the meat consumption is better for health.
I think there was one more question. Yeah.
Hi, Carrie Varakier from Cool Planet Food. Thank you so much for organizing this session. Raphael, it might have been you at the beginning that said you had hoped for something that might happen on the agenda on Saturday. Someone said that at the beginning of the session. Not sure. Okay, can you explain what is this hope for Saturday?
I can't. I'm sorry. I just saw that it's Nature Day, and I think there are 2 sessions, but I don't have them in mind, that are linked to animal agriculture. If you want, we can exchange details, and I can send it to you via email. I have it somewhere in my post box. Sorry.
One more.
Thank you very much. It's been a fascinating discussion. I would like to raise a couple of points which don't seem to be spoken about. One, which is the amount of fishing that creates protein which is then fed to animals. So this is another multiplier of the impact, but also of the wider issue of food sovereignty and food security. And the brokenness of the systems. So in the UK, things like supermarkets and the way that they work, they generate huge amounts of food waste. So I think I'd be interested in people's perspectives on these issues, because although you've laid out a hugely strong argument, I think there's an even stronger argument linking these other issues in. Thank you very much.
Thank you. Who would like to go on this one?
Yeah, they're really great points, and I think on fishing in particular, that does often get left out of the agenda, and the fish that's used to feed animals, so that it causes this thing called trophic squeeze. So we're eating the bigger fish, and we're farming up the food chain to feed animals with the smaller fish. So you end up with nothing very much in the middle. I think there's a big issue about transparency with what you mentioned, sort of our sovereign trade, and connecting the dots up is really difficult, and often something that governments don't want to do, including our own government. We've just left the EU, we're forging this new relationship with the rest of the world, and we kind of want to have our cake and eat it at the moment. We're sort of making all these promises on the one hand, and then going and signing trade deals that do the complete opposite on the other. But I think looking at the more promising future ahead, we do have opportunities to give consumers more information. For example, there's I think a big labelling consultation coming out soon, with the government, planning to make legislative action on that, so that at least consumers will have more information about, the food that they're buying, in the way that they do, on sugar and salts and things like that at the moment. But you're totally right, and there's a very long way to go on all of that to join the dots up properly.
Dr. Lin, do you have thoughts?
Yeah, I also want to comment about this from the health perspectives, because the food chain, they have. I read a study in Taiwan, the big fish contain much more dioxin, especially the big fish, and also the mercury in the fish is higher year by year. So I think that it is also because of the all the pollutions around the world. So from the health perspective, it is not recommended to eat fish because of all the waste. And then recently I saw a documentary called Seaspiracy. I don't know if you see that or not. Actually, it is one of the most big contributor for greenhouse gas, because of the seabed was damaged by the fish industry. So I think that we also have to know that eating fish is not good for planet health, and also not good for personal health.
All right. If there is one last question, we can take it. If not, we're going to conclude, because we have to give back the pavilion in 3 minutes, 2 minutes. So I would first of all acknowledge and thank really the WHO for organizing this session, helping us organizing this session. And we know the challenges with the infrastructures, with COVID, with everything, having hybrid formats, having headphones, having it's really challenging on day 2. And of course, with the Leaders Summit not making it easier, we've been through a very long queue, I think, for a lot of us. But it was really great to have the input today, and I would really like to thank the Humane Society, the Buddhist Sushi Foundation, for Paws, for being with us today and for helping us organize this. It's been great working together. I think we all agree that we have to put food systems, especially after this year of a food system summit, that we talked so much about the food system summit. We had so many conferences, debates, input, etc. And yet we see that there is still a lack of acknowledgement of the importance of food systems if we are serious about achieving the Paris Agreement. We need diet change, not climate change, and I hope that we can all work together to push also governments to include clear targets of meat reduction of the consumption of animal products in general in their NDCs, and work with farmers to ensure a just livestock transition, to make sure that also everybody benefits from a food system that is better for all of us. Thank you so much.
Good afternoon, everyone. It's not not yet working.
Somebody can help with the microphone. Not doing very much yet.
I think. Good afternoon, everyone. Welcome to this side event, Global Food 2050, how can we deliver climate resilient, sustainable and healthy diets for the future? I'm Modi Motsama, I'm going to be moderating this session. I'm the Head of Interventions at the Wellcome Trust. I work on the Climate and Health Research Programme. We're going to be hearing from an excellent panel of 5 speakers and from different parts of the world, so really looking forward to kicking it off. If you don't have them, you'll need to have headsets to be able to listen to the proceedings today. There's headsets at the back that you can collect to be able to hear us. We are going to be kicking off with a video manifesto put together by young leaders from the World Obesity Federation, and that's going to be on screen in a few minutes, in a few seconds even. So if we can kick off with that, please. Thank you. And while the video is loading, just to give you a bit more background information, so this event is going to explore climate and health solutions that can deliver a farm-to-mouth food system that benefits human health, climate, the environment, and resilience as well. So look forward to starting. Here we go, Youth Manifesto from young leaders at the World Obesity Federation.
Malnutrition, including undernutrition, nutritional deficiencies, and obesity, could cost society up to $3.5 trillion per year if nothing is done. Adapting food systems to be more sustainable and to reduce global greenhouse gas emissions has the potential to both reduce premature deaths worldwide and to support healthier diets. Young people around the world are taking these issues into their own hands.
Ensure that the transition to more sustainable and ecologically friendly food systems is done in a fair and just way.
Prioritize and promote sustainable and nutritious food options for all.
Create an environment where nutritious, delicious, low-cost food is available in every rural market for every farming family.
Give greater attention to the effects of climate change on small island developing states.
To champion healthy, sustainable diets, both in catering and in the agenda to fight climate change.
Actively promote plant-based diets through incentives that encourage people to reduce animal products in their diets by making alternatives more accessible and more affordable.
To give space to people most affected by the climate crisis, not to polluters who want to keep the system as it is, and to protect the right to protest across the world, because we have a right to protest for our planet.
Food systems are not only failing our planet, but they're failing our children. That's why we're calling on leaders at COP26 to take urgent action to transform food systems so that they begin to deliver on children's right to good nutrition while also safeguarding our planet's future. Governments, civil society, and private sector must prioritize the specific nutritional rights, needs, and aspirations of children if we're to end all forms of child malnutrition while also reducing our food system's impact on the climate crisis.
crisis and unhealthy food systems have the same drivers and solutions. Fiscal policies, front-of-pack food labeling, and marketing restrictions are effective tools to incentivize healthy and sustainable food systems and discourage the production and consumption of ultra-processed, unhealthy, and climate-damaging products.
The collective youth voices we've just heard from create a strong call to action for leaders at COP26 to recognise the synergies between food systems failures and climate change. These issues share many common drivers and must therefore be tackled through double-duty actions addressing both food systems failures and climate change. We call on leaders at COP26 to take decisive and effective actions to address both issues simultaneously. The time to act is now.
Leaders of the COP, from young leaders at the World Obesity Federation. So I welcome again on behalf of the Health and Climate Network, a network of global organizations working in health and climate who are calling on health-centered climate action to advance both health and sustainability objectives. Next up, we have one of the supporting organizations, London School of Hygiene and Tropical Medicine. We're going to hear from Professor Alan Dangle on my right. He is a professor of food and nutrition and global health at the London School. He's the director of the London School of Hygiene and Tropical Medicine Centre on Climate Change and Planetary Health. In 2019, Alan served as a specialist advisor to the Environmental Health Audit Committee of the UK Parliament in terms of their inquiry on planetary health. He is also my future boss. Welcome, Alan.
Thank you very much, Molly. Delighted to be here. If I could have the slides, please. So you've just heard the issues. The issues are that we have a food system that is creating an enormous amount of damage on the planet, and yet at the same time it's not delivering health for people. So the real question is, oh, that's worked. My talk is actually called, if you could see it, what are we going to eat in 2050? Who's eating what in 2050? It's a really, really important question. Next slide, please. Let's see, I hope you can see them. So these are the questions. Number one question is, what are we eating now? And that's about the nexus, the intersection between food systems and health. It's how will the climate affect the food availability and therefore what we're going to eat in the future. So that's about the food system and the environment interaction. And then finally, what are the diets of the future and what is their health impact going to be? Next slide, please. So Thomas Malthus said that we would never be able to cope with the rising population. The food system would not be able to cope, and there would be mass starvation and famine. That has not happened because we have an extraordinary food system that has been able to deliver food for people around the world. But it hasn't done it very well. So if you click, please. Next slide, please. Lovely. You can see here, this is from a recent report on the health of the world, the nutritional health of the world. And you can see we've got 50 million children who are wasted. That means they're dangerously thin and at significant increased risk of death. We've got 150 million children who are stunted. That means they're too short. They're dangerously short. And at the same time, we've got obesity and we've got diabetes and we've got all these other terrible things happening in children and adults. So the food system is delivering food for 7.5 billion people, but the diets are not healthy. Next slide, please. So you know this, the world is heating up, but it's heating up in a very unequal way. So some parts of the world will be much hotter than others in 2050, and some parts of the world will be much wetter than others. Next slide, please. The consequence of that on the production of food is absolutely massive. So on the left there, you have the yields of cereal by 2050. By 2050, Africa, Asia, Australia, South America, the yields of their cereals will be totally decimated, 15, 20, 30% lower yields by 2050. And on the right here, the data that we've pulled together on fruits and vegetables, legumes, nuts and seeds. And you can see there are declines, projected declines in the availability, the production of all these foods around the planet. Next slide, please. So at the moment, where are we getting our food from? So here in the UK, we've doubled. We've gone from 20% to 40% the amount of fruit and vegetables we're importing from countries that are currently climate vulnerable. So those are countries that can't afford to be giving us fruit and vegetables, can't afford to be giving us their water. And also the resilience of our food system is in significant danger. Next slide, please. And what that leads to is this, and we're seeing this again and again and again now in the UK, empty shelves. Because the food system is really creaking to respond to the impacts of environmental changes around the world. Next slide, please. So the big questions are, how do we deliver an efficient, sustainable, resilient, and equitable food system for all by 2050? How do we do that at a time when food systems are facing an enormous demand from increased population and changing diets, but at the same time a huge pressure from the changing climate and the ability of the food system to deliver those diets? And then finally, what we really must do is a huge transformation, for food systems, a pioneer, a new way of thinking about health under climate change. And these questions could not be more important. They're not here at COP. They're not being discussed enough by policymakers. This is the biggest question. What on earth are we going to be eating in 2050? Thank you.
Thank you so much, Alan, for providing that really powerful illustration of how food systems are going to be adversely affected by climate change and the implications, and the fact that we're not talking about that. So hopefully during the discussions we'll have some time to have a bit of a discussion around what can be done. Next up, we've got Professor Srinath Reddy from the Public Health Foundation of India. Srinath is the president of the foundation. He formerly headed the Department of Cardiology at the All India Institute of Medical Sciences. He's also an advisor to the governments of a number of states in India on public health, and he has served as a physician to 2 prime ministers of India. We're going to be hearing from him online, so hopefully he will be coming up on screen very shortly. Welcome, Srinath.
Greetings of the day wherever you are. Basically, we have been taught, rather incorrectly, that nutrition can be conveniently compartmentalized into undernutrition and overnutrition. We realize that there is a huge overlap between these two, and that it is being driven by food and agricultural systems, which are also driving climate change. And therefore, it's absolutely important for us to recognize these connections. We know that the nutrition-related disorders occur in a continuum, and that there is a considerable overlap between what is conventionally called undernutrition and what is being called overnutrition or overweight and obesity. Indeed, people who are overweight and obese are also deficient in a number of essential nutrients, micronutrients, and their diets are deficient in fiber, fruit and vegetables, and a number of other nourishing elements. So there is a clear overlap. And we find, even as we conventionally define underweight and overweight and obesity, that there is an overlap within populations where they coexist, within families where they coexist, and even in individuals, there is an overlap over the life course, and even at some time, even the same person, you could have a relatively thin person with a lot of abdominal obesity or visceral adiposity. So if we define obesity not by these anthropometric measures, which are convenient but inaccurate, but by the percentage of body fat and where the body fat is distributed, we find that the dimensions of overweight and obesity have even been underestimated worldwide. And therefore, the metabolic consequences and the disease consequences are quite severe and far more extensive than we believe. Therefore, we really ought to be really talking about metabolic obesity. And we now know, even from science, that the kind of foods that we eat modify gene expression, what's called epigenetics, but more importantly, they feed the trillions of bacteria that reside in our gut, and their eating habits are different from what we are currently forcing them to eat. And their signals to the brain also result in overweight and obesity as a result of the change in the gut flora. So science is clearly telling us that our food and agricultural systems are on the wrong path. And it's also true that it's the same food and agricultural systems that are pushing the climate change. So when we are really talking about animal food rich diets, particularly high levels of consumption of meat, we recognize that there is a huge amount of deforestation involved, both for expanding the agricultural land for grain and for grain feeding the animals for meat. We also realize that they're accelerating a variety of non-communicable diseases, cardiovascular, cerebrovascular, cancers, and so many others. At the same time, they're establishing a conveyor belt for microbes to migrate from wildlife into veterinary and human populations, leading to infectious diseases like COVID. But it is incorrect to believe that all these food habits that are being altered are entirely by people's choice and can be modified by people's choice. We know that choice can be conscious based on the right information or wrong information, or conditioned by aggressive marketing and promotion, or constrained by economic factors. Therefore, it is important that policy really needs to look at food and agricultural systems from the point of view of health as well as climate change. At the same time, try and plan for climate smart and climate resilient, health friendly, and nutrition friendly health systems. So, whether the policies are being made by the global policymakers, by brainy analysis, or are being guided by gut feeling, the message is the same. Fix the food systems as part of the climate response, because this is clearly an anthropogenic problem and requires a human response to fix the nature of foods that we are taking, which are driving up obesity along with undernutrition in many forms, and at the same time accelerating climate change. So we need a common solution for diverse but very intricately connected problems. Thank you very much.
Thank you, Srinath, for that powerful reminder of how food systems are both driving climate change and a variety of diet-related ill health conditions in people, and the powerful message that because of that we need to fix the food system. Next up, we've got Patty Fong from the Global Alliance for the Future of Food. Patty is Program Director for Climate and Health and Wellbeing at the Alliance, which is a strategic alliance of philanthropic foundations working together and with others to transform global food systems now and for future generations. She brings 2 decades of experience with strategic philanthropy in climate and sustainability, and she'll be talking to us about how food is currently featured in the NDCs. Welcome, Patty. We'll be hearing from her on Zoom, so she'll be appearing on the screen in a moment.
Thank you, Modi. It's a pleasure to be here and present virtually with you. Listen, can you show the slides, please? I'll start talking while Alison gets that ready. So as we've heard from Alan and Srinath, integrating food systems in climate action is critical to delivering on our interconnected goals, from tackling malnutrition in all its forms to protecting planetary health and upholding ecological integrity. Although there's been a growing attention to the connections between climate change and agriculture issues, relatively little focus has been placed so far on climate and food systems more broadly, even though the world's food systems are responsible for more than 1/3 of global anthropogenic greenhouse gas emissions. In addition, taking a food systems approach results in a diversity of context-specific solutions for food production, distribution, consumption, and waste reduction. Next slide, please. But how well are countries doing with food systems thinking? We developed an assessment framework as a tool for policymakers and advocates to identify opportunities for better integration of food systems with the NDCs. As you can see from this map, and I can't see very clearly, so I don't know if those in person can see the slides more clearly, but actually it's a map of the world. you can read, at least I can read the names of the countries. We've applied the framework to 14 countries, of which 8 have been completed, so those are the ones in blue. And we selected these 14 countries based on geographical and economic balance, mitigation potential, adaptation needs, and food security concerns, and finally, climate negotiating blocks. The analysis was based on the NDCs submitted, but they also consider broader key food systems policies. And each assessment was complemented by interviews with 5 to 10 in-country policymakers, advocates, and sectoral experts to better understand the challenges, ambitions, and needs. Next slide, please. We are planning to launch the full results early next year, but I can share with you today a couple of emerging insights from the first 8 countries that we assessed. On the health co-benefits, we found that all the assessed countries face nutritional and health-related challenges linked to food. Across France, Germany, the US, and the UK, obesity and overweight linked to unhealthy diets affect at least 40% of the population. These conditions are strongly linked with an increased risk for non-communicable diseases such as cardiovascular disease or type 2 diabetes. In comparison, Bangladesh, Colombia, Kenya, and Vanuatu mostly deal with the double burden of malnutrition, with part of the population considered overweight, while another significant part of the population, predominantly children, suffer from undernourishment, micronutrient deficiencies, or stunted growth, as you heard from Srinath. Yet none of the countries assessed explicitly included consultations with health and nutrition experts. This is really a missed opportunity for ensuring that the NDCs maximize the health co-benefits. A shift to sustainable and healthy diets can reduce the prevalence of obesity and overweight, as well as address undernourishment and food insecurities. And these benefits also imply reduced healthcare expenses and economic benefits. Next slide, please. On consumption and diets, we found that none of the NDCs assessed put forward an accounting methodology that considers the emissions reductions and removals from food systems in a systematic way. So, for example, the majority of the countries assessed did not include measures to mitigate or adapt to climate change by shifting diets, with the exception of the UK, France, and Germany. None of the NDCs put forward measures to reduce the consumption of animal protein, especially in those countries with trends of overconsumption. And none of the countries assessed fully account for emissions associated with food imports, particularly those related to deforestation and the conversion of ecosystems. So you might have heard the announcements yesterday about more than 100 countries having committed to basically phasing out of investments in deforestation risk commodities, yet they're not yet integrated into their NDC. Next slide, please. I'll end by commenting on the countries that are moving in the right direction. So this is just a spotlight on the European Union. The EU has taken effort to build policy coherence to achieve the interrelated policy objectives of mitigating climate change, shifting diets, and improving health. As part of the EU Green Deal, which seeks to make Europe climate neutral by 2050, the Farm to Fork strategy has been developed to address food production, transport, and waste, and make food systems across the EU fairer, more conducive to health, and more environmentally friendly. One of the primary targets of this strategy is to increase the agricultural land area devoted to organic farming from the current 7.5% to 25% in 2030. Another major cornerstone of the strategy is supporting global transitions towards sustainable food production and consumption through trade policies and international cooperation instruments. This strategy also seeks to improve the availability and price of sustainable foods and to promote healthy diets and sustainable consumption across the EU. The EU has also adopted its Beating Cancer Plan, which sets out a new EU-wide approach to cancer prevention and includes a campaign for promoting healthy diets and physical activity. At the member country level, Germany has made an explicit commitment to move away from harmful subsidies and promote sustainable food consumption by a greater investment in research, use of pricing instruments, and to incentivize alternative sources of protein and actions to increase health and dietary literacy. In France, its National Energy and Climate Plan mentions the intention to influence food demand and consumption through its National Food Nutrition Program. Next slide, please. You can find more emerging insights in the link on this slide. We'll be launching the final results early next year. Thank you. Back to you, Modi.
Thank you so much, Patty, for that fantastic overview of how actually currently food systems aren't featured within the NDCs. and we've got a long way to go, but it was also good to see some progress happening on policies towards sustainable food systems in the European region, including some examples from individual member states like Germany. Next up, we are going to hear from Mohammed Asa, who's sitting to my left, from the International Federation of Medical Students Associations. Mohammed is a sixth-year medical student from Alexandria in Egypt. He has been volunteering in public health for the past 4 years and lately has been elected as the Liaison Officer for Public Health at the International Federation for Medical Students Associations. Welcome, Mohammed. We look forward to hearing your thoughts.
Yes, thank you so much. So, I would start with a raise of hands. Who's hungry here at the moment? Okay, I'm hungry as well. Let me just take this first. Yes. So again, who's hungry? I'm hungry. Okay, so the good thing is that we can go after this session and we can get our food from outside or from any other place in this pavilion. But unfortunately, many other people could not attend, many other people could not come to COP, many other people could not survive a high quality life because they don't, or they are suffering from food insecurity. That's the unfortunate event that we are living at the moment, that people are not getting the food security that they deserve. However, in order to get more or to speak more about this, let's get to the back of the story. I guess I have some slides, so can we go to the next slide? Yes, so I have 3 questions that I will tackle here. Why food, why health, and why youth, since I'm the young individual here. So the 3 questions that we have in a climate change conference, why are we including these 3 questions? Can we go to the next slide? Yes, we have 3 pictures here. The first thing, that we would like to address is the food security. When we're talking about food security, let's link it to climate change and let's see what happened and how we contributed to the climate change with our food production methods. The thing is, with our food production method, agriculture has been one of the greatest contributors to the greenhouse gas emissions and biodiversity loss. In addition to the agricultural waste, the use of antibiotics in a very bad and misused way, this has led to the climate change in one way or another. And unfortunately, we were not ready with how the planet will hit us back. Like, people keep on going through the bright side of the planet and how the planet is very good to us and how the planet, we are destroying the planet, but the planet can be very bad when it's protecting itself. It can hit us back very severely and we would not be able to deal with the consequences. And this is the result, is that the climate change has led to food insecurity, has led to changes in temperature, has led to changes in the atmospheric gases concentrations, has led to changes in the water, the presence or the water availability in several areas, and the spread of different pathogens, different pests, which led to food insecurity. And here, when we talk about food security, what do we mean by food security? It's the physical and social accessibility of food, to everyone, but it has to be safe and nutritious and sustainable. And several people are not, unfortunately, being able to access that. Which leads us to the SDG number 2, hunger. How are we able to achieve or eradicate hunger if we are not to tackle climate change, if we're not to tackle food insecurity, if we're not to tackle the different other co-factors that are contributing to both issues of food insecurity and climate change? So the thing is here, we're contributing a lot with our food production methods. We led to climate change in one way or another. Climate change and the planet hit us back hard, and now we're suffering a lot from food insecurity that we cannot tolerate. And that's why I was speaking, when we get to speak about health, I'm a young individual who had the opportunity to come here to speak about health and to advocate for the inclusion of health in the climate change. However, several other people are not able to address this, several other people are not able to advocate for this because of just a way, or aside from the climate change and food insecurity, even the way we're using food is unhealthy. There has been a transition in how we are receiving our nutrition. Earlier, it has been much healthier, but now with the industrial area, with the globalization, with everything, we are going to the unhealthy lifestyle, we are going to the use of junk food and processed food, and we are going to the sedentary lifestyles, which are leading to more and more of the NCDs that everyone had been mentioning. So also, this is leading to the double burden of malnutrition. And what is the double burden of malnutrition? It's just the presence of undernutrition and overweight and obesity all within the same community, all within the same household, all happening at the same time within the life course. We're suffering a lot in terms of our health. So as we can see here, we're suffering from food insecurity. We're suffering from the impact of the unhealthy diets that we're having. We're suffering from the direct and indirect impacts of climate change. And all of this is affecting our health and affecting how we're contributing actually to the climate action in this era. And here, like the last thing I would speak about, why youth? Why are we speaking right now? As cliche as it may sound, we're the future, we're the leaders of the future, we're the biggest demographic on earth, but that's actually the truth. And if we are not contributing, if we're not recognizing our issues, and if we're not acknowledging them now, then we will be suffering from a future where leaders are not well oriented about the issues that we are facing in our communities, and we're suffering more and more of the climate change and more of the different other issues. So this shows why we are in deep need of food justice, we're in deep need of climate justice, we're in deep need of health justice, and we're in deep need of youth who are well empowered to contribute to this. And in order for maybe when we get to tackle food insecurity, maybe when we get to tackle health, maybe when we get to tackle climate change, next time when we get to have this conference, more and more youth from less developed countries, from low-income countries, from many different areas where people are suffering from food insecurity, they would be able to come here and address and tackle these issues from themselves. Here, I'm very happy that I got this opportunity to speak on behalf of 1.3 million medical students whom we're representing in IFMSA, but I would be happier with other youth to come and talk for their own issues. Yes, we have this issue in Egypt, but it's much worse in many other countries. So I would be very happy for youth from these countries to come and speak for themselves, and this can only happen with us having these pavilions and with us having these events, and much more importantly, for the country delegations in the other rooms who are not attending these events to attend these events and actually listen to us. Because actually food security, climate security, and climate justice, health justice, and food justice, it's a right and not a privilege. And we have to bear this in mind. Thank you.
Thank you so much, Mohammed, for that really passionate reminder about the climate and food justice dimensions of this debate and bringing in the youth perspective as well. We can get quite depressed when we think about the nature of the problems facing us, but it's so encouraging to see you as a young future leader, a young leader already, and future older leader, that you really get these issues and are so passionate about it. So yeah, we're looking to you to solve the problems. Thank you. Next up, and last but not least, we have Ana Paula Bartoletto from the IDEC Brazilian Institute of Consumer Defense and also University of Sao Paulo. We're going to be hearing from her online. So Anna is a nutritionist and researcher and activist who is for adequate and healthy eating. And as I mentioned, she's based at the Brazilian Consumer Defense Institute and is also at the Center for Epidemiological Research of Nutrition and Health at the University of Sao Paulo. Welcome, Anna.
I am speaking from the experience of IDEC, which is a non-profit consumers organization founded in 1987. And our work is independent of corporations, political parties, and governments. We work in collaboration with many international and regional networks like HCN, Consumers International, and a community of practice on healthy and sustainable food systems called Colanza. Considering the need to build systemic solutions for healthy and sustainable food systems, we have been exploring solutions from the consumer's perspective to tackle with these problems together. So I'm very glad to be in this panel and share our vision and dreams for 2050. A key concept that I would like to highlight is the definition of a healthy and adequate diet. It seems very obvious, however, it's a concept under international debate and an important narrative dispute, including the need to exclude ultra-processed food products from healthy diets. These are not exactly food, but rather formulations of substance or fractions of food from industrial proposals. The consumption of these products triggers weight gain, obesity, diabetes, hypertension, kidney dysfunctions, and premature death. In Latin America, more than half of the women are overweight or obese, and around 43 million people are undernourished. The coexistence of malnutrition in all its forms is not really new. The novelty is the recognition that the replacement of fresh foods by ultra-processed products is the main driver of these major health issues. This dietary pattern is supported by a dominant model of food system based on monocultures and extensive livestock with a high use of pesticides. The region, Latin America, is also responsible for 9.5% of global emissions, increased pollution of natural resources, and reduction of biodiversity. But Latin America is not only a region that suffers from the consequence of this hegemonic food system and the so-called corporate diets. It is also the region that has been presenting innovative, evidence-based policy solutions that seek to counteract this model. Countries like Brazil, Mexico, Chile, Peru, Uruguay, and Argentina have stood out and implemented policies to reduce the consumption of ultra-processed products. Two brief examples are the second edition of the Dietary Guidelines for the Brazilian population, an important shift in the definition of an approach for healthy and adequate dietary patterns, and the adoption of warning front-of-package nutrition labels. These approaches are more effective when combined with school canteen regulation, marketing restrictions, and fiscal policies. But besides these advances, the policy inertia and the corporate capture of the food system agenda are the most difficult obstacles to be overcome. Brazilian civil society is alert to serious political setbacks, which are already showing their consequences. While world leaders are at this moment in Glasgow building solutions, the Brazilian president, Jair Bolsonaro, didn't even bother to show up. Considering the scenario of dismantling of food and nutrition security and environmental policies, and weakening the democratic spaces of social participation in Brazil, we urge to connect and build bridges among food and nutrition and climate change experts. We don't have time to waste with false technological solutions or greenwashing practices from big food and big soda. We need to learn from our past mistakes that cause so many negative health impacts, like the trans fat solutions or the self-regulation commitments of the private sector that are inefficient and delay other advances. The power imbalances require adjustments between economic interests and the guarantee of fundamental rights. The governance and transparency mechanism must guarantee the non-participation and interference of the private corporate sector in the formulation of public policies on food, health, and climate change. Despite the challenges, we are focusing on building collaboration and exchange between Latin American and worldwide actors on this fight. And we truly believe that many of these solutions for 2050 are coming from the Global South. Thank you, and I'll be happy to share and learn more from you.
Thank you so much, Ana Paula, for giving us that perspective from Latin America, one of the regions that's been most progressive in terms of adopting policies towards healthy diets on the junk food obesity side, ultra-processed foods, but highlighting some of the challenges of transitioning towards similar policies on sustainable food system diets, the imbalances in power, corporate interests, some of the barriers and challenges she highlighted there. Thank you for that, Anna. Now we're going to open up to discussions and debate. Any questions, reflections on things you've heard? We would love to hear from you. We have a roving mic, so if you'd like to ask a question, please put your hand up and we'll get a microphone over to you. Thank you.
Hello, Dorit Adler from Israel. Thank you for an amazing session. I couldn't debate on any word you've said. So what are we doing? You know that last month there was the summit of food systems led by the General Secretary of the United Nations. And it's not on the agenda in the COP26. It's unbelievable. The Food System Summit was created from understanding that without a transformation in food systems, they cannot achieve the SDGs 2030. So what together we're going to do?
Thank you. That's a great question.
By the way, I'm from the Israeli Forum for Sustainable Nutrition. We're an organization of professionals around food systems, from agroecology, nutrition, health, food, and environment, and so on and so on. So just to give you a perspective.
Thank you so much for that question. Alan, would you like to go first? Or
I'd love to go first. That's a great question. So for me, the issue is, as it is in academia, as it is in government departments, as it is in the UN, that we have silos and we have distribution of activity into various different buildings, and those buildings don't talk to each other. So you have a food system summit that talks about food systems and transformation of the food system, but doesn't pay sufficient attention to climate change. And so the insufficient recognition that climate change is going to have an unbelievable impact on food systems, as we've discussed, and that was rarely debated or insufficiently debated within the discussions on food system transformation. So that results from silos, and that results from a blinkered approach to recognizing the impacts of climate change in the future. And people are worried, people are frightened, and people have a short-term outlook. And in those situations, you just look at what's in front of you, you don't look at what's coming over there. What's coming over there is really frightening, and requires much more holistic discussions and recognition. And the fact that, health is barely mentioned at COP, but food systems is not mentioned, and what's going to cause the next war? The lack of food. What's going to cause mass migration? The lack of food. And that's going to happen, already happening because of climate change, and will happen more. Surely it should be here. Surely it should be front and center of discussions at meetings like this.
thank you, Alan. Mohammed would like to come in, and if there are any other speakers who want to respond, others will go into the next question. Mohammed.
Yes, thank you for the question. Just to mention,
Right.
it's very weird to hear myself like 2 times. Yeah. So just as a response to this question, as Alan mentioned, like health is not even in the agenda. So like we can see that they don't care about our health that much here. But yeah, it's fine. We have at least our pavilion. But yeah, like regarding this, what we need to do, something that we used to learn, especially in the IFMSA when we used to work, like some stages of advocacy that I believe like they were very, very much like sufficient or not sufficient, like they were very much effective when we get to work on any issue that like is important to us. First thing, we need to do our research. We need to show them the evidence that there is a problem. Because like countries, governments, they do not hear if you don't show them evidence. Like they don't hear most of the time, but like we can make them hear, especially if we have our research, if we have our evidence. The second thing is doing our campaigning, doing like spreading our voice, disseminating the idea and disseminating the issue that we're having, networking, and this is actually what we're doing now, networking with each other, finding people with common grounds, finding organizations that are working on the same issues, and like raising our voice more and more, but through actions in our own countries and in our own networks. And last but not least, lobbying. Like this is the space for lobbying actually when we get to care about our health and our food security. So this should be done through direct lobbying and indirect lobbying, and I guess this is the most important thing. We need to get back to our countries, make people learn about food systems, make people learn about food security, and they get to ask for their own rights. It's very much stronger when people ask for their own rights rather than us asking it for them. So we need to start at the grassroots with the community, with the public, with the general population, and they will lead the change. Thank you.
Thank you. Alison, is there a question there? Okay, we'll start off here and then we'll come... Perfect, okay, thanks. Come in, Srinath. Then you come after.
In discussing nuclear weaponry and the threat of nuclear war, we use a term, mutually assured destruction, MAD. We find that climate endangering actions and disordered food systems are also mutually destructive. This is another example of mutually assured destruction. We need to tackle both of them together and with great conviction that they are connected.
Thank you, Srinath. We've got a question from the internet.
I've got 2 here. One is specifically for Patty, which is asking, to what extent does England's pledge to switch all its public subsidies for agriculture to nature and climate. How much is that shift from agriculture to nature and climate in terms of subsidies? A helpful starting point for the EU or global conversation on NDCs. Is that useful? So that's a specific one. And then a more open one about affordability. Affordability of more sustainable food could be an issue for many people. What solutions would you like to see?
I'm not sure we can hear you, Patty.
Can you hear me now?
Yes, thank you.
Okay, great. I said I'll answer the first question. I'll let Anna Paula answer the second question. So the UK has been publicly supporting a shift towards away from harmful subsidies, yet we found that it actually wasn't reflected in its NDCs that it was submitted. So we hope that it'll be the next time around. So only Germany actually made a commitment in writing in its national energy and climate plans to move away from harmful subsidies, but the UK did not at this point of the version of the formal, say, NDC that was submitted. So we hope for the next round of NDCs that because the EU as a whole is moving in this direction, that we'll see more countries within the EU, and we hope, especially with initiatives like the Just Rural Transition, which is focusing on repurposing agricultural subsidies. You see new reports coming out from the UN, from the World Bank on these impacts, that there'll be more and more pressure. So we're really looking towards the next round of NDCs that's due in 2025.
Thanks, Patty. And next up, Anna Paula on the question of affordability.
Modi, can you hear me?
Yes.
Great. It seems that the affordability issue also relates to what Patty was mentioned regarding subsidies. We have a lot of examples about how we have a lot of subsidies for pesticides, for sugar-sweetened beverages here in Brazil and in other parts of the world. So I truly believe that it's possible to organize a fiscal policy that can provide subsidies for really healthy and sustainable agriculture patterns, and not to subsidize what's causing this so many health and environmental negative impacts. So, and also considering the taxes for the unhealthy and unsustainable food systems, because we have so much example. We have evolved a little bit in some countries, but we still have a long way to go. And in this way, we can adjust the food prices so that the most affordable ones are the healthier. And we have some data that's showing that in the global south, we are seeing an inversion of the costs of the diets when the costs of healthy diets are increasing and the costs of ultra-processed products-based diets are decreasing. So we really need to look at these fiscal policies to change this scenario before it's too late, and we are going to be in a situation where ultra-processed products will cost less than healthier products.
Thanks for that, Anna Paula. I think a problem that's repeated the world over. Next up, a question from the floor.
Yes, hello. Thank you for the fantastic talks, everybody. I think they were really amazing, and I think the most important thing about it is that this is a topic that is intimately interconnected with both the climate, biodiversity, and human health and happiness. Now, I'm actually doing some research, so the answer could come from the floor or from the panel. But I'm doing some research for my talk, which is on the 5th, which is called Circularity in the City, from Food to Foundations. And it is my understanding that actually it's commodity economics that is creating one of the most destructive things on our planet, which is industrial monocultures. And the reason being is because, and there's a second part to it, and the second part is that waste is a necessary part of this commodity economics. If you didn't have waste, you wouldn't have the economics. And so this comes down to a couple of factors. Number one, it's that commodities are items that are ostensibly the same as each other. So gold here and gold there is ostensibly the same as each other. Those are extrinsic values that you can trade for money, and you shop for the lowest price, right? But then what happens with food is that food has intrinsic values. It has taste, flavor, nutrition, texture, all of these wonderful things. And actually food is traded and sold based on weight, size, and color. And the goal of the commodity economics is to trade as many equal things as possible from wherever it comes from, so that an apple in New Zealand and an apple from Denmark could both end up in Germany. And what that means is that you get degradation of quality of food, and in certain cases where there's genetically modified Bt toxins in food, you're buying a poison and not a food. And you want this in commodity economics so that you can not only trade, but make the difference, if you like, between the value of production and the value of sale the highest possible. And so my question to the floor and to the audience is, what devices do we have to go against or convert commodity economics into a value-based economic stream that will naturally graduate to diversity and health? Because when you have people who are creating foods in local areas, you get a natural connoisseurship of difference. You get natural diversity, and you get much more of an involvement of lifestyle between a person and the food producer who is next to them. So how do we create that in the countryside? My answer is how to create it in the city, but of course you have the peri-urban and the countryside areas. And the city at the moment produces the countryside, and in not a very good way.
Thank you for that question on commodities creating value beyond just the economics to actually include health, biodiversity and other impacts. Who'd like to kick off with an answer from that from our panelists? Or anyone from the floor, actually? Thank you.
Well, great question. Of course, food is not a commodity. The world relates to it as a commodity, but there is the right to food and so on. One game changer, for example, would come from regulation. In Israel, for example, the food waste, big part of it is being donated to NGOs, to give to poor people. But most of it is ultra-processed food. Now, most of it, it's just a day before the end of their life. If they couldn't donate it, they would have to pay a lot of price because, waste you have to pay a lot of money. Not only they don't pay this money, they get reduction in tax. And they get also greenwash as very contributing factories and so on. One regulation, for example, yes, that first of all, every nutrition support program has to be based on healthy, basic, sustainable food basket, culturally adapted, in every country. And it cannot contain a list of products. It will be a real game changer. Secondly, not to give any tax reduction, the other way around. You have food waste, pay for it, like I pay for it as a private citizen when I have waste. So this is one example. I can talk to you until tomorrow morning with many, but I think if we globally pursue this thing, yes, because most of the nutrition support programs are based on non-healthy, non-sustainable food basket all over the world. I think also for the United Nations. Thank you.
Thank you so much for those interesting ideas, which I actually agree with. Next up, we'll have Patty.
Hi, that's a really good question, and I would actually go even up higher level in terms of it's about our narratives, that how we think about our food systems, for the past, probably even at least since, the last World War, is that it's around calories and yield, right? And you think about the narratives around food security, it's about how much does it take in terms of calories, right? We're not talking about health and nutrition. If you actually flip the equation and say, actually, the food systems are here to serve health and well-being, provide nutritious, adequate diets, rather than the number of calories, you'd actually would flip types of policies, a type of financial support that would be out there supporting current food systems. And that would naturally shift how we're supporting or thinking about commodities that are traded.
Thank you so much, Patty. I think we've got 3 more questions, 2 from the floor and 1 online. So we'll take them all together and then get some comments.
Thank you for all the excellent speeches. Yeah, I have a question for Mohammed, because I'm also a physician. And we know that awareness is very important, how to increase the awareness, not only for all the general population, but also for the medical professionals. Because I know that IFMSA is working on how to integrate climate change issue into the medical curriculum. And also now, as far as I know, nutrition is not that important in the medical curriculum. So I don't know exactly the IMSA as a platform for all the global medical students, how the process you are now, because medical curriculum is all impact pathology, internal medicine, surgery, so many things to learn. But it's not easy to integrate it. So I want to know your comment or the progress. Thank you.
Thank you for the question. Hold on to your answer.
Hi, to be helpful as chair, mine's very quick. My name is Katie Robury. I work for RAP. We're a not-for-profit working on circular economy and particularly food waste. So just to really throw complete support behind the calls for food waste to be on the agenda at COP. It's as important as the discussion around emissions. Fully supportive of that. And also just to flag in terms of solutions or places to find answers on food waste throughout the supply chain, right from donation to farm, to flag the quartile commitment as well, which is a really good resource to look at and pulls together food producers, food retailers, food donation experts. Yeah, that's it. Just a quick yay, food on the COP agenda.
Great, thanks for the plug, and great plug. And then 1 more question on this side, a comment.
A very quick one here is really, what can the ordinary citizen start doing to improve or better their nutritional intake? And you've got 2 minutes to answer.
Thank you. So kick off, Mohammed, and then we'll come to the panelists.
Yes, thank you so much. Maybe quickly while I'm answering, can we get my presentation again on the screen? No? Okay, I can make it after. So yeah, just for this answer, yes, since we are in IFMSA, we're working on increasing the awareness of the medical students, and actually our vision is uniting the medical students for global health. So for the food systems in the medical curriculum, I would say first of all we created a framework for the climate change in medical curriculum, which we actually have a policy brief for in COP. So I can send it to you. I have a QR code for this. We are working currently on the framework, and we would love for people to help us review it and launch it. Also for the food systems, we have our own policy documents that we share with our medical students, and we actually adopt in our general assemblies. So we have policy documents on food for health and sustainability. We have a policy brief for this also with us in COP. And we have a policy document that's adopted by IFMSA. So it's an official policy document that represents the voice of the 1.3 million medical students. And in addition to that, we also work on online courses. We have worked on the creation of an online course for nutrition for health and sustainability, together with EIT Food and the European Union. We worked on this course. It's already launched since a couple of months, and many students have enrolled for this. So I guess this is a way, and especially we need to take into consideration that the COVID pandemic, I guess the bright side is it has shown us different ways of learning, different ways of connecting. So maybe we can use these online platforms to reach more youth, reach more medical students, and help them get educated, because it's very much part of our profession as future doctors to understand the prevention.
Thank you so much, Mohammed. Last question was about what can ordinary people do. Who'd like to kick off? Alan.
It is abundantly clear from dietary recommendations around the world that a healthy diet is a diet which is largely plant-based with small amounts of animal source foods. It's abundantly clear. All global dietary recommendations say the same thing. And the best thing about that recommendation is not only is it good for health, but those diets have a much, much, much lower environmental footprint, lower greenhouse gas, lower water use, lower biodiversity loss. And that's been proven. That's very good science behind all of that. So it's a win-win. So the average individual eats a largely plant-based diet with low amounts of animal source foods. It's better for you and it's better for the planet.
Thank you so much, Alan, for ending the session with a reminder of what we can all do as individuals. But then also, what we've heard today is that we've got a long way to go to integrating sustainable food systems into the climate agenda. Go forth and network, and whoever you speak to at COP, aim to make this a much bigger priority, sustainable food systems and health. Thank you so much to our excellent set of panelists, Alison Doig, the coordinator of the Health and Climate Network, who has put this session together. There are a set of briefings online which provide more information about sustainable food systems as well as other issues with co-benefits for health, and they're available through this hyperlink on the leaflets. And lastly, thanks to all the sponsors or supporting organisations: London School of Hygiene and Tropical Medicine, IFMSA, World Obesity Federation, WHO, IDEC, and Public Health Foundation for India. Thank you very much, and goodbye.
43 academic institutions from around the world. These are lead academic institutions, lead universities, but also UN agencies. And once a year, we publish a report in the medical journal, The Lancet, one of the most prestigious journals in the world. And in this report, we offer over 44 indicators that offer standardized metrics tracking the health impacts of climate change on health, and particularly what are the health opportunities and the benefits of the transition to a low-carbon system. Through these indicators, we offer standardized metrics that can offer ways of comparing different countries, different performances, and about everything, tracking our progress year on year to see how we are doing with respect to meeting the Paris Agreement, which the WHO has said is the biggest and most important public health agreement of this century. So when we think about climate change, the first thing that comes to mind is obviously the rising temperatures. One of the things that we're tracking is the extent to which people, particularly those very, very vulnerable groups, people over 65 years of age and very young children under 1 year of age, are getting exposed to extreme heat, to heat waves that are putting their health and their lives at risk. Heat waves have been called the silent killers and can really tip people over the age, particularly those with underlying health conditions. One of the things that we're seeing, as these graphics show, is that exposure to extreme heat, to heat waves, has been going up pretty dramatically since the 2010 and has been going up over the past at least kind of 30 years. This has led to year 2020 seeing over 3 billion more percentage of heat wave exposure in people over 65 years of age. And in very young children, over 600 million more percentage of heat wave exposure. So those are really worrying trends. But apart from the extreme heat exposure, obviously climate change is also changing precipitation patterns, humidity, and climate in general. And that goes hand in hand with a change in the environmental conditions that make it suitable for infectious diseases to be transmitted. And one of the things that is really worrying is that diseases like dengue, that is the leading cause of serious illness and death in some Latin American and Asian countries, and which is one of the vector-borne diseases that is most rapidly spreading around the world, is becoming increasingly suitable for transmission as a result of changes that come in temperature, in humidity, that are generated by global climate change. And as you can see here, the Americas, the Western Pacific, areas that are particularly vulnerable and with very, very high incidence of this disease, are seeing the environmental conditions become more and more apt for their transmission, putting people at risk. Today, we have an estimated 100 to 400 million infections of dengue per year, and this is increasing very rapidly. In every one of the indicators that we're tracking at the Lancet Countdown, we track hours of safe physical activity as a result of the rising temperatures, heat-related mortality, lethality of extreme weather events, marine food security, sea level rise, crop yield potential, drought, wildfire incidents. In every single one of the indicators where we track the health impacts of climate change, trends are going up. We are giving a code red for a healthy future. And as the Director General of the UN, Antonio Guterres, said, quoting our report just recently, climate change will be the defining narrative of human health. And this is what we're tracking with standardized metrics. However, as I said, tackling climate change could also be the biggest global health opportunity of the century. And this is because with this risk of climate change, what we really need is for health systems to adapt and to build resilience to be able to cope with these multi-hit scenarios and with these multidimensional impacts of climate change. So what we're calling is for health systems to increase their resilience, their preparedness, and adapt to the changing climate. However, one of the things that particularly worries us is that we're seeing that countries are not responding as fast as we would need them to. What we measure here particularly is the extent to which countries are delivering on the international health regulations, particularly the implementation of the National Health Adaptation Frameworks that will help countries deal with health emergencies such as COVID, but also with the multi-hit scenarios and the increased health risk posed by climate change. And as you can see in this graphic, there's a very big difference between the level of implementation of the National Health Emergency Framework between countries with very high Human Development Index and the most vulnerable countries with low to medium Human Development Index. So climate change and the way we respond to climate change is amplifying the inequities between countries of different levels of human development, which is really concerning. So strengthening health systems could not only allow us to cope better with climate change, but also help us build resilience towards all types of health risks. Now, we also need to mitigate, and that's mainly why we're all here, or virtually here today. And there also we have an enormous opportunity for health if we do act together to rapidly respond and mitigate climate change. One of the key elements of fossil fuel burning is that they contribute to air pollution, and the WHO this year has made even more strict its air quality guidelines for very good reason. Exposure to PM2.5 air pollution, the very thin and most harmful ways of air pollution, are generating 3.3 million preventable deaths per year. And the interesting thing is one third of these are coming directly from fossil fuel burning, but they also come through things like transport, they come from agriculture, the burning of waste, all activities which contribute to greenhouse gas emissions and also contribute to damaging health through air pollution. Mitigating, rapidly acting to mitigate climate change could offer a huge opportunity in terms of preventing air pollution-related deaths. And when we look at our food systems, these are also a major source of greenhouse gas emissions, particularly cattle and ruminants. What you can see here in these kind of gray areas is greenhouse gas emissions that come from cattle products, meat and dairy. And what you can see here is the deaths that are associated to excess meat consumption. Almost 1 million deaths per year, we estimate, for 2017. So shifting towards more sustainable ways of producing food, shifting away from cattle and red meat production could also offer an enormous opportunity in terms of reduced deaths from red meat, as well as mitigating climate change and enabling a more sustainable food system. So it's incredibly important today, when we're here at COP, that we keep in mind that tackling climate change would offer the opportunity not only to enjoy economic and environmental sustainability, but also to transition towards better health and reduce inequities. So there's a win-win situation that we really need to grasp today. And this is why perhaps we're here talking about what health systems have to do and the role of health systems in this. Climate change is, above everything, a health crisis, a health problem. And health systems, as such, need to respond and be at the forefront of our response to climate change, because we need to deliver health without doing harm. And as Jody just mentioned, the healthcare sector contributes to around 9% of global greenhouse gas emissions. Through these emissions, they are contributing to the climate crisis, and they are contributing to damaging our health as a response. And not only that, we turn to health professionals because they are the ones that will show us how to live healthily, that will show us what a healthy lifestyle looks like. And as such, the healthcare professional has to lead the way in showing us how we need to transition to a low-carbon system, to more active travel, to more exposure to green space, to increase urban green space, to better and healthier diets, and above all, to tackling climate change for the health of our present and future generations. So with that, I'm just going to end, and I will invite you to look at the Lancet Countdown webpage at lancetcountdown.org, where you can see these metrics and many, many others, where we try to systematically track the health dimensions of climate change, and you can look at this on a country level with higher geographical resolution and what this means for your country in particular. Thank you. And I'm going to try to stop sharing.
Thank you, Dr. Romanello, for that outstanding talk. We will take our questions at the end. We'll try and leave as much time as possible. Without further ado, our next speaker, Dr. Matt Eckelman, is Associate Professor of Civil and Environmental Engineering at Northeastern University. He's an Adjunct Associate Professor at the Yale School of Public Health and has served as analytical consultant for the NHS Net Zero Project. He is also co-author on the report of the Lancet Countdown on Health and Climate Change. Without further ado, Dr. Matt Eckelman.
much, Shodi, and it's nice to be here with you all. You heard from Dr. Romanello about the Lancet Countdown's metrics and reporting around the effect of climate change on health. And at the very end, there was a slide about the effect of the healthcare system regarding its own greenhouse gas emissions. I'd like to give you a high-level view of that kind of carbon accounting, looking at carbon footprints of healthcare systems, digging down into what are the largest contributors to healthcare system emissions and how healthcare systems compare. So the NHS has been a leader in this area, doing healthcare carbon footprinting for more than a decade here. And its recent Delivering a Net Zero National Health Service report put together a nice framework looking across Scope 1, Scope 2, Scope 3 in the context of a health system. Scope 1 and Scope 2, of course, are possible to calculate based on on-site information about electricity use, information about fuel use that's burned on-site. These are relatively easy to track for hospitals and other healthcare facilities. Scope 3, on the other hand, includes all goods and services purchased by healthcare systems, which can be from a large variety of sources, a large variety of locations, millions of different types of goods and services. Is very difficult to track. And in general, Scope 3 reporting by healthcare systems has lagged behind, and we haven't had as much visibility about what are the large contributors to emissions overall, looking at this big picture. So I'd like to present an analytical framework, how this is typically tracked, and some of the work we've done to compare different healthcare systems. So starting with different goods and services that are used in healthcare, we take an economic modeling approach. We can look at economic models to find out where different purchases of goods and services come from that are feeding into healthcare, and looking all the way up the supply chain where those purchases come from, all the way back to raw material extraction, basic chemicals production, the basic manufacturing building blocks of our economy. And the trick here is to count up emissions that occur at each one of these steps using a framework called Environmentally Extended Input-Output Lifecycle Assessment. So we've employed this tool to look at different healthcare systems over time. This is some analysis for the United States, most recent work looking at the last 8 or so years of available data. And what we see first is that the trend has been, in general, up. There's two different countervailing trends happening here. One is that the background energy system is decarbonizing at the same time that expenditures for the healthcare system are increasing more than $3 trillion in the US currently. The other thing of note here is that Scope 1 and Scope 2 emissions, while important, aren't the majority. The majority of healthcare system emissions for the United States and for most of the other countries that we've looked at are Scope 3 emissions. And this tells us that if we want to have the healthcare sector decarbonize, we need to focus on purchased goods and services. We need to focus on using these inputs more efficiently. We also need to focus on partnerships with suppliers and decarbonization of the supply chain. You'll hear from other speakers about that. Using these tools, we can also dig into what sectors are contributing to the most. This is also a picture from the United States, and you can see food, pharmaceuticals and chemicals, transportation, other types of manufacturing of medical devices. These are all important sectors that are targets for partnerships and decarbonization. Even though, of course, we're at COP and the focus is on greenhouse gas emissions, I'd like to pick up on Dr. Romanello's important comment that there are many other types of air pollutants that are intertwined with greenhouse gas emissions, and we can use the same kind of analytical framework to count those as well. So what you're looking at here is a similar map, a contribution analysis of other types of emissions, emissions that cause cancer to humans, emissions that cause ecotoxicity, to ecosystems or ozone depletion. We use the same sorts of frameworks, and we can quantify the total emissions that occur as a result of all these other types of pollutants to air, water, and soil. An important metric that we try to use in this work is the impact on health. Of course, clinicians and other health professionals are focused on health metrics, rightly so. It's important to try to translate emissions and other types of environmental impacts into metrics around health as an important communication tool. So what we've done as part of this suite of work is to quantify the disability adjusted life years, the health damages associated with both greenhouse gases and the non-greenhouse gases, the other types of air, water, and soil pollutants that I mentioned. So, of course, the path that the climate will take is uncertain. There are different scenarios and different ways of doing accounting. But we know that there are certain contributions to health damages, such as malaria, malnutrition, diarrheal disease, and these will have different contributions depending on the scenario. Added up, if you look at both the non-greenhouse gas emissions impacts, mostly dominated by particulate matter emissions, and the greenhouse gas emissions, we're talking about several 100,000 disability-adjusted life years per year that are lost because of the healthcare system's impacts, the healthcare system's activities. So even though, of course, the focus is do no harm, we can see, in fact, that healthcare does have an attributable portion of healthcare damages, and this is an important realization. The last thing I want to note is that, of course, healthcare is a global industry like most other industries in our globalized world, and we can use similar models to track flows, the carbon and other emissions embodied in trade. And those are goods and services that are imported or exported by healthcare systems. This is the approach that we've taken in the Lancet Countdown. Myself and Dr. Sherman and others are working in this metric, indicator 3.6, around healthcare emissions. And we've been able to compare different countries. You can see here on the x-axis, different per capita healthcare greenhouse gas emissions by country, and this accounts for the trade that happens among countries. But it's important that we also consider the quality of healthcare that's being delivered. It's not really fair to compare greenhouse gas emissions when different countries have very different levels of healthcare services that are being delivered. Another version of the indicator 3.6 from 2 years ago in the Lancet Countdown report is comparing these per capita emissions against what's the Healthcare Access and Quality Index. And it shows a very similar pattern that you saw earlier for the Human Development Index, that there's a saturation effect. I'm based here in the US, and I'll give you a hint about what this circle over here on the far right is. What this tells us is that there are many healthcare systems that are achieving a high level of healthcare access and quality without such a high level of emissions. And this tells us that a low carbon emissions healthcare system is possible. So thank you very much for having me on the panel, and I'd like to turn it over to my fellow panelists.
Thank you, Dr. Eckelman. Again, for those of us who have joined us late, we will be taking questions at the end. Without further ado, I'd like to introduce Sarah Juanhan, who is Senior Net Zero Delivery Lead for the Greener NHS program team at NHS England and NHS Improvement. Within the team, she leads the delivery of the NHS Net Zero commitment across the supply chain, including medicines and food work streams and non-medicines. And she'll be speaking to us about the Greener NHS's program, sustainable strategy, and carbon accounting of the healthcare supply chain. Without further ado, Sarah.
Hi, everyone. Can you hear me?
Yes, we can.
Great. Can I have the first slide, please? So as you've heard already, the NHS has been one of the first systems to commit to a net zero target. So it stepped up last year in October 2020 to commit to 2 net zero targets. The first one was a net zero target for its direct emissions by 2040. So it's the scope 1 and 2 emissions that you saw on Matt's graphic. And then the other target is to reduce all of our emissions, including in our supply chain, for 2045, so net zero by 2045. That was a year ago in October 2020, and I really wanted to start this presentation with some good news, which is we're on track. So despite COVID, despite the last 18 months, we are on track to deliver on this net zero target. And by the end of the financial year, we will have delivered a bit over 1,200 kiloton CO2 reduction. Another thing, so this reduction is always difficult to measure and to analyze. We know that it's mostly coming from the NHS staff direct actions, also the government, like national action, and also some of the impact of COVID, and both in a positive and in a negative way. Speaking of COVID, I wanted to share another good news, which is that in a recent survey, we found that 9 out of 10 of our NHS staff think that the NHS should make a priority of tackling climate change. So it's not just a national ambition, it's an ambition that's shared by everyone in the NHS staff, and that gives us really a lot to hope for in the coming years. Next slide, please. So the thing I wanted to focus on today is the net zero supply chain, because this panel conversation is about standardized metrics, and this is really one topic where we need those standardized metrics. Next slide, please. So you can see on this diagram when we speak about the NHS supply chain, we speak about all of these blue area. So we speak about more than 60% of our carbon footprint. What is this made of? You can see a lot is made of medicines, so that's 20%, and there's an extra 5% at the point of use, and then medical and non-medical equipment, and other commissioned services. So you might know that the NHS commissioned services from other providers. So that's 60% of our overall carbon footprint. How do we plan to reduce this? Next slide, please. So this gives you an idea of how we plan to reduce these carbon emissions. Basically, when we speak about supply chain, we speak about demand and supply. So at the top of this waterfall chart, you see all these interventions which we expect will reduce carbon emissions by changing the way we consume goods and services. So an example that I'm sure you will all be quite familiar with is the moving away from single-use items, for example, to use reusable. And then we need to change the way also like supply works. So one way is to ask our suppliers to make their product more sustainable, so themselves move away from providing single use and then having more sustainable items. But then those two big green bars that you can see at the bottom of the chart is actually asking our suppliers to set as ambitious targets for themselves in terms of reaching net zero. And that's what those two bars at the bottom show, is that we will only reach net zero if our suppliers also reach that net zero at the same time. This can only be achieved with a partnership with our suppliers. And some of you might have heard yesterday, we had a panel conversation with some of our biggest suppliers in the UK Pavilion. And you've seen that some of these suppliers are already leading the way. They're already very ambitious in their own net zero target. Next slide, please. So what will this partnership actually look like? It looks like a set of milestones, a set of asks that we, the NHS, make of our suppliers. You can see here a roadmap that we've recently shared publicly to show what we will require of our suppliers in the coming years between now and 2030. This shows that gradually we're including more and more requirements of our suppliers to be able to qualify for NHS contract. Initially, we start with scope 1 and 2 emissions, and then we increase to scope 1 to 3. Initially, we start with like big contract, like high value contract, and then slowly we expand to all of our contracts. And the idea is that we are asking our suppliers to disclose their carbon emissions and also disclose their plan to reduce their carbon emissions. To do that, we need to have frameworks. We need to have those metrics that we've been speaking about with Matt and Marina, about how can suppliers disclose their carbon emission in a way that's meaningful and that we can then use. The other thing you might notice in 2028 is we plan to ask our suppliers to disclose information at product level. This is a bit more challenging because we really need to understand what we include in the scope of product level emission. And here again, we need to define frameworks to really make this information meaningful and usable in the future. Next slide, please. So this panel was not just about metrics. It was also about access and quality. And I thought I would flag that our first milestone in this roadmap is in next April, all of our tenders will include a 10% weighting on net zero and social value. And that's very important because in social value, there's not only net zero, but there's also equal opportunity. There's also like tackling economic inequality. And so we are also asking our suppliers to tell us what they will do to improve social value in each single contract they will deliver for us. And this picture was actually chosen really in purpose because when we speak about access, this is actually Sam, one of our supply chain manager in London. And you can see at that exact moment, she's getting a supply delivery from a boat in London. And so that reduces air pollution and at the same time improves access for vital supply like stents for patients. Next slide, please. And what do our suppliers think about all of this? So we've asked them, and actually most of them are either there. So some of them already have targets. Some of them already have targets aligned with our 2045 objective. And the majority of the ones who don't actually have a plan to have it in line with our expectations. So the feedback suggests that we're probably setting the bar at an ambitious but also realistic level. The other thing we heard in the feedback is that not all suppliers are the same. There's a wide diversity. When you have 80,000 suppliers like the National Health Service in England, there is of course a diversity in our supply chain. And so what we've heard is also that we need to adapt to different types of suppliers. And that's why for our small and medium enterprise suppliers and also for our voluntary sector suppliers, we're giving a 2-year grace period on the roadmap you've seen in the previous slides. Next slide, please. So we've spoken about metrics. How do we measure progress? Next slide, please. Matt gave us like a really good overview of those input-output modeling, which are based on spend. That gives us a really good grasp on how we're doing at the top line and how we're going to do in the next few years. Now, the problem is, how do you reconcile this with the very specific interventions you're doing on the ground? So when we work on working aid, refurbishment scheme, how do you link this very top line carbon reduction with actually how much carbon emissions you're reducing by refurbishing your working aid? And that's where really we need to be able to link this bottom-up approach, that's the sort of technical way of calling it, with this top-down approach to really be able to follow our progress and how we're doing. Next slide, please. So we're working on it. That's the key message. Like, we're adopting this continuous improvement approach. We're refining our indicators every year as we develop new interventions. And then we're also working with our suppliers to understand how we can measure change and how we can monitor progress within our supply chain. We're also looking at what's happening out there, and there are already organizations that are doing a fantastic job. So for example, this year, more than 200 of our suppliers declare their carbon emissions through CDP. And we are also looking at accreditation organizations like Science Based Target, EcoVadis, or B Corp. Next slide, please. Next slide. So I'm just going to finish with this. We've spoken a lot about supply chain, but again, this panel was not just about metrics, it was also about quality. And low carbon healthcare is good quality healthcare. So a key topic we're also working on is sustainable models of care. It's about providing the right care to the right patient at the right time and in the right care setting. It's about preventing rather than treating. And And it's really important when we speak about reducing carbon emissions that we also look at this whole pathway of care. And at the moment, we're working with some of our national programs to define a carbon calculator that will help those programs consider carbon emissions when they define their new models of care. And we're just at the beginning. At the moment, we're mostly considering activity. Is it in person? Is it remote? Is it in acute care setting? Is it in community health setting, in primary care? But the idea really is that this modeling approach will be more and more encompassing, so that really when we make decisions about how we deliver care, carbon can be a key criteria. Thank you.
Thank you, Sarah. Again, we will take questions at the end. Please feel free to start sharing them in the chat box. Without further ado, we'll move on to the final speaker of our panel, Dr. Andrew McNeil. Dr. McNeil is a surgeon at Vancouver General Hospital and a clinical associate professor at the University of British Columbia. She is the founder and principal investigator of the UBC Planetary Healthcare Lab, a novel interdisciplinary research collaborative dedicated to creating health systems that promote both human and planetary health. And she also serves as the medical director of the Planetary Health for Vancouver Coastal Health. Without further ado, Dr. McNeil.
Thank you, Jody. So my task today is to address the clinicians in the audience and in a very short period of time, convey the tremendous opportunity that we have as agents of change for planetary health. There are 44 million healthcare workers worldwide, and we're seeing a collective awakening to the immediacy of the climate and ecological emergency. Sorry, my slides aren't advancing. There we go. Our paradigm shift begins with an expanded duty of care from the individual patient to the public and to the planet, a concept that's beautifully encapsulated in this Lancet call for an updated Hippocratic oath for the Anthropocene. The literature describes 3 levels of social accountability in clinical care, and we've adapted that here to create a ladder of engagement for clinician action around climate and ecological health. The micro level refers to actions that individual clinicians can take in their day-to-day scope of practice. Meso-level actions occur at an institutional level, so usually a hospital or a health system, or within the local community that they serve. And then macro-level actions are undertaken by governments, professional societies, and regulatory and oversight bodies that have the capacity for sweeping top-down mandates across the health sector. Clinicians can influence all of these levels by adopting an advocate role or assuming leadership and administrative responsibilities within their organizations or professions. Now, Jody and I were co-authors on a framework for what we've termed planetary healthcare, which is our vision of low-carbon, high-quality, equitable healthcare delivery. And this was published in February in the Lancet Planetary Health, and it's represented by the infographic on the right. We then operationalized that framework for the individual clinician in the BMJ article that you see on the left, which was published in September. And you'll notice as I provide a few examples from this work today, that actions to mitigate the environmental footprint of healthcare almost invariably improve healthcare quality and equity. And the first thing to notice is that the framework includes both supply and demand side management strategies, because as you have heard from our previous speakers, we can't achieve net zero healthcare emissions with efficiency gains alone. We need an absolute reduction in the demand for health services, and that can only be accomplished by healthier populations. Healthcare only contributes to 20% of health and well-being. The remainder is the result of broader social, economic, ecological, and political determinants. So we need healthy public policies that modify these social determinants of health, such as is advanced by the WHO's Health in All Policies framework, that advocates for intersectoral decision-making that explicitly acknowledges the human health costs of policy decisions. Once you recognize that every healthcare activity has a footprint, you can readily appreciate that anything that reduces the incidence or severity of disease, thereby reducing the amount or intensity of care required, is a climate mitigation strategy. This requires robust public health and primary care structures to ensure universal access to preventive services and good chronic disease management. Our second operating principle of planetary healthcare is matching the supply of health services to demand, which means avoiding both overuse and underuse of healthcare. Underuse of necessary services like vaccinations or cancer screening leaves patients exposed to avoidable disease, whereas overuse of health services results in avoidable harms to patients, financial harms to health systems, and environmental harms. Inappropriate or low value care is characterized by care in which risks or harms outweigh the benefits, or care which will not influence clinical decision making or change outcomes. Globally, about 25% of health services are low value, and in the US alone, this carries an annual price tag of $100 billion. Appropriateness of care is a neglected dimension of healthcare quality, and it stems from both system factors, such as healthcare structures and funding, and from clinician and patient behaviors. System factors include things like inadequate primary, community, or long-term care services, such that patients are forced to use acute care services for conditions that could be managed in less resource-intensive environments. So if we think through our ladder of engagement for appropriate care, we can appreciate how practices that we associate with quality care, such as adhering to evidence-based guidelines or critically appraising the literature to be able to generalize it properly to our patient populations, are in fact climate mitigation actions. Similarly, avoiding technology or indication creep, where something that's shown to be beneficial in one circumstance is uncritically applied to other clinical scenarios. Shared decision-making refers to a process in which providers help situate evidence within patients' own worldviews, incorporating their values and preferences. Studies of shared decision-making suggest that 20% of elective procedures would be unwanted if patients had access to understandable, relevant clinical information. At an institutional level, care coordination avoids unnecessary duplication of tests by allowing, for example, sharing access to electronic medical records across health systems. This improves patient safety and it leads to better patient experiences. Electronic medical records can also encourage resource stewardship by applying stop dates, for example, to antibiotic orders or laboratory investigations. There's a documented human tendency to add choice and complexity but never take away, but de-adoption of low-value practices is an important aspect of appropriate care. Some hospitals have removed from formulary the inhaled anesthetic desflurane, for example, due to its outsized climate impact. And at a macro level, the most important driver of appropriate care is universal access. I'm still processing the knowledge that uninsured patients in the US can't access primary care services to manage their chronic conditions, but they are covered for hospital-based care once they suffer a catastrophic health event. This is a glaring supply and demand mismatch, and it's absolutely terrible for health outcomes. Codifying evidence-based best practices in clinical practice guidelines increases uptake, standardizes practice, and confers a degree of medical legal protection. The third operating principle of reducing emissions from the supply of health services captures the classical notions of sustainable healthcare, such as decarbonizing building energy supplies and electrifying transport fleets. And these things are important, but typically outside of the purview of the clinician. What is more within our scope are decisions around mode of care delivery, such as appropriate use of virtual care platforms. These not only eliminate patient travel miles and resource-intensive interactions with the system, but they're an important component of health equity in ensuring access to specialist care across geographies. When appropriately applied, virtual care has been shown to be more convenient and cost-effective for both patients and providers, both of which are dimensions of healthcare quality. Now, as you've heard, the majority of healthcare emissions arise from the supply chain, and this is largely the result of our current healthcare supply chains being reliant on single-use disposable devices. Single-use devices are an example of a linear economy in which products are manufactured, used once, and discarded. And the solution I would propose is a so-called circular economy in which materials are kept in circulation at their highest value application for as long as possible. This includes an emphasis on reduction, followed by a series of strategies from reuse to repurposing to eventual recycling. Multiple studies of single-use versus reusable products have shown several-fold higher petrochemical use, emissions, and solid waste with disposables. The circularity in healthcare requires thinking across silos, such as the notion of repurposing surgical gowns as non-sterile PPE once they're no longer fit for the high-level barrier protection required for surgery. A circular economy approach has also been shown to be more cost-effective, such as in this study that Jody and Matt did comparing reusable and disposable laryngeal mask airways. Not only did they show that reusables outperform disposables across every environmental impact category, but they also saved Yale New Haven Hospital $1 million a year. At an individual level, clinicians can address our disproportionate supply chain impacts by focusing on conservation of material resources, so not taking a whole stack of supplies into an isolation room, for example. We can select environmentally preferable options where choice and data exist, such as avoiding desflurane or using dry powdered inhalers instead of metered dose inhalers. And we can engage with industry to drive innovation toward circularity. Hospitals need progressive procurement policies that favor reusables, and as Sarah just described from the NHS, that mandate ambitious environmental commitments from manufacturers. Infection control practices must be evidence-based, as this is a primary driver of unnecessary single-use consumption. And institutions can apply rules and restrictions around the appropriate use of single-use consumables. At a macro level, embedding low-carbon best practices in clinical practice guidelines will be higher yield than educating for individual behavior change. Governments and regulators can introduce policies that mandate responsible resource use by both vendors and purchasers, such as Sarah just described. And healthcare structures like hospital accreditation and quality improvement frameworks can be updated to explicitly account for environmental impacts of care and recognize these as elements of patient safety and quality. So we began with an expanded duty of care, and we finished with an expanded notion of patient safety, quality, and equity. Practicing planetary healthcare is in no way additional to other paradigms of good clinical care, but rather it's synergistic with all of these in our collective pursuit of intergenerational health and well-being. Thank you.
Thank you, Dr. McNeil, and thank you to all our panelists. We do have some questions in the chat. I ask you to place your questions in the chat, and if we get through these, there may be opportunity for you to raise your hands and also offer questions if that's a preference. Let's start with, there are several along the theme of low middle income countries. And so as much as is possible, it would be nice if each of our panelists might comment on how their presentation, their work is felt by, affected by, limited by the current state of healthcare delivery in low middle income countries. Dr. Romanello, if we could start with you, that'd be great.
Yeah, absolutely. One of the things that particularly in this year's report we have really seen is that those countries that are already very vulnerable, those which have the lowest level of what we call the Human Development Index, which takes into account metrics of health and health delivery, are the ones that are being the most impacted by climate change risks, and particularly those that are being the slowest to perhaps adapt or deliver that institutional health adaptation response to climate risks. But at the same time, they're also the ones that are perhaps lagging behind in being able to decarbonize, to transition towards lower carbon economies, and to make the most out of the health co-benefits that come with that transition. So one thing that is really interesting and has really seeped through our data this year is that because of the excessive impacts on the most vulnerable populations, and because of that delayed response, it has become so much more important, so much more urgent that the least developed countries, the lower Human Development Index countries, are getting the support and are accelerating action to protect their people from climate hazards. Obviously, the health system, healthcare delivery is fundamental in delivering this, but the whole of the policy system needs to be adapting and responding to climate change hazards. One of the key issues here, one of the key items, is that in delivering that response, health needs to be considered at the center of all policies, whether it's a policy of infrastructure, of green space in urban areas, of decarbonization. Is really critical that the health system has a voice, has a say, and interacts really closely with the environmental departments and the urban planning departments to ensure that in all of those policies, climate change is protected and health is maximized. So there's a key role there for the health professional that goes a bit beyond what the kind of hospital or health setting per se might be, and can deliver enormous dividends for health of people.
Thank you, Dr. Romanella. I actually think that ties in very closely with what Dr. McNeil was telling us. And perhaps, Dr. McNeil, you could offer some further thoughts.
Yeah, thank you. I think that we can look to low and middle income countries for models of more efficient resource use. So I was quite struck by Matt's slide showing the degree to which the US is an outlier in terms of its health expenditures versus its health outcomes, and how it achieves potentially equivalent, in many cases, inferior health outcomes with many more times the expenditure than countries with lower health expenditures. So I think we can look to low and middle income countries for examples of more efficient resource use. They certainly, in many cases, have not bought into the myth of the need for a single-use dominated supply chain, but rather have demonstrated the safety and efficiency and resilience of a circular economy-based supply chain. It was interesting to see some high-income health systems, in particular in the US, operate under resource constraints for the first time during COVID, when supply shortages kind of imposed restrictions that those systems had never previously experienced. And this helped shape a little bit of a paradigm shift that I hope that will persist beyond the pandemic, so that we all recognize that we live on a planet of finite resources and need to operate as though we are resource constrained at all times.
Thank you, Dr. McNeil. Dr. Eckelman, understanding that there are challenges in data, and this could sort of tie in between low middle income data that we have, and what does ideal data look like? Perhaps you can tie those 2 points together for us.
Sure, thank you. So carbon accounting frameworks have lots of different forms. I showed some examples of top-down accounting frameworks used for carbon and pollutant emissions accounting. You saw a really great example in the NHS of a hybrid accounting method where they have both some bottom-up information and also some top-down estimates using this blend of data. And it's true that not all countries have the public health infrastructure or statistical infrastructure to do every kind of carbon accounting, including the top-down estimates that I showed earlier. But the important thing is to adapt some kind of carbon emissions accounting framework. And there are great examples of organizations rolling out carbon calculators and decarbonization planning frameworks to help healthcare systems in low and middle income countries to get started and to work in this area of carbon emissions accounting, both at the government level and also at the facility level. It's a flexible enough framework that even just getting started on scope 1 and scope 2 is possible given information that's readily available in pretty much any setting.
Thank you, Dr. Eckelman. Sarah, there's actually a lot of excitement and interest around the procurement policies that the NHS is developing, and tying that in again to these questions of low middle income countries. But in general, might you say, how might other nations participate in, model after, leverage our collective purchasing power together? What opportunity is there already for us to collaborate, and what further things would you like to see in terms of the international community coming together on this?
Thank you, Jody. Yeah, it is a global challenge, and it's probably like we need a global solution. So when we set requirements of our suppliers, they are global supplier. Like a lot of them are multinational companies, and it's very important that we collaborate with all other countries so that we make it feasible for suppliers. So you don't want the NHS to say, well, this is what we require from our suppliers in this framework, and then having other countries trying to do something completely different on a different timeline. So we're in that sense we're really open to collaborating, to share our work and how we got to the timeline we got to, the metrics we have. We are also doing some more specific work. So, for example, a month ago, we worked with an organization in England called Prescript to survey manufacturers of inhalers to ask them about the life cycle carbon emissions of inhalers. And this is something that is now publicly available on the Prescript website. So we are really keen to share this information and to push our suppliers to be as transparent as possible. And this is why when we require information from them, it's not just for them to give it to us, the NHS, but it's to make a public commitment in a carbon reduction plan that can also benefit other countries.
Thank you, Sarah. Dr. McNeil, would you care to delve in a little bit deeper on barriers to achieving the circular economy and how clinicians can help overcome these?
Sure. I think the number one barrier is the perception, or more accurately, misperception of improved safety with single-use devices. So this is a myth that has been very successfully propagated to a clinical audience and taken up by regulators and oversight bodies alike, such that there are now really deeply entrenched systemic factors that are driving single-use uptake, such as a preference for that by hospital creditors, for example, or ways in which the FDA makes it easier for manufacturers to bring to market single-use devices rather than reusables. So we need to tackle that at multiple levels. We do need clinicians to engage in advocate roles with the regulatory and oversight bodies. And individual clinicians to engage with their hospital leadership, and in particular with their hospital infection prevention and control partners, whom I would suggest are our most strategic allies in eventually arriving at evidence-based infection prevention practices that demonstrate the safety of reusables. The other part of the safety conversation is a perception of improved convenience with single-use items and of lower cost, both of which are only true if looked at through a very narrow lens. So single-use reliance allows hospitals to divest of infrastructure for inventory and reprocessing, and that may be more convenient under business as usual scenarios. But as we saw to a tragic extent during COVID, that system is susceptible to catastrophic disruption. And ultimately, PPE shortages led to the deaths of hundreds of healthcare workers because of that sort of reliance on single-use devices. Similarly, the perception of lower cost is only applicable over a very short time horizon. When you factor in the many more life cycles of reusables and avoided disposal costs and avoided environmental costs, they invariably come out as more cost-effective in all of the published studies to date. So we need clinicians to be undertaking those studies, to be engaging in quality improvement projects, and to be exercising their personal choice to drive demand for reusables in their individual hospital supply chains and then up throughout industry.
Thank you, Dr. McNeil. Dr. Eckelman, I think this taps into more of your background in chemical engineering in addition to the environmental engineering metrics you've just presented. But can you comment on how the pharmaceutical industry can work to make health systems more sustainable, make medicines more sustainable, and also how we might actually measure that?
Sure, thank you, Jody. So the pharmaceuticals and medicines were one of the largest contributors in the supply chain to healthcare system emissions. And this has to do with intensity, the energy intensity and carbon intensity of fine chemicals and pharmaceuticals manufacturing. It also has to do with the sheer quantity of drugs that are purchased and used. So the pharmaceutical industry itself has a history of collaboration, thinking about sustainability and thinking about efficiency. And this is an area where the allied field of green chemistry has really brought pharmaceutical manufacturers together to focus on improving yield, to focus on reducing the use of hazardous chemicals during processing, and to focus on improving the carbon emissions profile of manufacturing. And you see some very large pharmaceutical firms setting ambitious targets for their own carbon emissions reductions. So I was very glad to see the partnerships that Sarah talked about that NHS is taking, including with pharmaceutical suppliers. And they're a really important linchpin in this overall decarbonization effort.
Thank you, Dr. Eckelman. I think we have time for just one more question. I'd like to pose that to Dr. Romanello. How do you see the work of the Lancet Countdown expanding globally and how that can aid healthcare's response, since that's the subject of this panel? Thank you.
Thank you, Jody. One of the, I think, most crucial elements to what the Lancet Countdown does, what the tracking mechanisms do, is that it provides a view of how climate change is already affecting health and almost real time, so it's annual reporting mechanism to monitor how the transition to a lower carbon economy, lower carbon systems can provide benefits to health through those kind of health co-benefits and directly avoiding the impacts of climate change. It's very worth taking into account that there's many countries, there's many organizations that are producing metrics on climate change and health that are starting to monitor particularly kind of the health impacts of heat, of air pollution, and some of the key co-benefits. But these are some very, very few countries. The European Environment Agency has just set an observatory on climate change and health, for example. There's a few countries that are setting up their own observatories as well. But these metrics generally are not standardized. So what we are trying to know, what we're trying to provide is some benchmarking mechanism that will allow the world to monitor progress and keep ourselves accountable. One of the key elements of what we're trying to do at the moment is actually expanding our Lancet Countdown network and developing some regional and national centers that will start to produce data and monitoring mechanisms at much more geographical, high result level, and using as far as possible official metrics from health systems such that health professionals can also take this on board and compare with their own benchmarking mechanisms. But it's really important that beyond what we do from the Lancet Countdown, countries start collecting this data and start monitoring climate change as it pertains to health and what the opportunities look like and how efficient all of these climate change mitigating activities are in delivering benefits to health, because that will help us actually track and monitor and quantify that increased health benefits, that additional benefit of climate action that should be included in all of the policy considerations and all of the cost benefits assessments for any type of policy. The health elements will be crucial to it. So when we try to provide that at a global level, and we're trying to refine and provide much more locally relevant metrics, it's also crucially important that countries do start monitoring this and also help us build those indicators moving forward.
Thank you, Dr. Romanello. And that is the final word. This concludes our panel session today. And I'd like to thank all of our participants and our panelists. And we will be posting this for future viewing. Thank you very much.
Recording stopped. Okay, well, good evening, everyone, and welcome to today's event, Achieving Healthy Diets from Sustainable Blue Food Systems in Small Island Developing States. My name is Zitouni Uldada. I'm the Deputy Director of the Office of Climate Change, Biodiversity and Environment at FAO, and it's really my great pleasure to moderate this event today. The event is co-organized by the World Health Organization, the Stanford Center for Ocean Solutions, and the Center on Food Security and the Environment, UN Nutrition, and the EAT Foundation. And it is supported by Scaling Up Nutrition, the Organization of Africa, Caribbean and the Pacific States, and the World Fish. So thank you very much for joining us, and thank you to colleagues who are joining us online as well. It's nice to have you joining us virtually. What we would like to achieve from today's event is that you will hear from a number of speakers who will share with us their knowledge and innovative solutions around shifting to healthy, sustainable, and resilient diet, with a particular attention to aquatic foods and small island development states. So the SIDS are particularly relevant, obviously, in this context of vulnerability to climate change, and they serve as leading advocates for both local and global action to secure a healthy and more resilient future, and for diets that include sustainably sourced aquatic food from healthy oceans. So there was the WHO SIDS Summit of 28th to 29th of June this year, and it's really highlighted how essential it is for SIDS to ensure healthy, sustainable, and resilient food systems that focus on the preservation of biodiversity and deliver healthy diets. So our objectives really is to share the knowledge between the speakers and build awareness around the climate, food, health systems nexus. And it is really an important role of the Blue Systems for SIDS and the silent state of emergency they are in. So this is just to set the scene, and before we kick off, just to let you know, obviously this is a hybrid event. It will be recorded, and it will be available to record, to watch later on. For those joining us virtually, feel free to post your questions, and then if we have time for the panelists, then we will take them. And I see there are people obviously joining us physically in person as well. Think about any questions, any comments you would like to make, so you can join the conversation, and that would be with pleasure. So without much ado, it's really my great pleasure, and we're honored with the presence of the Minister Bruce Billiman, who will speak in a minute. But first of all, we will watch a short video by Her Excellency Helen Clark, who's the former Prime Minister of New Zealand and the administrator of UNDP. So let's watch this short message and then we'll kick off.
The Development Goals offered a vision of a world free of malnutrition, being gender equal, and living sustainably. The small island developing states are committing to creating healthy food environments, to fight the growing burden of non-communicable diseases on their peoples, and to adapt and mitigate climate change. We heard that loud and clear in the statements of the SIDS leaders at the United Nations Food Systems Summit, and I hope we hear it at COP26. The battle cry from the SIDS as they wrestle with the twin crises of climate change and non-communicable diseases is that we're not drowning, we are fighting. But to win that fight, the SIDS depend on action from countries everywhere. as they can't tackle the growing impact of climate change on their food systems and their health alone. Women must be empowered to lead and inspire on these issues. Around the world, we see women in leadership more likely to prioritize action on issues impacting on health and well-being. And we need to amplify the voice of SIDS and fora around the world. Their fight is our fight. We have to protect our planet's rich ocean ecosystems. Unsustainable and harmful fishing practices must end. We need food systems which deliver health and well-being rather than profit and calories. Those listening to this event today represent many different countries, but we all live in just one world with one destiny. We need the climate negotiators at COP26 to come up with more ambitious agreements and for decision makers around the world to act on those agreements. That way, and only that way, we can realize the vision of the SDGs and the goals of the Paris Climate Agreement. Thank you.
Thank you very much, Your Excellency Helen Clark, for that very nice and short and pertinent introduction, highlighting the role of empowering women for more leadership and action, and stressing the fact that food systems need to deliver health and well-being, and also that we live in one world with one destiny, and it's important that we aim to achieve the SDGs and the goals of the Paris Agreement. So thank you very much for that. So now it's really my great honor to invite in our Minister, Bruce Billeman, who is Minister of Health and Human Services from the Marshall Islands. Minister, over to you.
Thank you. And greetings, everyone. And I just want to begin by expressing my appreciation and gratitude for being able to take part in this very important talk. And I'm also honored to be here today to provide a short introductory statement. And for the past few days, I've been acting like a Minister of Environment, but I'm the Minister of Health for my country. And it's really fortunate for me to come here as a health minister because I can see the very importance of the connection of climate change to an healthy living. And healthy living in terms of as a human being, it's a very important component of our survival, our sustainability, and living in this planet. And I'm just thrilled and very honored to engage in this talk because it feels more comfortable for me as a health minister talking about healthy lifestyle, healthy selection, and of course, blue food and fishing. Like many other seats, my country of the Marshall Islands has a unique and codependent relationship with our ocean. Our marine ecosystem has been a central part of our way of life and our economy for generations. But as with many small island states, we face a number of challenges that make our country vulnerable to food insecurity. These include our limited land mass, our nuclear legacy, and the increasing impacts of climate change. All of these impacts have led to a high level of dependence on imported food, particularly processed food for our Marshallese population. Therefore, our government has promoted the need to find solutions that can shift our food system into a healthier and more sustainable path. This past September, we published the Marshall Islands Food Systems Pathway, which outlines ways to transform our food supply by 2030. Measures include ensuring that an ecosystem based on management approach to blue and green food production is integrated into all development plans. It also includes health education and awareness raising for our people, from levels of foods to lessons plans in schools. And as we are already implementing projects on the ground in this respect, for example, our lifestyle changes and climate resilient projects aims to strengthen community health by providing training in healthy cooking and gardening in two of our most vulnerable nations or atolls. And through a project with the World Health Organization, we are organizing an annual workshops to engage our high school students on issues like health and climate change. This is what the Marshall Islands is doing to tackle this challenge, and I look forward to hearing from today's distinguished panel about the innovative ways to promote healthy and sustainable food system in our small island states. Thank you, and kamultata.
Thank you very much, Your Excellency, and thank you for sharing with us the experience from the Marshall Islands. It's really nice to have a health minister here in this environment, as you said. We've been suffering for a long time from having just environment ministers really representing this, but climate change is not only an environmental issue, it's a health issue, it's a security issue as well. So it's really nice that you bring in your perspective from a health perspective to share with us. And thank you for highlighting the strong link between climate change and health, and also the special relationship in your community with the ocean and with the biodiversity of the ocean. And also the vulnerability to food systems and the need to find solutions for healthy, sustainable diet. So thank you very much for sharing that with you. It's a really pleasure having you with us. I know you're not going to be able to stay with us for long, but thank you very much.
Thank you.
I think we can applaud. Yeah. Thank you very much. I think I might need to stand up actually to see the panelists in Zoom, so just bear with me. So I can see everyone. So hello everyone joining us virtually. I'm sure you can hear me very well. We can see you very well. So welcome everyone. I just check that we have everyone in the list here. So I will welcome you all and then ask you one question each. And if you could please take 3 minutes to answer the question briefly. And hopefully we'll take some questions from the audience. And then if we have time, I'll ask you a second set of questions as well. So let me start with Francesco Branca. Hello, Francesco. So you're the director of the Department of Nutrition for Health and Food Safety at WHO. So let me give you the floor for 3 minutes, and if you can please share with us, the need to address the state of emergency by connecting healthy, sustainable diet and climate change. Over to you.
Well, thank you, and it's great to speak immediately after His Excellency, the Minister of Health in the Marshall Islands, because he really exemplified in his talk what Helen Clark was saying about the twin crisis about climate change and non-communicable diseases. The fact of the matter is that our global agriculture and food production systems are the single largest driver of nature and biodiversity loss. They are responsible for about one quarter of greenhouse gas emissions. They use up two-thirds of fresh water. They contaminate that water also with nitrogen and phosphorus fertilizer. They use up the land. And at the same time, this food system fail us because they are not responding to our nutrition needs, but are in fact responsible for a large proportion of people in the world who are affected by food insecurity, are responsible for 1/5 of global deaths, 11 million deaths for largely for non-communicable diseases. So the food systems are failing us, and making our diets healthy and sustainable would be a wonderful way to address those problems at the same time and really have a win-win for people and the planet. We can shift to sustainable, healthy diets, to diets that address all dimensions of individual health and well-being, prevent all forms of malnutrition, prevent non-communicable diseases, ensure safety of food, but at the same time that have low environmental pressure and impact, are accessible, affordable, safe, equitable, and culturally acceptable. Now, how do we do that? WHO has produced a special report on climate change and health for COP26, highlighting a series of very concrete actions to basically change with policies the food environment, the way we eat, by changing the way countries are investing in food systems and shifting away from harmful agricultural subsidies, but also making sure that this transition is equitable, it's just. We work with local communities, with indigenous community to afford sustainable diet. And finally, making sure that biodiversity is mainstream for nutrition and health. This requires collaboration. And WHO, together with UNICEF, FAO, and a number of partners, including the EAT Foundation, we're setting up a Healthy Diet Coalition as a follow-up to the UN Food System Summit. We can work together and make these policies a reality.
Well, thank you very much, Francesco, and it's good to hear about the Healthy Diet Coalition. Maybe we'll hear more about that from you later on. Let me now welcome Shakuntala Tilsted. It's really an honor to have you with us. You're the World Food Prize winner and global lead for nutrition and public health, World Fish. Over to you for 3 minutes. If you can share with us, please, the outcomes of the recommendations of the Blue Food Assessment.
Thank you so much for having me. The Blue Food Assessment is an international initiative that brings together over 100 scientists from more than 25 institutions. It is led by Stanford University and the Stockholm Resilience Center, and with EAT as a lead partner. The Blue Food Assessment team has spent the last 2 years gathering and analyzing data and evidence to support decision makers to implement solutions and evaluate synergies and trade-offs towards healthy, equitable, and sustainable aquatic food systems. Up to now, 5 peer-reviewed papers are published on subjects such as nutrition, environmental performance, climate change, small-scale fisheries and aquaculture, and demand of aquatic foods. And 4 more papers will be published in the near future. The evidence from the Blue Food Assessment papers suggests that aquatic foods have enormous potential to contribute towards achieving net zero climate goals. And at the same time, aquatic foods are superfoods, making vital contributions to nutrition and health, as well as livelihoods and incomes. And therefore, aquatic foods must be protected from the detrimental effects of climate change. Let me summarize 4 key findings from the Blue Food Assessment papers. 1. Aquatic foods, which are a vast range of diverse animals, plants, and microorganisms from both marine and inland waters play an essential role in creating healthier, low carbon, climate resilient food systems. The diversity in aquatic food systems, which includes the diversity of actors, production methods, and supply chains, can enhance food systems resilience and offer opportunities to explore synergies and navigate the trade offs on climate mitigation and adaptation. Next, aquatic foods have lower carbon footprint than terrestrial animal source foods. Diverse aquatic foods, including seaweeds and bivalves, have exceptionally low or negative greenhouse gas emissions, and their supplies can be increased to meet food and nutrition needs without increasing carbon emissions. Improvement in aquatic food systems, such as the use of low fuel gear in fisheries, can potentially reduce greenhouse gas emissions by 60%. Three, climate change creates significant risk to the nutritional, economic, and cultural contributions of aquatic foods, as we have heard before from the former speakers. Climate hazards threaten the productivity, the nutritional quality, and the food safety of aquatic foods, especially of captive fisheries in the oceans as well as in inland water bodies. And therefore, investments are needed to adapt and build resilience to ensure sustained aquatic food contributions in the face of climate change. And the last piece of finding I want to give from the Blue Foods Assessment is small scale actors produce most of the aquatic foods for human consumption, often with low emissions, and therefore enhancing their resilience and environmental performance requires tailored consideration and support. We know that more than 800 million people, many of whom are women, and with 90% in low and middle income countries, belong to this group. So we should you explicitly include this group when we are seeking to put climate policies in place so that the sector can get its full potential in mitigation and adaptation. Let me just give four short examples about how I think the decision makers at COP26.
Very short, please, so I can
Yeah.
move on to the other
Yeah.
speakers.
Okay, yeah. So one, we would like to see sustainable nature positive aquatic foods as a key part of nationally determined contributions. Two, to include aquatic foods ecosystems, infrastructure, workers, especially smallholders, and assets in the national adaptation plans. Three, mobilize climate mitigation and adaptation for financing aquatic foods and ensuring access for all small-scale workers. And four, work across agencies and build partnerships to maximize the potential of aquatic foods to reduce carbon emissions while supporting nutrition, livelihoods, and economies. So, as we've heard before, this link between climate and nutrition and health is extremely important. Thank you.
Great. Well, thank you very much for sharing with us those recommendations of the Blue Food Assessment. And thank you also for stressing the importance of thinking of the vulnerable groups in the policies and measures that we put in place. Thank you. Let me now bring in a voice of a youth leader and invite Narendra Andrimahela Fasan. Apologies if I misspelled your name, mispronounced your name. But over to you. Please share with us your perspective for nutrition, particularly for women and girls.
Thank you so much, and good evening, everyone. Thank you for having me today. It's great to be with you all at this event. So I am Narendra Andrimahela Fasan. I am a girl guide from Madagascar. So as you know, Madagascar is it's not so small, but it's a big island in the Indian Ocean. So we are We have all the ocean around us, and 80% of the Malagasy population are living from agriculture and fisheries. Yet, we still have a big rate of malnutrition, with 47% of stunting and 37% of girls still having anemias. So the cause of that is mostly, there are four causes of that. First is culture. So we still have these stereotypes where girls or women need to eat less than men or boys. The second reason is the lack of knowledge. So people don't know what is a healthy diet, what should they eat during the day. They just eat whatever is available for them. The third reason is food system. We don't have, I would say, we have a weak food system. So we produce a lot, yet we still are one of the country who has the highest rate of malnutrition in the world, where we produce a lot of food in the local and in the far. And the third reason is the environment, as we are a small island, so we are affected by a lot of natural disasters like cyclones, droughtness, or floods. So that causes a lot of problem on our nutrition. But mostly, so we have noticed that girls and women are the most affected by malnutrition. That's why the World Association of Girl Guides and Girl Scouts have introduced a program called Girl Powered Nutrition with the vision to for the healthy and well-nourished girls are able to reach their fullest potential and are empowered to take action to break the cycle of intergenerational cycle of malnutrition. The vision is that girls and adolescents are at a pivotal point in this life cycle. So if we can improve nutrition of girls and adolescents at this stage, then it can have an impact on women's and on professional level, on educational level, and on their reproductive capabilities. So what we do is we educate our members, we do community action, and we do advocacy action to the government and other decision makers. So it's not just about us learning about it or us changing our behaviors. It's all about us taking something out to the communities and fighting for a better nutrition for everyone. We don't just stop there, we also work with others. That's why Act for Food, Act for Change came. So we integrate those programs, those platforms, so we can speak out more because we want to change the food system from changing the girls and women nutrition first and then improving our food system. So what we are mostly asking is first to support us to educate more girls and more women because we can see the change as so far we have in Madagascar, for example, we have educated more than 12,000 girls who have actually reached more than 26,000 peers in their communities. So now more than 50,000 people know more about good nutrition, healthy diets. So that's what we ask is support us to educate more girls because if we educate more girls, more peers, more people in Madagascar will know more about good and healthy diet. The second thing is listen to young people because we don't have many spaces where we can speak out like this. So it's really great to have spaces where we can speak, where we can share our perspective. And that's what we fed also with Act for Food, Act for Change. The third is we are asking all the government, international NGOs, all UN that we should stop giving fish to people. We should give the hook because if we keep on giving fish, they will keep on asking fish there won't be any sustainable solution. But if we give the hook, people will think about what should they do, find a way to work on. Even if there is cyclone, they will find a way what they can eat. Even if they can go fishing, they will find a way on what they can do. So please stop giving fish, but let's all give hook. And the last is together for the environment. We can improve our environment. We can stop climate change because that is the one biggest causes of malnutrition here in Madagascar. Thank you.
Thank you very much, Narendra, for sharing with us your experience. And it's great you're doing all that training for education for girls. You know, good luck with that. And we definitely support you. And it's good that you're having this opportunity to voice that. And from what you said, you know, this is exactly what we like to support young people with, is to have a platform where they can actually do exactly as you did, share with us, and hopefully mobilize others to join you in that action beyond Madagascar, in Madagascar and beyond. So thank you very much for that. Let me now bring in Dr. Leslie Ramzami, who's advisor at the Ministry of Health in Guyana, who will give us his health perspective on the topic. Leslie, over to you for 3 minutes, please. We can't hear you.
Okay, thank you very much. Let me thank Dr. Branca, Dr. Shakuntala, and Narendra for setting the stage for me. I just want to add to what they've said, that the world food system has failed us, and just add these little things, that whilst we have a world still with too many hungry people, 30% of our food go to waste. At the same time, 33% of our agriculture soil is now degraded and cannot support food production, whilst another 33% are under stress. 32% of the global fishing grounds are overfished and cannot support the food system and support livelihood. And overall, corporate interest take precedent over the health of people, and some of the things that Dr. Branca mentioned. So there is no question that we desperately need to transform our world food system. And therefore, I want to address what we need to do and what we expect from COP26. We believe that COP26 must direct government around the world to include in their nationally determined contributions health goals, from disease preparedness for pestilence to better nutrition for better health. COP26 must join with the WHO and the FAO and other organizations for a robust global One Health agenda. Uh, Aligning its health and diet targets with other global fora, including the UN Biodiversity COP, the Stockholm Plus 50, etc. COP26 must direct all governments to advance national dietary guidelines that meaningfully integrate the blue food options, with aquaculture contributing significantly to a new food paradigm. COP26 must support a mechanism like the Framework Convention on Tobacco Control to regulate salt, sugar, and trans fat in our diets. And COP26 must align with Codex Alimentarius for front of the package labeling, highlighting unhealthy food aspects, making our citizens more aware and more educated. Ministers responsible for health, agriculture, the environment must meet annually to account for actions that support healthier food production and diets through the One Health agenda. And COP26 must support an increase in research for healthy dietary options to at least 1% of agriculture research funding from the present less than 0.01%. We need a special fund at the IMF to support research on healthier dietary options and for transformation of the world food system, similar to the Global Fund for HIV, TB, and malaria that was established after the 2001 UN General Assembly Special Session on HIV. I believe COP26 must support integration of findings such as the Harvard T.H. Chan School of Public Health study, which compiled nutrient profiles of 3,753 types of aquatic food, finding that on average, such blue food options are richer in certain nutrients than beef, lamb, chicken, or pork. We must therefore fight for the WHO's 10 recommendations relating to climate change and health at COP26, particularly the recommendation number 8 to promote healthy, sustainable, and resilient food systems. We must ensure that COP26 include these recommendations for individual countries in the sea. Thank you.
Okay, well, thank you very much for sharing with us your thoughts on the transformation of the food systems. And I liked your point about supporting the integration of findings. Before coming to COP, there was a number of other events being held as well, including the Food Systems Summit and COP15 on biodiversity, or at least first part of it. And it makes sense that many of those have raised the issue of nutrition and diet and also sustainability in addition to the link of climate change. So it would be good, as you said, really to join these dots at the COP and to strengthen awareness about the linkages between climate change and health. So thank you very much for that. Let me invite now Lorenzo Raplili, who's climate justice project officer at the Pacific Island Climate Action Network. Over to you.
Thank you very much for the opportunity. I will start off by saying Pacific leaders have unambiguously affirmed that climate change is the single greatest threat facing the Blue Pacific region. These words appear in the Pacific Islands Forum Leaders Boy Declaration, Kanaki Declaration, and the Pacific Leaders COP26 statement. The ecosystems and agroecological zones of Pacific Island countries are rich in terrestrial and marine biodiversity that should support sustainable diets for our island population. Yet, there are nearly 11 million people in the Pacific have the highest rates in the world of obesity and diabetes and other diet-related chronic diseases. All of the Pacific small island developing states are highly vulnerable to the various manifestations of climate change. The World Risk Index has placed my beautiful country, Vanuatu, as the #1 most disaster vulnerable nation on Earth again. Climate change is pushing us towards increased rates of diet-related disease, directly related to loss of food sovereignty and an increase in reliance on nutritionally poor food imports to make up for what climate fueled storms, extended droughts, and ocean acidification is causing. I am here today to bring you the demands of Pacific civil society that we can no longer accept COP negotiations that do not yield immediate and transformative outcomes for the people of the Pacific. Pacific Islands developing countries are remote and supply of protein highly depends on fishing, while food security has been a critical concern for non-communicable diseases like obesity. Exacerbated by the threat of climate change, food systems are under enormous pressure to continue to provide healthy diets. The 2021 Intergovernmental Panel on Climate Change IPCC Working Group report on islands paints a bleak picture for the food systems in the Pacific. Terrifyingly, the report on 1.5 degrees suggests that the majority, 70 to 90% of warm water tropical coral reefs that exist today will disappear. Even global warming is constrained to 1.5 degree. Very high confidence. Risk of impacts and decreasing food security are projected to become greater as global warming reaches beyond 1.5 degree, and both ocean warming and acidification increase with substantial substantial losses likely for coastal livelihood and industries. How do you expect us to survive? To eat when your emissions causing 90% of our coral reefs to die are coral-dependent fish, clams, crabs, snails. How dare you to come to argue over support for loss and damage when our healthy food supply is disappearing before our eyes? As a youth activist from Vanuatu, I stand here today to demand action at COP26 to address a climate crisis on the health of my people. Thank you very much.
Well, thank you very much. It's good to have another youth representative as well to share with that your perspective, particularly from that part of the world that is vulnerable to the impact of climate change. Thank you for that. And I did ask earlier the audience, if you would like to ask a question or make a comment. I've got my colleagues here helping me to monitor any questions online, which I can't see. But the audience here, if you would like to make any comments, in a brief comment, or ask a question to the panelists, you're welcome. There are mics here, so just put your hands up and you will be welcome to ask a question. Otherwise, do we have any questions from people online? So if you could please read that. And I don't expect all the panelists to respond to it because I might ask you another question. But if you feel like a question you want to answer, just raise your hand so I can see you. Thank you.
Thank you. We seem to have gotten 3 questions so far from our virtual audience. The first one is from Mary Purdy. What are your thoughts about the announcement of the recent partnership between the FAO and Bayer Crop Science, which produces many of the agrochemicals that are harming human health and the environment? I'm not sure if that's
I'm not sure who's that question to. I'm not sure if Francesco would want to take that. He highlighted something similar at the beginning. I can't see. Francesco, would you like to take that up?
Well, I'd like to comment on the collaboration and coalitions. I think we're in this together, and we need to work with many partners. But of course, we need to be careful with whom we partner, because we need to have adequate protection for conflict of interest. I think the collaboration with companies producing agrochemicals will require that we set very clear guidance on what is appropriate, what is allowed, and looking for solutions that allow improvement of productivity without harming the environment and without having the residues of those chemicals in our food. Codex Alimentarius is doing that, and so I think making sure that that guidance is fully implemented all over the world. I think that's what we need to do. We want to have food which is safely produced. We want to have good agricultural practices. But then, the partnership have to be built on solid grounds for avoiding conflict of interest and aiming at public benefit and public health goals.
Thank you very much. If there is one more quick question.
Yeah, there is 2 interesting comments about the importance of building coalitions across the health and agriculture and the kind of the blue food sectors. Comments along the lines of damage in one area spilling over and creating problems in the other, such as if you have agricultural wastes spilling into and undermining fisheries. If there are any perspectives in the panel about how to actually improve that coordination and that cooperation across sectors to tackle these issues.
Okay, thank you. Let me bring in Shakuntala. You mentioned trade-offs in your intervention. I wonder if you want to expand a little bit more on that, because this comment is related to the issue of trade-offs.
Well, um, you asked me about, well, let me start in another place. If we look at what we discussed at the UN, at the United Nations Food Systems Summit, and also now with the changes that are taking place in the one CGIAR. This is the international organizations that work with research on agriculture. We can see that there's a shift, and the shift is about the transformation of food, land, and water systems for healthy diets, for resilient diets, and in the climate crisis. So I do think that there's a greater understanding and a greater and better evidence on the table as to the trade-offs that what happens on land also affects what happens in water and vice versa. And if we would embrace this transformation that is holistic and takes into consideration a food systems framework that 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 has different entry points for solutions and different entry points for actions, I do think we will get further with our efforts. And this we have seen in the last 2 years with the United Nations Food System Summits, with the deliberations, the dialogues and meetings we have had, and the solutions that stem from that. My colleague Florence Egal made a comment in the chat about having agriculture and food and nutrition and health working together. This is so imperative that these sectors must work together, and this must happen at national level, at
Okay.
subnational level, and at global level. Thank you.
Okay, thank you very much. I just want to bring in Leslie, Narendra, and Lorenzo very briefly, because you all talked about the transformation needed, and you asked for actions. I just want to ask you very briefly, from your perspective, what are the actions that you would like to see happening in support of SIDS specifically? Let me start with you, Narendra, and please be brief so we can move to the conclusion.
So I would say, we are kind of victim, like we are in an island, but the solution is we all work together, no matter where we are from, no matter who you are, we have to work together in our field. Like, so for us, it's education, so we do educate. For the government, they are making policies, so we are advocating for that policies. But even if you are not living in seed, we are all responsible of climate change, so we are all the solution, so we must work together
Okay.
to achieve a better food system and to give good nutrition for everyone.
Okay, thank you. Lorenzo?
Thank you very much. From my end, to ensure a healthy future, small island developing states must allow their people to survive and strive by reducing global carbon emissions while also strengthening the, the resilience of health systems and health determining sectors such as food and nutrition, water and sanitation, and also social protection to protect and enhance the health and well-being of the people of small island developing states in the face of climate change. Thank you
Okay.
very much.
Thank you. Leslie? I need to unmute yourself.
Yes, let me quickly identify one area that I believe small island developing states and low and middle income countries can benefit, and that is the research being done at Harvard, at Stanford, in Stockholm Research Group need to reach these countries, not just reach them as recipient of the findings, but engage them in the research. And that's why I'm calling for an increase in research that is dedicated to the transformation of food system from the the shameful less than 0.01% to 1%. Research institutions in these countries need to build capacity. And I think if we do that, we could help in solving some of the problems, not only in climate change impacting food systems, but food systems impacting climate change, such
Okay.
as waste of food.
Great, thank you very much, and thank you to all the panelists. I'll just move on now to the conclusion, and we're really very pleased and very honored to have with us Ambassador Peter Thompson, who's the UN Special Envoy for Oceans, and is the best person really to give us a conclusion of this event. So I would like to invite you to join me, or probably better, so that everyone can see you.
Shall we? Yeah, or do I? Well, thanks very much. Sorry, I'll just get all my branding sorted. First of all, SDG 14. You know about that. That's the Sustainable Development Goal to conserve and sustainably manage the ocean's resources. And this branding here is produced by my grandchildren. And it says, I'm the grandfather of Grace, Mirabelle, Poppy, and Rosie. And they've put kids' rights now, and they've put on the back, never give up. I suggested to UNFCCC that every delegate coming into the blue zone should be required to wear a badge saying who they're the parent of or the grandparent of. Because this conference and the so many that we've been to over the years, what's it about? It's not about us. You know, we've lived our lives and we've done what we've done to the planet. But we are condemning this generation. These are my granddaughters, and Rosie there will be 80 years old when we get to the end of this century. And WMO says that's a world on fire. 3 degrees Celsius global warming. We just have to refuse that future. Okay, so, you know, that's why I say that we should take a mindset of this is all about the kids, it's not about us. So, having said that, you know, blue foods, aquatic foods, where does that fit into that picture? Well, it would be remiss of me to sit here and not say what my boss, the Secretary General of the United Nations, has said about the context of our times. Context of our times is that we have been waging a war against nature, and that it's time to make peace. Now, part of that peace process is obviously the food systems that we have. Because, you know, we know that the food systems have been one of the big contributors to climate change. Mainly what's happening terrestrially, but also and in the fishing industry. You know, all you have to do is think about bottom trawling and how that destroys carbon sequestration and marine ecosystems. So the findings of the UN food systems, and you know, I'd like to congratulate the members of the panel because many of them and some of the people in this room were responsible for aquatic foods making their mark at the UN Food Systems Summit, something that would not have happened if we hadn't got together and pushed for that, because we are, you know, we have terrestrial mindsets, us Homo sapiens, and that's why we've got into a lot of the trouble that we're in now. But we have to take the findings of the Food Summit, particularly in relation to aquatic foods, through now into implementation. And that includes keeping that whole mindset, the outcomes from the Food Summit on the international agenda. So when we go to Kunming in April for the biodiversity COP, we have to be talking about food systems in relation to biodiversity loss. And of course, I'm sure you all know that 70 to 90% of biodiversity, i.e. life, is hosted by the ocean. It's not on land. So we have to, of course, take that through all the various meetings that are happening between now and next June. But in June, we'll gather at the UN Ocean Conference in Lisbon, hosted by Portugal and Kenya on 27th of June to the 1st of July. And I can assure you that aquatic foods are going to be front and center on consideration there, because SDG 14, conserve and sustainably use the ocean's resources. what are the main resources we're concerned about here? It's actually seafood, nutrition from the sea. And increasingly, we have to think about new ways of getting our nutrition from the sea. We can't carry on like hunter-gatherers, depleting the ocean of its wild stock. It's just not a thing for us to do. That's the trap that Homo sapiens has been stuck in for so long, that we think that linear exploitation of finite planetary resources is somehow okay, that the production will just keep on coming. Well, of course, we know it's not. You run out of things if you exploit them too much. And FAO figures are that we're 34% overfishing the UN the global fish stocks. At the same time, human madness, the same governments, and that's all of us, we're the taxpayers that allow it to happen. The same governments that subsidize the fossil fuel industry to the level they do. I mean, is that some kind of human madness? It is. But that's those same governments are subsidizing industrial fishing fleets to go out and chase depleting stocks of fish. They're enabling the depletion of those fish stocks. So, of course, the future is, is getting smarter in everything we're doing. So for aquatic foods, it's getting into new food types. And I always say that food is fashion. I lived in Japan. I opened the Fiji embassy there in early 1980s. The world hadn't heard of sushi in those days. Look at it now. It's everywhere. The smell of Tokyo is the smell of seaweed. It's called dashi. That's the stock in all the Japanese soups and everything. That's just kelp in boiling water with a bit of shaved katsuobushi in it. That's the smell of Tokyo. So seaweed. The future is things like seaweed, non-fed aquaculture, shellfish. We will develop new kinds of food from the life in the ocean. As I mentioned, 70 to 90% of that is out there, mainly micro foods. We will start sustainable aquaculture with ethical foodstuffs for the finfish that we do still feed, but we'll select species which are appropriate for feeding. We won't stick top predators into closed off bits of lochs and fjords and so on, and feed them antibiotics and allow them to contaminate wild stock. That's not the future of aquaculture. The future of aquaculture is a much cleaner, greener approach with ethics and appropriateness of food and consumption being considered in the process, and not just dollars, which of course is the problem with that linear approach that humanity has had to much of our exploitation of the planet. We have to now start thinking in circular ways. Look, the best managed fish stock in the world in terms of tuna is in the Southwest Pacific. We've got something like 60% of the tuna is in our region, the Southwest Pacific. And for a country like Tuvalu or Kiribati, it's up to 90% of their foreign exchange comes from giving out licenses for tuna fishing. But it's very well managed. It's acknowledged as the best managed fish stock. But folks, the terrible thing is that nothing to do with us. It's all G20 GHG emissions heating up the atmosphere, that the conditions are changing in the Southwest Pacific. And there are now very clear scientific studies which show that of the 5 commercial species of tuna, the 3 of them, the 3 main ones, are all just going to leave the region this century. Again, in the lifetime of my granddaughter Rosie, she won't be able to go out and eat tuna the way I did when I was young in Fiji, because it's going across to the coast of South America and down south towards New Zealand, leaving our tropical Southwest Pacific. So these changes are underway. We've got to get smart. So obviously we don't just give up in the Southwest Pacific. We have to find what I was talking about before in terms of sustainable aquaculture, new forms of food from the sea. We have some great seaweeds in Fiji, lumi, nama, things the world doesn't even know about, but we've been eating them since forever. We just take those to the world like sushi was taken to the world. So anyway, I just want to close on an optimistic note, because people said to me, we know the ocean health is in decline, right? So how do you still be optimistic and hopeful and everything? What I say to them is, get some grandchildren, and you'll have to fight, you'll have to be hopeful, you have to come up with the solutions, because you're going to love them more than you love yourself. Okay, thank you.
Thank you very much, Peter, for the conclusion. It's really very pertinent, and I liked your introduction about who are we representing here? Our children, or are we representing our grandchildren? Because that links nicely with what you stress about the future getting smarter, and it has to be. Otherwise, it's not going to be sustainable. With the growing population and where our kids or grandchildren are going to be with regard to sustainable consumption. And I like the fact that you highlighted food is fashion. That's a really good one, because new forms of food, has to come from sea. There's many communities focusing only on a limited number of fish species, which there is an abundance of nutrition and protein in the sea that is there to be, to benefit from. So thank you very much for that. You set the scene really nicely in doing the conclusion, and hopefully this dialogue will continue. So thank you. It's a pleasure having you with us. Thanks a lot. Good evening. Thanks to all panelists and everyone who joined us virtually as well. Thank you.
Hello, hello. Can you hear me?
Yes, I can.
Wonderful. Okay. Thank you. Welcome, everyone. We're about to get started now. You may wish to put on your headphones for better sound because we will have virtual speakers. So we're going to go ahead and get started. Sorry about a little bit of a late start, inevitable by the end of the day. And thank you to all of you who have joined us at this point in the day. It'll be worth it, I promise. We have a really exciting session with some really interesting things to share. So I'm Jenny Miller, and I'm the Executive Director of the Global Climate and Health Alliance. And before we jump in, I just want to make sure that we have our virtual presenters connected. Milena, do we have our virtual presenters connected? Okay, fantastic. So the Global Climate and Health Alliance is an alliance of health organizations that have come together to be a voice for climate action because of the incredible threat that climate change poses to health and also the many opportunities for health from climate action. Just before we jump into the substance of today's session, a little bit of housekeeping. So some of our participants are in person. One of our panelists is in person. Thank you, Lourdes. And then we have a few folks joining us virtually. We have people who have joined the event via Zoom, and we also have people watching via live stream. So for those of you who have joined on Zoom, Spanish translation is available on Zoom. So if you go to the bottom of your screen and select the globe that says something about translation and click there, you can get the Spanish translation. So this session is focused on the Healthy NDC scorecard and incorporating health into countries' nationally determined contributions. So what is a nationally determined contribution? These are the national climate plans that every country that is a party to the UNFCCC is required to deliver under the Paris Agreement, making their own commitments for how they're going to reduce emissions in line with the Paris Agreement targets. Generally, they're required to include those mitigation goals. They also frequently include references to how a country is going to adapt to climate change as well. Those NDCs are required to be updated every 5 years. So the first round came out just after the Paris Agreement was agreed. Countries were to have updated them in 2020, but with the postponement of COP26, those updates to country NDCs have actually been mostly delivered this year. Although to date, not all countries have delivered their updated and enhanced NDCs. At this point, just over about 80% of countries have delivered those updated NDCs. And the idea behind updating the NDCs is that with each round, countries are meant to be more ambitious in reducing their emissions, be more ambitious in their climate action, until we get to the point where we're actually aligned with the Paris Agreement targets of limiting warming to below 2 degrees and ideally 1.5 degrees centigrade. Health and climate change are intrinsically linked, as I mentioned a moment ago. I don't think I probably need to explain that to anybody in the room here. But the threat that climate change poses to health, we're already seeing in countries around the world with the extreme wildfires, extreme storms, the droughts that are driving famine, all of these kinds of impacts that we in the health community are already seeing all around us in patients in the communities that we serve. But also, as I mentioned at the beginning, many of the actions to address climate change are oftentimes the things that I'm a public health professional things that we've been advocating for in public health to address health issues, reducing air pollution, making cities more walkable, making our food, healthy food, more accessible. Many of those things are things that we've already been advocating for, and they line up very nicely with climate action. So recognizing these links, bringing the health perspective into the climate conversation can be potentially really powerful. So we can both highlight the seriousness of this issue around something that is a shared human value, people's health. People care about their health. They care about their health of their children and their families even more often than their own health. So it's a shared human value that can unite people around climate action. We also have a good story to tell decision makers. We can go to decision makers and say, if you take climate action, particularly if you build health and equity into the policies that you choose and deliberately choose those that favor improving people's health, improving equity, then you can save lives. And not only that, you can save money. And the health cost savings can make a significant contribution to offsetting the cost of climate action. So because of all of that, this year GCHA undertook to analyze those nationally determined contributions. So we looked at all of the updated ones, not the original ones, but the ones that were updated and submitted last year and this year. And we analyzed how they did in terms of incorporating health into the NDC, the Nationally Determined Contribution, or that national climate commitment. So the NDCs that we reviewed cover, we looked at the 94 that have been submitted, and that's, I can't do the math in my head right now, but the EU submits a joint NDC, so one NDC for the EU, and then all the other country NDCs that have been submitted. So in this session, we're going to hear from a couple of, we'll hear from one country representative from a country that scored very well on the Healthy NDC scorecard. Unfortunately, the video that we have from the other country representative, the video quality and sound quality is not quite up to snuff to be able to hear well in this context. So we'll share what that country representative communicated, and that video will be available afterwards. And then we'll hear from a couple of, yes?
Can you use the telephone as a microphone as well so people in the Zoom meeting can hear?
Ah, okay. Just testing. Does this work for those of you on Zoom? Okay, good. We're having to do so many creative things to continue the work we need to do under pandemic conditions. But at the same time, it's been kind of extraordinary that we've been able to increase the reach of what we're doing globally by developing these kind of virtual and hybrid methods. So thank you to everyone for patience with the technological baubles. We'll hear from about two country examples, countries that have done a really excellent job at incorporating health. And then we'll do a deeper dive with a couple of folks that have thought very deeply about the NDCs and what they mean from health. And then we'll take some questions. So with that, I now have the great honor to turn to His Excellency, Dr. Luis Alexandro Moscoso, who is the Vice Minister of Public Health and Service Delivery of Colombia. Dr. Moscoso, could you please tell us more about the rationale for including health in Colombia's NDC in terms of health co-benefits, adaptation, or any other aspect, and also how the ministry was involved in shaping that NDC? Over to you, Dr. Moscoso. I believe you are on mute, sir. Could you unmute yourself? There we go.
Sí.
Bueno, un cordial saludo para la doctora Jenny Miller, directora ejecutiva de la Alianza Global para el Clima y la Salud, igualmente para el doctor Daniel Bush de la Organización Panamericana de Salud, también a la doctora Jessica Beagui de la Alianza Global para el Clima y la Salud, y para las doctoras Lourdes Sánchez y Patty Flom, y a todos los participantes que hoy nos acompañan en este importante evento. En esta breve intervención tengo el gusto de contarles la razón por la cual se decidió tener en cuenta
Disculpe un momento,
del NDC
señor.
de Colombia y cómo fue el proceso para llegar a estas dos metas de adaptación e incluir los cobeneficios sobre la salud a partir de la reducción de gases de efecto invernadero propuestas por el país para el año 2030. Primero, lo que quiero mencionar es que ya existe una evidencia científica importante frente a la relación de la viralidad y el cambio climático con la salud. Es así como la Organización Mundial de la Salud y el Panel Intergubernamental de Cambio Climático indican que el cambio climático tendrá efectos negativos y positivos sobre la salud humana, siendo de mayor magnitud los negativos. Y que además estos efectos pueden reflejarse de manera directa a través de la ocurrencia de fenómenos climáticos externos, como por ejemplo inundaciones, fenómenos de remoción en masa, huracanes, entre otros, los cuales han venido aumentando tanto en frecuencia como en intensidad en los últimos años. De otra parte, se encuentran los efectos indirectos generados por las variaciones en el clima medidas en décadas, que han logrado que los factores ambientales y que los ecosistemas cambien y con ello la distribución de algunas especies como insectos que transmiten enfermedades, como por ejemplo los vectores de dengue y malaria, o que se incrementen las infecciones de tipo respiratorio en algunos momentos del año, por mencionar algunas de ellas. De esta manera, al lograr entender estos impactos, el país decide incluir al sector salud en el proceso de actualización de la NDC, con el único fin de pensar a futuro en un sistema de salud con una mayor capacidad adaptativa y que pueda dar respuesta a estas inminentes variaciones del clima y a los efectos de la ocurrencia de los eventos climáticos externos que se presenten y seguirán presentándose en las diferentes regiones del país. Por eso decide establecer una meta dirigida a reducir la vulnerabilidad de las instituciones prestadoras de servicios de salud que permitan mantener la del servicio a pesar de la ocurrencia de eventos que se vea afectada su infraestructura ni todo lo que conlleva la prestación de servicios. Y por otro lado, se plantea una meta dirigida a prevenir el incremento de las enfermedades sensibles al clima por medio de acciones de promoción de la salud y prevención de la enfermedad y que puedan ser implementadas por todas las entidades territoriales bajo las orientaciones del Ministerio de Salud y Protección Social con el apoyo científico de nuestro Instituto Nacional de Salud. De igual forma, Colombia reconoce la necesidad de los cobeneficios en términos de salud asociados a las mejoras en la calidad del aire, que resultan de la implementación de medidas de mitigación de gases de efecto invernadero generados por otros sectores. Es así como se llevó a cabo un estudio nacional que estimó los beneficios en salud y económicos asociados a la pueden esperar de acuerdo a los escenarios de reducción de emisiones propuestas en la NDC por el país, desde sus metas de mitigación del año 2030. Debo decir que los de dicho estudio se presentarán en la COP26 como la primera experiencia de Latinoamérica y Colombia los ve positivo y como unas experiencias positivas para evaluar el futuro del ambiente. Por último, quiero resaltar que esto no fue un proceso en que participó solo el Ministerio de Salud, sino que las metas de adaptación son producto del trabajo conjunto con los Ministerios de Ambiente y Desarrollo Sostenibles, quienes acompañaron técnicamente todo el proceso y llevaron a cabo las diferentes sesiones durante 9 meses con todas las dependencias de nuestro ministerio para concretar las dos que se incluyeron en la NDC. De igual manera sucedió con el beneficio en donde la Organización Mundial de la Salud, la Organización Panamericana de la Salud y el Instituto del INFLE, al igual que el Ministerio del Ambiente, jugaron un papel fundamental en el desarrollo del estudio y la entrega de estos resultados. Con todo esto quiero decir que el Ministerio de Salud y Protección Social seguiremos trabajando para alcanzar las metas en la NDC y en lo posible ir visión, porque tenemos una responsabilidad no solo con nuestro sector, sino con el bienestar de la población. Muchas gracias.
Muchas gracias, doctor. Takeaways and good. So I apologize to those here in person. Many of you figured it out, but the text of what he had to say is printed and available. I think a key takeaway there is that the Ministry of Health was involved in the process of the development of the NDC. And if I understood correctly, it was through a 9-month process of working very closely with other ministries to really provide that health input that really was key to enabling that to be incorporated throughout. Thank you, Doctor Moscoso. No sé si va usted a quedar con nosotros para preguntas después o si usted necesita... de cualquier manera está bien, pero muchísimas gracias por su contribución. Okay. We thank Dr. Moscoso and thank Colombia for your leadership on this issue. So we now also get to hear about the experience of Cambodia, who also scored very high on the Healthy NDC scorecard. Unfortunately, the video message that Dr. Hero Cole, director of the Department of Preventive Medicine, Ministry of Health, Cambodia, sent, the sound quality was not great. And so what we're going to do is I'm going to read what his remarks would have been, and we will share the slides. So Dr. Cole speaks of how climate change will affect the fundamental determinants of human health. In 2010, Cambodia conducted a vulnerability and adaptation assessment describing the impact of climate change on health outcomes in Cambodia, which was supported by WHO. This revealed that the most major health impacts of climate change in Cambodia include vector-borne diseases, malaria and dengue, as well as food security, water and foodborne diseases, and the health consequences of extreme weather events. To respond to these threats, the ministry is working with partners and donors to include the Cambodia Climate Change, including the Cambodia Climate Change Alliance, the Asian Development Bank and the WHO, and the Global Environment Facility to train health professionals to manage these impacts and to develop guidelines to support rollout, expand surveillance systems, and ensure access to water and sanitation for health centers and communities. Much of this work has been done in small group of pilot provinces. The next slide, and I don't see the slides advancing. There we go. Okay. This next slide shows improved water and sanitation infrastructure of 25 health centers in Ratanakiri province. Expansion of this initiative to other provinces would be extremely valuable to ensure that health services can continue to provide care for the population in this country, which is currently highly vulnerable to the health impacts of climate change. The ministry is working to overcome challenges, including those related to the pandemic and other financial constraints, and in future plans to submit a proposal to expand climate and health adaptation to wider parts of the country. We were very impressed with the scores that both Colombia and Cambodia received on the Healthy NDC scorecard. They really have both taken to heart the integration of health throughout their climate commitments. And thank you so much to Dr. Moscoso and to Dr. Cole
for the scene setting for the rest of the session, and we're indebted to both for contributing your perspective on the work that you've done to incorporate health in the NDC. So now I'm going to turn to Jess Beagley, who will join us virtually. And Jess is the policy analyst with the Global Climate and Health Alliance and really spearheaded the work on the Healthy NDC scorecard. So now I'm turning over to you, Jess, to talk about the process of the scorecard and the findings and give us a little bit more of an insight into the Healthy NDC scorecard. Over to you, Jess.
Thank you so much, Jenny, and thank you to everyone for joining us today. We're so grateful to have you here. As Jenny said, I'm going to speak today about the Healthy NDC scorecard. And the first slide that I want to show just covers shows an overview of, I'm sorry, I'm just having some technical issues here. Here we go, sorry. So the first slide, Jen, if you're able to transition to that, I'd just like to cover the analytical framework that was developed in consultation with GCHA partners and collaborators who had previously worked on inclusion of health in the NDCs. There were 2 rounds of analysis and discussion where there was any difference in scoring between those 2 analysts and the final score. And you can see on the right-hand side of the slide, there's a bar chart if you'd like to view it in full online. It's too big for a slide, unfortunately. But it shows the health score, which is calculated by GCHA. And this covers 5 categories with a total of 15 points available, 3 points for each category. And these are health impacts, health in adaptation, health co-benefits, economics and finance, as well as bonus points for the overall detail and integration of health. Of course, health is not, inclusion of health in the NDC is not alone enough to protect health. So we're also interested in the level of climate ambition, and this is calculated by Climate Action Tracker, and you can see that on the right-hand side of the bar chart, indicated by those dots, and you can see it in full online. It's important to note that rather than including adaptation measures in their NDCs, many more economically developed countries have separate adaptation strategies and were therefore awarded a lower score for adaptation than would otherwise have been the case. Nevertheless, it's notable that despite the limited resources of many nations in the global south, low and middle income countries secured the top scores around the world. These countries have contributed least to the emissions responsible for climate change and are already experiencing the most severe health impacts. Jen, if we could have the next slide, please. Thank you. These are examples of the individual country scorecards. On the left-hand side of each scorecard, you can see the 5 health categories that we looked at and the score that was assigned for each. In the middle, the thermometer for countries where data from Climate Action Tracker is available. To talk through the details for Malawi and Australia, Malawi's NDC refers to health impacts, including vector-borne diseases, malnutrition, and exposure to extreme weather events. It also notes that the 2015 floods took the lives of over 100 people. Malawi plans to develop a national adaptation plan for health. Health co-benefits are identified from mitigation interventions in the transport sector and from clean cooking. Anticipated costs for interventions yielding health co-benefits are specified, and in addition to including a titled health paragraph, Malawi also integrates health throughout its NDC, including several mentions of health equity. The climate ambition of Malawi is not assessed by Climate Action Tracker, and that's why the thermometer is blank. Australia's NDC makes no mention of health-related considerations anywhere throughout, and it fails to align with the Paris Agreement. Despite claiming to be on track to meet and beat its 2030 target as set out in its 2016 NDC and experiencing devastating annual wildfires, Australia opted not to increase this insufficiently ambitious target to reduce greenhouse gas emissions, and this jeopardizes the health of the national population and also of people worldwide. This contributes to Australia's overall climate ambition score, which according to Climate Action Tracker is in line with 4 degrees of warming, which would be catastrophic for human health. If we move to the next slide, this shows an overview of the health scores around the world. And to talk through this in a bit more detail, Cambodia, Cape Verde, and Moldova received the highest joint score of all countries that were analysed, with 14 points out of an available 15. Costa Rica and Myanmar followed closely with a score of 13 points, and all NDCs which received over 10 points were in fact submitted by low and middle income countries, which bear the greatest burden of the health impacts of climate change. By contrast, 4 of the 9 countries with a score of 0 are high-income countries. And in other places, it's worth noting that there was a mismatch between the recognition of the health impacts and overall ambition, and this was really notable. The level of ambition in the NDCs submitted by Colombia, Argentina, Mexico, Vietnam, and the UAE do not necessarily all reflect the links between health and climate change in their NDC, although they have many other strengths. Climate ambition isn't shown on this map, but you can see the full bar chart online. Low scores were consistently received for economics and finance, which are essential considerations if commitments are to become reality. In lower middle income countries, international financing will be crucial for delivering measures to protect health. And that's all I have to say for now, but I look forward very much to the discussions and to answering any questions. Thank you very much.
Thank you so much, Jess. That was really excellent review of the Healthy NDC scorecard and how we got there. So now I would like to turn to a couple of speakers who will share with us and go into a bit more depth on different categories of health considerations and how they are included in the NDCs from different countries and regions. So I'm now delighted to introduce Dr. Daniel Bus, advisor in climate change and public health of the Pan American Health Organization, who will present on the inclusion of health adaptation measures and wider health considerations in NDCs from the Americas, and drawing on PAHO's recent report, Enhancing Health and Climate Change Commitments in Updated Nationally Determined Contributions. So Daniel, over to you.
Thank you very much, Jenny, Jazz, His Excellency, Vice Minister of Health of Colombia, and other colleagues joining this call. I'm delighted to be here. I'm just going to outline a few of these examples. Some of those examples that I'll use were extracted from this publication, Enhancing Health and Climate Change Commitments in Updated National in NDCs, which is the like a guidance document, if you will, from PAHO on how countries could enhance health and climate change considerations, but also do a brief analysis of where we were in terms of implementation of the first NDCs. It's a very short document. It's a technical note. We have a long report that is coming out soon as well. And just to outline a little bit on some of the things that I'll be speaking, this is one way that you could organize the health and climate change agenda. So addressing governance and institutional structures is key, and that's what one of the main topics that I want to refer here to you today, because those health participating in interministerial committees or even having intra-ministerial participation with multiple stakeholders is what would allow health to bring to the table health issues in the planning part and also in the financing programming of a country. So this is what we really want to highlight in this 5 minutes presentation on how having these structures would allow or not countries to include health considerations in the vulnerability and adaptation assessments on health, in the health national adaptation plans, in the NDCs, in national communications and other communications and other documents, and also on informing the programming part of a country with the GCF or other, or even its own investments. And the topics that both should serve as baselines for these planning and financing programs, and also the activities that the Ministry of Health could take and the vice minister very well positioned that as part of the integrating health and climate surveillance systems and having measured the health co-benefits part is crucial to understand where health and other sectors will interlink, but also on the carbon footprint of health infrastructure and services. And then, so not only measuring that, but also then using this baseline information to prepare plans and activities specifically to address those topics, but also on fostering research and building capacity within the country, not only within the health sector, but also in multi-sectors, so they can understand what's the health implications of climate change. So just to highlight some of these topics and to bring some specific data from the region of the Americas. So we did analysis, for example, on the percentage of countries with health representatives participating in the interministerial climate change committees, because we think that this is one of the key things that might explain even why some countries scored low or high in the NDC assessment that GCHA did. We have our own assessment of those documents, and we think that we see some progress. And I'm going to show you quickly just one or two examples of that. So in 2017, we had 24 out of 28 existing interministerial climate change committees had health seating there. 7 countries did not have committees at all. A very high percentage of countries in the Americas had health seating in those committees. And this number even increased in 2021. We still have 10 pending responses from member states here. 2 countries still reported that they don't have yet the climate change interministerial committees, but in all of them, they had health sitting at those committees to make the decisions, right? And part of it would be to include health considerations in the NDCs. So a high number of countries in the Americas, and with part of the work that PAHO is doing with the countries to position health in NDCs, we have a very high level of NDCs specifying health in the preamble, in the introduction part of the document, identifying health as key priority of vulnerable sector. So 86% in the first NDC in 2016-15, and 91% so far from the 23 NDCs that were submitted from countries of the Americas so far. And there's also a high percentage of countries who have reported at least one health action within their NDCs. Now, when it comes to having a section specific for health that has a proper diagnostic analysis and linking with specific group of actions on multi-topics, then we have less health representation in those documents. So we went up from 23 to 39 NDCs that had that incorporated in their documents. And we continue to work with them, like Colombia and some other countries who are the champions in this region, to make sure that we can advance with the incorporation of health considerations in the NDCs and implementation. So again, to me, it's key to have a governance and institutional structures in place to have empowered people within the ministries of health to be able to sit down with other sectors and then incorporate health actions in the NDCs and other documents. Maybe this is something that can explain, like I said, some of the results that were found in the NDC scorecard. And just to, if you are interested more on the topics that each country is addressing, we did launch the country profiles, PAHO WHO and UNFCCC. We have, so this year we published 10, and we are on track of publishing some 9 more countries of the Americas very soon with the country profiles. And there you can see the key recommendations that a country has decided, the health threats, the climate threats, associated with health, what are the health impacts of climate change in each country, and what is the vulnerability and adaptive capacity of health systems to respond to health. So I invite you also to take a look at those documents, but also to talk with us if you have any other questions. And just a teaser, Jenny, with another GCHA meeting on November 8th. So there we can explore a little bit more on not only the NDC, but also the MAPS, VNAs, and which topics are being identified by countries of the Americas as being priority for the work that PAHO is doing and other partners in the region. So thank you very much for having me today, and I'm here to wait for the discussion part. Thank you.
Thank you so much, Daniel. And you're doing my job for me. You're pitching our other event focused on the healthy NDCs. So on November 8th in the Euroclima Pavilion, we have a session that's focusing exclusively on the NDCs and healthy NDCs in Latin America. So thank you for that. And really valuable to have you kind of articulate what helped make possible the inclusion of health in these NDCs in Latin America. And it's really having health at the table and in dialogue with other ministries, other sectors, to really think that component through as the NDC and other policies are being developed. So thank you so much, Daniel Bus. Now I would like to turn to Lourdes Sanchez. Lourdes is Senior Policy Advisor and Lead in Indonesia, working in ISD's energy program. Her research focuses on the analysis of energy subsidies for electricity and fossil fuels, the evaluation and design of sustainable energy policies, and on developing communication strategies for energy subsidy reform. She's worked on projects in Mexico, Guinea, Indonesia, China, and India. And she will share with us work that she's been doing on health co-benefits of mitigation and adaptation in the energy sector. Over to you, Lourdes. And thanks for joining us in person.
It's a pleasure and an honor to be able to be in presence with you. And thank you, Jenny, and the rest of the team, as well as to the rest of panelists. So indeed, perfect. My presentation is there. So I'm going to be talking about how to include health and NDCs, considering the energy sector, or in general, energy policies. So next slide, please. I guess I need the microphone as well for the Zoom.
Oh, yes.
Sorry, next slide. Perfect, thank you. So as you know, the energy sector is actually the main cause, or one of the main causes of CO2 emissions. So those are data from the IEA. And you might remember the 40 gigatons CO2 emissions total by the IPCC in 2015. So if you can see there, the energy sector is responsible for more than 3/4 of those total emissions. And what we see there is also most of the use of energy. Well, it's because of fossil fuels, and to use that energy, normally you burn fossil fuels, and that produces air pollution. So that there's a very clear connection with health, as you can imagine from that. Next slide, please. So how we put that together with the health co-benefits, or how we estimate the health co-benefits, so that we can include or we can link energy and health in NDCs. So there are plenty of models out there that that bring for example, what is the impact of specific energy policies into, for example, CO2 emission reductions. This is an example from a model we have, the ISD is called the Global Subsidies Initiative Integrated Fiscal Model, and basically what this model does, it estimates, okay, if we take some measures, for example, on pricing of fossil fuels, like reform of subsidies to fossil fuels or carbon tax, and also invest into energy efficiency or renewables, we can reduce CO2 emissions. And next, please. And from there, actually, from those CO2 emissions, we can also get estimates of the corresponding air pollutants, so the reduction on air pollution based on all these policies. And from there, we can also have, there are already models that allow to estimate the physical and economic consequences for human health. So this is basically through this kind of circle or chain that how we can easily nowadays estimate the health co-benefits of any policy related to energy. Next slide, please. So I'm going to give two examples of work we have done in the past couple of years. So the first one is on China, and that was based on their previous NDC, so the one they submitted in 2015. And here what we saw is that, well, China had very clear NDC targets in order to reduce their emissions and the use of fossil fuels. They also had a series of very relevant policies that addressed air pollution, but also the fossil fuel consumption in order to reduce it and increase renewable energy, among others. And having that all together, we looked at models or studies that other people had done. In total, we looked at 6 of them, and they were pretty consistent in their outcomes. So basically, we realized that the estimate of deaths, premature deaths that could be avoided were very big, so over 225 or between 225,000 and 250,000 in 2050. Also that the co-benefits in terms of cost, they were significant, so they were depending on what had been considered. We saw it was between 18 billion US dollar and 700 billion in value of life savings. And in any case, all these models, what they agreed on is like the cost of implementing these policies was lower than the co-benefits achieved. So this is a very clear example that including health in the NDC will have been a very easy win because they had already the right targets and the right policies. And those were already leading to very positive co-benefits. Next slide, please. And the second and last example is from more recent work on Pakistan. And here the case was the other way around. So basically, if, we wanted to estimate the health co-benefits of different energy policies in order to raise ambition of the NDC. So as you can see there, we evaluated different scenarios considering different mix or different policies or situations for how electricity is produced, also electric vehicles, the standards for fuel consumption, but also pricing of fossil fuels, like again, fossil fuel subsidy reform and taxation. And with these scenarios, we model the related energy consumption, CO2 emissions, the pollutants, and impacts on health. I'm simplifying a lot, but those are kind of the main things that we looked at. And again, what were the results that we obtained? So we saw that compared to the scenario in which nothing happens, what we call in that report the NDC reference case, under the high ambition, so the highest ambition one that we consider, basically we could prevent around 65,000 premature deaths by year, or basically it's 1 in 8 of PM attributable mortality, in 2030, not by year. And also economic benefits of around 9 billion US dollar. And also considering that most of the deaths, a big part of the deaths that could be avoided, actually, they were infant deaths. Also, we realized that if we increase the current ambition to the higher ambition scenario, the results actually were doubling the lives that could be saved. So again, a case in which estimating the health co-benefits could really help raise ambition of an NDC. And last slide, please. Thank you. So just to summarize a couple of conclusions and recommendations. So basically, including health in NDCs, it can be a very easy win if the right policies and targets are already there, because again, models say that that can lead to significant co-benefits. But also it reinforces the need to meet NDC targets, because actually health, as you know probably more than anyone else, it's a very powerful argument. And also helps increase the ambition and brings closer relevant ministries that are involved in the process, a little bit like a doctor from Colombia was mentioning before. So that's very positive, and in more pragmatic terms, we can say that our recommendations is to adopt health in all policies approach to energy policy when developing NDCs, and also establish mechanisms that can facilitate the collaboration between mostly different ministries, but mostly health and energy professionals and ministries as well. And also another thing that we have seen through this work is that despite their data limitations, actually there are already many models and data there, even if they're international. And a framework to understand the linkages, however, is needed, so something that really brings all together and puts that clearly on how you can get from one thing to the other, as well as better quality data. But still, that should not discourage any kind of exercise, because these kind of high level, we can call it estimates, are better than no estimates. And that's it. Thank you.
Thank you so much, Lourdes. And I think those of us working on climate and health have been saying for a long time that climate action can deliver health co-benefits that help offset the cost of climate action, that deliver tremendous benefits to society. It's work like yours that helps us to quantify that enables us to actually tell that story in an evidence-based and powerful way. And I think we do, from health, have such a good story to tell about what it would mean if you truly incorporate health into all policies, incorporate health into your climate policies. It really is a win-win. It's not a trade-off. It's really a potential for a huge win-win. And those putting those kind of quantities and evidence base behind it really helps make that case. Okay, we have one more speaker, and after we hear from this speaker, we'll take questions from all of you, both virtually and here in person. So if you have questions, think about what those may be, and those of you who are online, please feel free to post your questions in the Q&A. Okay, so finally, our final speaker is Patty Fong. Patty is Program Director for Climate, Health, and Wellbeing at the Global Alliance for the Future of Food, a strategic alliance of philanthropic foundations working together and with others to transform global food systems now and for future generations, which has recently conducted an analysis of how food features in the NDCs. So with that, let me turn over to Patty Fong.
Thank you, Jenny. Thank you for the opportunity to speak here, even if it's only virtually. So as Jenny mentioned, I'll be focusing on the co-benefits of health with respect to food systems. So centering food systems transformation in climate action is critical to delivering on the interconnected goals, from tackling malnutrition in all its forms to protecting planetary health and upholding ecological integrity. Although there is growing attention to the connections between climate change and agriculture issues, relatively little focus has been placed so far on climate and food systems more broadly, even though the world's food systems are responsible for more than 1/3 of global greenhouse gas emissions. Food systems have significant adverse effects on climate change, and climate change impacts food systems in many complex ways. Taking a food systems approach results in a diversity of context-specific solutions for food production, distribution, consumption, and waste reduction. Next slide, please. So how well are countries doing with food systems thinking? We developed an assessment framework as a tool for policymakers and advocates to identify opportunities for better integrating food systems within the NDCs. We are applying the framework to the NDCs of 14 countries, of which 8 have been completed. And you can see here in this map that the 8 are in blue. We selected these 14 countries based on the geographical and economic balance, mitigation potential, adaptation needs, and food security concerns, and climate negotiating blocks. The analysis was based on the NDCs submitted, but they also consider broader key food systems policies. Each assessment was complemented by interviews with 5 to 10 in-country policymakers, advocates, and sectoral experts to better understand the challenges, ambitions, and needs. Next slide, please. We're planning to launch the full results early next year, but I can share with you today a couple of emerging insights from the first 8 countries assessed. On health co-benefits, we found that all assessed countries face nutritional and health-related challenges linked to food. Across France, Germany, the US, and the UK, obesity and overweight linked to unhealthy diets affect at least 40% of the population. These conditions are strongly linked to an increased risk of such non-communicable diseases as cardiovascular disease or type 2 diabetes. In comparison, Bangladesh, Colombia, Kenya, and Vanuatu mostly deal with the double burden of malnutrition, with part of the population considered overweight, while another significant part, predominantly children, suffer from undernourishment, micronutrient deficiencies, or stunted growth. Yet, none of the countries assessed explicitly included consultations with health and nutrition experts with respect to food systems. This is really a missed opportunity for ensuring that the NDCs maximize health co-benefits. A shift to sustainable and healthy diets can reduce the prevalence of obesity and overweight, as well as address undernourishment and food insecurity. And these benefits also imply reduced healthcare expenses and economic benefits. Next slide, please. On consumption and diet, we found that none of the NDCs NDCs assessed put forward an accounting methodology that considers the emissions reductions and removals from food systems in a systematic way. For example, the majority of countries assessed did not include measures to mitigate or adapt to climate change by shifting diets, with the exception of the UK, France, and Germany. None of the NDCs put forward measures to reduce the consumption of animal protein, especially in those countries with trends of overconsumption. And none of the countries assessed fully account for emissions associated with food imports, particularly those related to deforestation and the conversion of ecosystems. You probably have all heard the headlines, commitments by more than 100 countries committing to phasing out investments in deforestation risk commodities, yet this type of consideration is not yet included into the NDCs. I'll end by commenting on countries that are moving in the right direction. The EU has taken effort to build policy controls to achieve the interrelated policy objectives of mitigating climate change, shifting diets, and improving health. As part of the EU Green Deal, which seeks to make Europe climate neutral by 2050, the Farm to Fork strategy has been developed to address food production, transport, and waste, and make food systems across the EU fairer, more conducive to health, and more environmentally friendly. One of the primary targets of this strategy is to increase the agricultural land area devoted to organic farming from the current 7.5% to 25% in 2030. Another major cornerstone of the strategy is supporting global transitions towards sustainable food production and consumption through trade policies and international cooperation instruments. The strategy also seeks to improve the availability and price of sustainable foods and to promote healthy diets and sustainable consumption across the EU. The EU has also adopted its Beating Cancer Plan, which sets out a new EU-wide approach for cancer prevention and includes a campaign for promoting healthy diets and physical activity. At the member country level, Germany has made an explicit commitment to move away from harmful subsidies and promote sustainable food consumption via greater investments in research, use of pricing instruments, and dietary literacy. In France, the National Energy and Climate Plan mentions the intention to influence food demand and consumption through its National Food Nutrition Program. Before I move on, I just want to acknowledge that we also assessed Colombia's NDC from a food systems perspective. And because the Vice Minister for Health spoke, I just want to really congratulate their work in this area, because of the NDC that we did assess, theirs was the most inclusive and democratic process for developing their NDCs in terms of how they engage with grassroots communities, engaged across ministries, and engaged with the private sector. And as Daniel mentioned, that governance is really key to a good NDC that is implementable and that is co-owned by all in terms of taking it forward. And I'll just mention that Colombia, of the ones we assessed, put forward the most ambitious set of agroecological measures. So they weren't only just great on health, they were great on agroecology and agricultural production. Last slide, please. So you can find more about our emerging insights on this link here. We'll be launching the final results early next year. Thank you very much, and back over to you, Jenny.
And it's really fantastic to hear about your work. Patty reached out to GCHA to tell us about the research that they'd been doing and the analysis that they'd been doing when we came out with our Healthy NDC scorecard. And so we've had the opportunity to learn about the kind of deeper dive on food and food systems. And it's just really, really excellent work. So thank you so much for that. Okay, we've now heard from a number of folks about NDCs, and I'd like to open it up for questions. Does anybody, I'm looking around the room, yeah. Yeah, just speak, project loudly. Hang on a second, we'll get you a microphone.
I think it's representing mental health in some capacity and working with the Royal College of Psychiatry. I'm interested in this idea of co-benefits in terms of not only mitigating climate change, but building back better. And given the kind of growing understanding of the burden of mental health, although there are difficulties with quantifying, and I think that's one of the major barriers, do you have any thoughts about also presenting that as an additional opportunity, but also it didn't come through clearly in what was been spoken about on the emphasis of well-being, and not simply, I think, having a significant lifespan removed of illness, but one actually that's fulfilling. And I'm wondering if there's any thought or work going into trying to build up a more comprehensive, holistic vision of health, and whether or not mental health is something that can be looked at or is considered at all in any of these analyses.
Yeah, thank you for that really important question. So just to encapsulate so that those online can get the question. So the question was about thinking about mental health and to what extent whether mental health has been considered when in these looks at the NDCs, whether there's the potential to think about mental health in the context of the NDCs, and also to kind of broaden the frame from just protecting health to actually thinking about well-being and kind of a better future and one that really has robust well-being. Do any of our speakers want to take a crack at that? Jess, it looks like you might have a bit of a response.
So when we were doing the analysis for the Healthy NDC scorecard, mental health would absolutely have been allocated a point on our scoring framework under health impacts, as well as considering if the context of mental health was to do with reforestation and ensuring that there was green space in cities and mental health and well-being associated co-benefits of that, then that would get a score under co-benefits as well.
Lourdes?
Yeah, maybe I can add briefly about the modeling part. Indeed, I think there's a huge opportunity, but as you say, the problem is how to quantify that, no? So yeah, I think there's definitely an opportunity, and we're actually developing a framework, a health and economic framework, to kind of think broader on how to link everything, and that's one of the things. I mean, definitely something to include, but the risk when we're estimating things is like to find data, but any idea is more than welcome, so I will be very happy to hear about that. Thank you.
Yeah, and Daniel, did in your work on NDCs, has mental health come into it at all in the work that you've been doing in Latin America on this?
Yeah, no, thanks for the opportunity to comment on that. Certainly, and it's a growing concern by ministers of health. So when you think of hurricanes, for example, in the Caribbean and Central America and the south of North America, or the loss of productivity or loss of crops, and all these processes having to or producing forced displacements, this is something that mental health has a very, very important role to play there. We do have one project in the Caribbean that is currently being funded by European Union that we do have a specific look into this topic. And also another thing that I would like to raise, maybe it's not very common to hear about that, but among the young people in the Caribbean, when we ask about climate change, most people say that they feel hopeless about the future when they start hearing about climate change. So I think that our messages focus so much on the impacts of climate change that is driving people away from coming together with us to find solutions to the problem. And that seems to be such an overwhelming topic, especially in small island developing states who are threatened even their own existence because of sea level rise and other climate-related issues, that this is freezing the response instead of stimulating response, especially among young people. So that's one of the things that we've been investing on understanding better and working on specifically in the Caribbean, but also throughout the Americas as another aspect related with mental health.
Yeah, thank you.
Thank you.
Great question. So I have a question now for Patty Fong. So it seems pretty clear the role that the health community and health professionals can play when it comes to kind of diets and consumption, and advising people about healthier diets that are also more sustainable. But what is the connection between the with the health community with respect to the production side of the equation? Is there any role that the health actors can play on the production side?
Thank you, Jenny, for that question. Actually, if you consider health along the whole food system and you think about production, think about how it's produced, right? So from farm workers and the exposure to pesticides and herbicides to food processing. I mean, you heard through COVID, frontline workers, people working in meat packing plants and their exposure. You also can think about food safety in terms of just contamination that takes place through food. So, and all of this really comes down to this industrialization of food systems, which is not in itself bad, but this focus on kind of monoculture, this focus on yield and productivity de-emphasizes the importance of health. And in fact, health and nutrition need to be at the center of food systems rather than yield and productivity. But if you look at what's happening policy-wise, the subsidies that are taking place that are supporting the type of farming practices that are in place, it's actually supporting productivity and not supporting health outcomes. So we really need to think about the shift in narratives in order to have change those types of policies that are underpinning the current food system. And health actors have a really important role to play because they can talk about the health impacts and the need to shift our food systems as a form of preventative health. And I just want to make just another point on the question about mental health. So just taking the NDC assessment for Colombia as a really interesting example. So they quantified all types of co-benefits. And one of the co-benefits they quantified was actually around peace building. So the dialogue process that took place in order to develop their NDCs led to better support and basically, positive impacts around peace building, which basically in and of itself is a health co-benefit. If you think about the number of lives that are lost due to all the conflict that's happened over the years, as well as the mental health of communities. So I just wanted to really make that point, to think really broadly about how we are considering those direct and indirect impacts on health.
Yeah, thank you for that addition to the mental health conversation as well. Okay, I'm going to take one more question because I know we're running out of time here. But Lourdes, if a country that wants to do the assessment of health co-benefits doesn't have robust national data, is it still worth it to do modeling, or should they just base their estimates on what other countries have done? What happens when a country just doesn't have that national data that you would like to work with?
So definitely it's worth to do that, even if national data are not as robust as could be in some other countries. I mean, international data are normally there. So, all the international organizations, they produce data on most of the parameters actually that at least we have been using so far. Otherwise, even some projections based on discussions with, experts, local experts, etc. And one thing that we shouldn't forget is we have the SDGs that sooner or later are going to start to be there. So that's also, one reminder, it's the importance of having robust SDG or taking the SDG reporting seriously. But anyway, so to say that even if they don't have data, the national data that are robust at the time is still definitely worth doing, because even a kind of more, let's say, less, it's not less scientific, but it's less precise estimate is definitely going to give some idea of how the trends are and what the impacts of specific policies are. So yeah, they should take international data or some kind of approximations based on experts' estimates. Yeah. Thank you.
Great, thank you, Lourdes. Well, just to sort of sum up a bit, I think one of the big takeaways from this session is, we know that the nationally determined contributions are commitments. It's not the same as action. It's not even the same as like national policies. But through the process of engaging with them and engaging in a way to build health into them, you kind of build the engagement that then can bring about the relationships, the commitment, the investment in turning these into something real. And so this process of thinking about the NDCs as an opportunity for us to embed health and well-being into those national commitments, the process by which we would do that most effectively also starts to build in the possibility of its implementation. So I want to thank all of you for sticking around late at the end of the day to hear this session. I want to give a great thanks to our presenters and our speakers for taking the time today to speak with us about this issue. And I also am just so thrilled to see such a health presence at this COP. Climate change is unquestionably a health issue. I think it's on our shoulders to make that case and to articulate for those who are working on climate change so deeply how we want health to be built in and why it should be built in and why everyone, not just the health community, but why everyone will benefit if that happens. So thank you to all of you, and especially thank you to our speakers and presenters for this wonderful session.
Thank you.